Welcome to the Startup Health Festival. I'm Logan Plaster, the editor of Startup Health magazine, and I could not be more excited to be welcoming you into the festival via the Startup Health studio.
Yeah.
I'm joined here by Paulina Hannon, the portfolio director, and we are kind of inviting you in behind the scenes as we get ready for an official 10 a.m. Pacific launch of a live cast. We'll be starting promptly at 10.
Yes, we will.
And with Victor Panev from Edamame.
So
and
excited.
that's just in
how
7
many?
minutes.
7 minutes.
So Paulina, what are you excited about for today?
There are so many things to be excited about. We actually just finished a wonderful get-together and breakfast of all of our health transformers who are in attendance here at the Startup Health Festival. There were, I think, over 100 health transformers who were attending, and what was so great is to see entrepreneurs who've been in Startup Health since 2012 and entrepreneurs who literally joined a few days ago, all getting together, getting to know one another, sharing their moonshots and their achievements and what they're looking forward to. So I'm just riding on that kind of energy.
So why do we call them, hey?
Just wanted to say hi. Welcome to all the people watching on live stream. My name's Unity Stokes. We are grateful to have you join us today. We're going to be broadcasting for the next several hours, today and tomorrow. Paulina, we love you. Logan, we love you. Welcome to the Startup Health Festival. Ciao.
You heard it there.
Yeah.
We're going to be broadcasting live for 2 days. You can watch both live streams at startuphealth.com. We'll be broadcasting live the Health Moonshot stage, which is going on upstairs. And then down here, we'll be interviewing more than 100 of the world's top health entrepreneurs.
Yes. I'm so excited that there's 2 different channels that people can tune into. So whether you're looking for slightly more in-depth discussions with industry leaders or health transformers who are going to be sharing their founder stories, you can tune into what's going on the Health Moonshot stage. And then you can tune into what's happening on Startup Health TV with over, I think you said 100 interviews, right? 100 is short but really impactful interviews of what entrepreneurs are up to, their progress on their moonshots, what they've achieved over the last year and what they're looking forward to over the next year. It's just going to be a really, really exciting 2 days.
Who are you excited about? Who's going to be on the main stage, on the Health Moonshot stage this morning?
I am very excited for a great panel that we are doing on diagnostics and how diagnostics are broadening access to care. It's just such an interesting perspective to be able to take that goes beyond what we may understand and know about access, and really starting to think about how devices are starting to bring diagnostics literally to the palm of people's hands. So that is going to be moderated by Peter Layden, and it's going to feature 3 of our health transformers.
All right, Peter Layden of Wired.
Yes.
Yeah. And he's just one of the smartest, coolest guys who can moderate a panel. So excited to have him here with us, and so much going on. You can join our conversation as we're here at the Startup Health Festival. You can tweet us at Startup Health. You can use the hashtag Startup Health. Really the theme of this whole festival and issue 5 of the magazine is collaboration.
Yes.
And so one way to do that is through social media.
Yeah, exactly. On the collaboration front, what I'm really excited about is to be able to share the partner stories that are happening between health transformers. So a couple of our health transformers over the course of the next 2 days are going to be bringing on either their customers on stage, or some are actually going to be bringing their patient champions on stage with them. We actually have our youngest person on tomorrow, a 4-month-old kiddo named Aiden, who's going to be joining us on stage tomorrow as the product of one of the wonderful solutions that Baby Scripts has launched. And I think
the child is the product.
The child is the product.
Of the
is
startup.
the product of the startup. Correct. What I'm
successful launch.
Yes, really. A 4-month. I wouldn't say alpha test or beta test. Commercialization of the technology. What I'm really excited about is actually sharing these patient stories, because it's so important that we all really get together and go beyond the business models and what's working and what's not working on business to business side, and really just start to think about what's happening to all of us as patients, as consumers, as people, and bringing patients and some of these unheard voices onto the Moonshot stage is absolutely critical. So I'm really proud of that for this year.
Awesome. All right. We are going to be broadcasting live for 2 full days, starting at 10 a.m. Pacific today, which is in just a few moments. We're going to be kicking off our first interview, and we'll be running all day until about 5 p.m. Pacific, and then starting again tomorrow at 9 a.m. Pacific. So we hope that you'll join us for the live stream for both channels. You can watch them at startuphealth.com, and you can learn everything you need to know about any of the people that we interview on the site. Yeah, and you can join the conversation through social media. So tweet us at Startup Health and use the hashtag Startup Health. Pretty easy.
Yeah, easy to remember.
Easy to remember.
Yeah, Startup Health.
Yes.
Startup Health Festival, hashtag Startup Health, at Startup Health. Pretty easy to remember.
Yes, pretty easy to remember.
Yeah.
We're here in San Francisco at the Startup Health Festival in conjunction with the JP Morgan Festival. So if you're watching this live stream and you're in San Francisco, come on by.
Yeah.
Maybe
Stop by if you're part of the industry and want to be part of the celebration that we have here. Would love to see you. But if you're not and you're not in San Francisco at the moment, hopefully you're tuning in.
Yeah.
We're super excited.
I think that we are almost ready for our I'm Logan Plaster. I'm the editor of Startup Health magazine, and I couldn't be more excited to be inviting you into the Startup Health Festival. I'm here in the Startup Health studio, and we are going to be broadcasting live for 2 full days as we interview about 100 of the world's top health entrepreneurs. I'm excited to be kicking off today's interviews with Victor Panev, founder and CEO of Edamame. Come on, Victor, take a seat. I have here that you're creating a platform to supply the world with the food data they need to eat healthier and live longer.
That's more or less it.
Exactly. Fantastic to have you. So as you know, at Startup Health, we like to start with the big picture, with the why. So we like to understand what is the big audacious goal that you're going after. So what's your health moonshot at Edamame?
Look, it's very simple, but I'm going to give a little bit of a context. We believe that food is medicine, the ultimate medicine, and we believe that if people eat right, they can live long, healthy lives without chronic conditions, without mental illness. So the health moonshot is help everybody on the planet live to 120 without ever getting sick, without having mental illness, without any chronic conditions. That's it.
Sounds good.
Yeah.
I mean, who can
Very
argue
doable.
with that? Okay,
Very
so
doable.
what are you building? How are you doing that?
Well, so we realized that one of the big problems, people want to be healthy, they want to make the right food choices, but the data is not organized in a way that they can actually make those choices. It's controversial, there's so many fads and whatnot. So we set up to organize the world's food knowledge.
Okay.
And give it back to people so they make the right choices. So what we're building is the biggest food knowledge base that exists out there, with all the tools for meal recommendations, nutrition analysis that are able to help people make those right food choices.
Okay, so you're making a food database. Are you selling that into businesses or to consumers?
We're selling it to businesses. We think that to have the most impact, we have to meet people where they make the food decisions, right? They make it at the grocery store, at the restaurants, with their dietitians, whatnot. And so we want to partner with all those businesses, wherever people are making food choices, so that we can provide them at the point of making the food decisions. So we're a B2B company.
How might I interact through one of these businesses? Let's say I'm an individual consumer and I want to eat healthier. I want to live longer. I want to eat better in 2020. How is that food data going to impact my life?
Well, ultimately it's your decision, but where you can encounter the data is maybe your employer, maybe StartUp Health has a plan that gives you a benefit to, a meal recommendation engine that is powered by us. Whether that is through another app or partner, that would be one way. Another is you can just go and look for data on the web. Maybe you want to cook a recipe, you'll go to Epicures or New York Times or Microsoft and pull out a recipe there. It will help our nutrition data, so that's another way you can interact. You will go to a grocery store, you want to be able to find out foods that you can eat and foods that you can cook. You'll be using an app that is powered by our data that will recommend foods for you. So there's various ways you can find
Now
out.
I understand you're a great cook, so
Yes.
how do you incorporate food data into what you do?
Well, look, I've been doing that for over 30 years. So for me, it's a lot more about the feeling. I kind of have that knowledge in the back of my head. I don't count calories, if that's what you mean, but I do incorporate it in the way I eat day to day. I have my own ways I've developed in terms of breakfast, lunch, dinner, the balances of fermented, non-fermented food, greens, and other things. So for me, it's always a challenge. I enjoy the creative part of actually cooking and understanding. So it's not all data. We have to remember it's about enjoyment and fun as well.
Yeah. So you're creating this food database, helping people to eat better, live longer. Let's talk about traction. Let's talk about things you're excited about from 2019, things you're looking forward to for 2020 for Edamame.
So the big achievement for 2019 for us was that we got profitable, which for a startup is a landmark.
That's
Absolutely.
It's huge. It's awesome.
Yeah.
Congratulations.
Thank you so much. So that was one. We constantly grow our client database. We have APIs that we offer the data through. So our subscriber database has gone to 35,000 businesses that sign up, and about 1,500 sign up every month. So that's also exciting.
Okay.
And we launched with another startup health company a chronic conditions tagging for every meal out there. 5 million recipes, 750,000 foods. We've tagged them for chronic conditions.
Oh, wow.
In 2020, what we want to do is actually expand further into the personalization of food recommendations, and we're going to start mapping genotypes to food and microbiome types to food. So that's very exciting, because then we can get really personal. I think ultimately we can provide truly personal meal recommendations to everyone every moment of their life.
So you collaborated with another startup health company. Is that public, who you partnered with?
Yeah. It is Personal Remedies.
Personal Remedies.
Yeah.
Awesome.
Yeah.
I mean, I love to hear that, because the theme of this whole issue is collaboration. So
there you go. We're ahead of the curve.
That's fantastic. Victor, that's all the time we have. So excited to be kicking this off with you today.
Thank you so much.
I hope you have a fantastic festival, and have a great day.
Thank you.
All right. Next up, we have an interview with Mario Anglada, the founder and CEO of Oi Health. You provide minorities, immigrants, and veterans and other medically underserved communities with affordable, cash-based health products. This is my understanding.
That's correct.
And we're so excited to have you here, Mario. As I just mentioned with Victor, we like to talk first about really the why. So really that big, audacious goal we're going after. So for Oi Health, what's your health moonshot?
Our access to care moonshot is the focus of our mission. So what we're doing is we're making sure that consumers anywhere in the world can access high quality, primary care oriented healthcare services at very low cost.
Okay. Where did you get the passion to go after such a big health moonshot?
Well, I've been in the industry, in the healthcare industry for 25 years, and during that time I've always seen the opportunity of providing access to the masses in a way that can actually be profitable for a company and for its partners. So what I decided to do was to put together a healthcare expert team to build our solution. And what we've built is a platform of interconnected products and services that taps into providers, payers, manufacturers, and makes sure that all those relevant stakeholders have the ability for their products to be hosted on our platform, and for a consumer, a family member, or a healthcare provider to provide access to the ultimate consumer.
Awesome. Okay, so we're opening up access. That's great. You've interconnected these different products. Let's break it down and kind of understand what those products are and kind of make it understandable for a consumer. So what are the products?
So the first area that we focus is on medication access. So on the medication access front, we invented a medical gifting model for prescription medication.
Okay, that's cool.
So let's say that you're here in San Francisco, I'm in New York, and you need medication access. Through our OIRX program, I can buy it for you from anywhere in the world, which is a first, allowing families to support each other. So that's one aspect of what we do. We also focus on chronic condition management, and we have what is called OiLife, which is a kit that includes everything a diabetic, hypertensive patient might need in a box delivered to home with medications included, and we're actually selling that today for about $89 to a consumer.
Okay.
So our goal is to get access to care, access to medications, and ultimately help those patients better manage their conditions.
Why are these novel sort of cash-based products important in the access to care moonshot?
Sure, because when you look at underserved medical communities, in the US only, we're talking about 118 million people. When you expand that, like it's our goal to expand it on a global level, the numbers are in the billions. Right now, our company operates in 6 countries, which is basically the US and all of Central America, and we've seen that the need, sadly, is identical in many of the countries that we operate in. So us being able to provide a platform that gets a consumer excited about their care and accessible from an economic perspective is our goal and our mission.
All right, let's talk about what you're most excited about from the end of 2019 coming into 2020. What can we expect from OI Health?
Absolutely, and 2019 was a great year. We got all our products into the market. We were able to start getting partnerships signed. Into 2020, we're going to be focusing on 2 additions into our platform. So number 1, we're working on a solution that is going to be providing healthcare professionals with population health tools where we can help them manage their hypertensive, diabetic, and chronic condition sufferers from a Medicare perspective. So these partners will implement OI Health into their practices, and we will help them manage all their patients across the geographies that I described. The second big opportunity that we're tapping into this year is we're about to launch on February 4th our direct-to-consumer insulin program, which will lower the cost of all insulins across the U.S. without you having to have a need for health insurance to be able to access our pricing.
Fantastic, fantastic. Okay, Mario, that's all the time we have for today. I hope the Startup Health Festival is hugely productive for you and that you have a great week here at the JP Morgan Festival. So
I appreciate your time.
All right. Take care, Mario. I am excited to invite to the hot seat Linda Van Horn, founder and CEO of iShare Medical. Correct?
Yes, great.
Your software aggregates a person's medical records from all their providers into one shareable lifetime medical record to minimize errors and reduce costs. So I'm excited to have you here, Linda.
Well, thank you.
As you know, we like to start with that big picture question. So let's talk about iShare Medical's audacious health moonshot. What are you shooting for?
Yes, well, iShare Medical is on a mission to be able to help simplify the process of being able for patients, providers, and payers to be able to get, organize, use, and share medical information. And we aggregate that information into a complete medical record that creates the foundation for a learning health system. So we really think there's 3 macro trends we're really addressing. The first one is identity management. So we ID proof the patient, provider, or payer, and we assign them an iShare ID that's bound to a couple of key pairs that are used for encryption, decryption, and digital signature, because it's really important in healthcare to know that the person you're talking to can be trusted.
Okay.
And then the second part of that's interoperability, the ability to share that data regardless of care setting, provider, or EHR system.
Okay.
The third item is the learning health system. And the learning health system, basically, we look at what happened in the past, and then we look at what's monitoring what's happening now.
Yeah.
And then we can use what's happening now to create triggers, to create events, to automate processes.
Okay.
And then we can also then predict what will most likely happen
Okay.
so we can improve care and outcomes and reduce costs.
Very nice. I mean, interoperability is a big issue across so many different platforms. How is iShare Medical's take on interoperability unique, or how are you kind of going at that problem?
Exactly. Well, we began with the end in mind, which is creating a learning health system, one that could learn from what was happening and then adjust the model. So we started by saying, what do we need to do to be a learning health system? And the first foundation was trust. So we became ENAC accredited for HIPAA privacy and security.
What is that for anyone who doesn't know ENAC accreditation?
ENAC is a organization that accredits software for compliance. And a lot of providers require HIPAA accreditation for privacy and security.
Got it.
So we became an ENAC accredited for privacy and security. Then we became a direct trust accredited trust anchor. Then we, just most recently, which is the most exciting part, is we became one of the first QHINs, Qualified Health Information Networks.
Okay.
So under a new law called 21st Century Cures Act, it mandates that the Office of National Coordinator for Health IT create an information superhighway.
Okay.
And that superhighway is going to have these interoperability brokers, and they're called QHINs. And it's a really big technology lift, and it's a huge accomplishment to be able to become a QHIN. It allows us to have bidirectional exchange of data throughout the healthcare system.
Got it. Okay. All right. So that's kind of what you're building and kind of giving us that big picture. So let's talk about the end of 2019 into 2020. What are you most excited about for iShare Medical, and what could we expect coming up?
Yes, well, we have some really big wins that we really worked on in 19, but we closed the deals just a couple weeks ago. So one of them was getting a contract with a major pharmacy benefit management company.
Okay.
And so we're very excited about that. We'll be scaling that up in 2020. Also becoming a QHIN. So that is huge. We have a first mover advantage, becoming one of the first in the country. Accredited QHIN. So this is a nationwide network, and we'll be working directly with the regional coordinating entities and under TEFCA, this new piece of legislation, the Trust Exchange Federated Common Agreement, scaling that up. We're also going to be leveraging our trust framework for FHIR, the Fast Healthcare and Operable Resource, which is the latest protocol that we're using in healthcare. But FHIR right now doesn't have a trust framework. So you have to have a pre-existing relationship. So you and I would have to have an agreement before we could exchange data.
Okay.
What we are doing with the digital identity is being able to create the identity on the fly. So let's say you're a primary care doctor, you want to refer to a specialist at the Mayo Clinic, but you don't have a relationship with the Mayo Clinic. If under the current structure, that would be something you couldn't do. Using the iShare Medical Trust Framework, you would be able to establish that relationship in real time because you would be trusted, ID proofed as a primary care doctor, they would be ID proofed as that specialist, and then we can make that electronically happen. So it's a way to authenticate, authorize, and exchange information dynamically.
Nice.
Yeah,
Nice.
It's really awesome.
So last question, what do you hope to get out of the Startup Health Festival? Kind of why is it important to be at an event like this?
Yeah, well, for us, it's really about, we're looking to raise capital. So we're meeting with a bunch of investors. We're also, though, this is an amazing network of health transformers, and I learn something new every day. So it's so great to talk to people and see what they're doing and saying, that's cool, and how can we partner? We're already partnered with a couple of transformers already, our customers of ours, so that's just awesome.
That's fantastic.
Yeah.
Linda, that's all the time we have.
Great.
I hope you have a wonderful couple of days here, and really excited about what you're building. Okay?
Thank you so much.
All right, take
bye-bye.
care. You can step here. We're going to be back in a few minutes on the live stream. I want you to know that you can continue to watch at startuphealth.com, and you can join the conversation on social media by tweeting us at StartUpHealth using the hashtag StartUpHealth. So we'll be right back. If you're just joining us, I'm Logan Plaster, editor of StartUp Health magazine. I'm at the StartUp Health Festival. I'm excited to welcome you into the StartUp Health studio as we interview about 100 health entrepreneurs over the course of 2 days, broadcasting live at startuphealth.com. So I'm so excited you're here joining us, and we're just going to jump right into our next interview. So I'm excited to welcome to the stage to the interview chair, Brett Shamash, CEO of CareDocs. Brett, happy to have you. Grab your microphone. I understand CareDocs is on a mission to improve children's health by really making the school a hub of care, which I think is really, really cool. So I'm really happy to have you here. For our interview, you know, we like to start with that big picture question, sort of the why question. So what's that big health moonshot that CareDocs is going after?
Sure. So at CareDocs, we want to ensure that every family in America has convenient access to quality care for their children at all times, and it's absolutely possible.
Yeah. So why are schools so important to that equation?
Well, so we have this organized system in this country that understands the needs of our kids' health at all levels. They understand the social determinants affecting these kids' health. They understand that they have great relationships with the parents and guardians of our children, and that's an untapped resource. I'd argue that it's actually the largest pediatric health network in the country. And so what we're aiming to do is to provide this health tech infrastructure. We have our EHR in 2,600 schools across 31 states in the country.
Wow, that's a
and
lot.
we can connect that to the services so that these kids get the care they need at the time they need it.
Okay. So that's the big picture, that's the health moonshot. What are you building? Describe that network and how that actually works on a day-to-day basis in a school.
Yeah, so our children are going to the school nurse office 5 to 10 times during the course of a year. All sorts of things are going on with their health. So 10-year-old Mary is having exacerbations of her asthma, and she's going to the school nurse 3-4 times in a month. And there are all sorts of things going on at home. Mom doesn't have a car, there's a cat at home. And so there's managed Medicaid services that are funded to the tune of $89 billion a year across the country for cases like this. And so we connect that intelligence to the managed Medicaid organizations so they can provide those services, and they can reach out to the families and coordinate with the school nurse to get the care the kids need.
Yeah. Is this a passion that's personal for you? I mean, a lot of people are connected to children's health, and it can be very, very personal. So,
Yes.
So kind of what does this mean to you?
Well, I have 2 kids, a 10-year-old, 11-year-old, and 11-year-old that is a grade above my other 11-year-old, and they're in the school nurse office, and I am very fortunate to get those updates and be on top of my kids' care. But many families across the United States are working multiple jobs. Both families are working. They can't be as on top of it and can be connected to the convenient services. And so I'm pretty passionate about making that happen.
So this infrastructure that you're building is in thousands of schools currently. Let's talk about traction. What you're excited about coming out of 2019 into 2020, what we can be expecting from CareDocs.
Yeah. So in 2020, we have recently signed with soon-to-be largest Medicaid MCO on the planet, Centene, upon their acquisition of WellCare, and we're going to launch with them in Indiana and California to provide services to kids through the school system and through this intelligence network. So we're really excited to prove that.
Why is that collaboration important specifically?
Because they have a lot of funds to provide these services. In fact, they're obligated in many instances through MLR, medical loss ratio, to provide upwards of 85% of their revenue in the form of services. They're wonderful services, free cell phones, free chronic disease management, all sorts of programs.
Yeah.
They just need to know who needs the care and at what time. And so we're able to provide that intelligence and work with them to get the kids the care they need.
Okay. If you were speaking to like a school nurse, like paint me a picture of how dealing with a child situation would be different with this kind of infrastructure.
Yeah, so
my mother-in-law happens to be a school nurse, and so I think about her and improving her life, kind of making it very practical.
Yes. Where is she a school nurse?
In Pennsylvania.
Okay, so she may be using our software. We'll have to talk after.
Okay.
But you know, these school nurses want to have convenient software to understand who are the frequent flyers, what are the care programs recommended by the parents or the care provider of that kid. They want to understand what they should do for discharge, so there's clinical decision support baked in. And it makes their lives a lot easier to be able to give the kids what they need with our electronic health records.
Awesome. Brett, that's all the time we have.
Great.
Thanks so much for coming. I hope
Thanks
this
for
is an
having me.
awesome few days for you
It
at the
was.
conference. All right, take care.
Take care.
All right, I want to welcome up to the hot seat Christian Pasquale of Medictor, the CEO and co-founder of Medictor. I understand that you're a Barcelona-based tech company that provides an AI medical assistant for triage in order to give clinical decision support. Okay. Really happy to have you here. Excited to understand more about Medictor. We've talked before, and yeah, it's really neat what you're doing. So, as you know, we always start big picture with the why. So I want to understand for Medictor, what's that big health moonshot that you're going after, and kind of what makes you passionate about the work that you're doing?
Thank you. Yes. Well, we are in a global mission to improve access to healthcare.
Okay.
So people, it's in a trouble when their first symptoms appear and they seek for care. They go the wrong place. They go to Google. Okay. We all go there and put our symptoms and try to make the best decision. But that's not reliable, scalable,
right.
and we are solving this problem with this AI-based medical system to drive patients to the right level of care anytime.
Okay.
And that's a great breakthrough because it's an unsolved problem worldwide. And we really made a great effort to build this AI engine to be accessed with any interface you would like and speak to it as it was your doctor. So you can have a first assessment on how fast you need to seek care.
Okay. So that's an idea that has been in the market for a while as a concept. Obviously, like Dr. Google is a thing, and it's just not good. So what has made yours successful? How have you built it so that it can actually give you the answers that you actually need?
I think that symptom checkers have been around, specifically in the US, for many years.
Yeah, they're just bad.
But technology has really changed a lot.
Okay.
And when it matters to use a tool like Medictor, is how accurate is it. And we are the only medical assistant in the world today that has proved accuracy with clinical trials with real patients, achieving a 91.3% accuracy. And that's a big breakthrough because we don't only want to be a fancy tool, we want to be a reliable tool and really supported by the clinical community. And that's a huge difference. I think that accuracy is a key point. When you want to be assessed online, you want the result to be accurate. If not, it makes no sense.
No sense. So you're based in Barcelona, at the Barcelona Health Hub, correct?
Yes.
That you helped found.
Yes.
But you're a global company. So tell me about where Medictor reaches globally.
Well, yeah, we have a global opportunity with our company, and we really think big in this sense. Of course, Europe and US are our main markets as objective, but we go by opportunity worldwide. And we think that really Barcelona has whatever it takes to be really relevant digital hub worldwide. We have a great medical community. We have a really fast-growing startup ecosystem, and the combination is a great, really hub to not only foster our solution but other health insurance digital health companies from Barcelona.
So is this a digital triage tool that's available to me now as a consumer? Like if I were to have a fever and I was concerned and I want to just sort of I don't want to do Dr. Google, I can go onto Medictor and I can do an AI symptom checker?
Yes, our system is available online and everybody can use it, but we are devoted to B2B business, so it's only a showcase and also something that is useful for us because we can learn from user interaction, but our unique purpose is to be integrated to health systems, health insurance companies, telemedicine platforms, so they can first assess symptoms and guide users to the most relevant next service, online or offline.
Got it. So you become the AI backbone for the B2B partner that you have. Got it. Okay. So let's talk about things that you're looking forward to most in 2020, things that are upcoming traction-wise.
Well, we have gathered significant traction in the US by the most game-changing agreement that we recently signed with Yale New Haven health system, and that's a big breakthrough because it has break the ice with the big corporations in the US, and now we have a good reference to gather more traction in the US. Also, we signed an agreement with a telemedicine platform that I cannot disclose right now, but it's a big name. So now we have these references to foster this traction in the US. And also we are looking worldwide. So we are now raising a round to foster this growth. We have a solution that has proof the market traction, the benefit for our clients.
Awesome.
Now we are looking for global growth.
Awesome. Well, Christian, that's all the time we have. So excited about the work that you're doing with
Thank you.
Medicure, and I hope the next couple of days are really fruitful for you.
Thank you very much.
All right, thanks for coming by. All right, take care, take care. All right, I'm excited to be welcoming you to this live stream, and we're going to be broadcasting live for 2 full days as we interview nearly 100 health entrepreneurs. You can watch the live stream at StartUpHealth.com. We actually have 2 channels going where you can watch the Health Moonshot stage, and then you can also watch the Startup Health TV live stream as we interview health transformers. We've got a amazing lineup of co-hosts who are going to be helping me to interview people throughout the day. We've got Dan Kendall from Digital Health Today coming up. We've got Saran Rothberg from Comedy Cures. And then later we'll be joined up here by Marty McCary, the new editor-in-chief of MedPage Today. Something we're launching here at Startup Health at this festival is issue 5 of Startup Health magazine. It's 120 pages of stories about health innovation and really sharing with the world what's coming next in health. So hope you'll check that out at startuphealth.com/magazine. My next interview, I'm excited to have up Samit Manier, CEO of WellBrain. Come on, join me. And happy to have you. Come on, sit down. So I understand that you have to tell me more about WellBrain, but I understand that WellBrain is a digital chronic pain management platform that's really fighting the opioid epidemic. So
Yes.
I'm excited to talk to you about that. Obviously, the addiction moonshot is really near and dear to our hearts, our most recent health moonshot. So let's start big. Let's start with the health moonshot question. What is the big audacious goal that WellBrain's going after?
So the big audacious goal we want to accomplish is basically eliminate dependencies on painkillers and then also halt the opiate epidemic on a worldwide basis, and specifically for those who are in chronic pain. So that's the big, paradigm thing.
All right, well, let's get right into it.
Yeah.
What are you doing to do it?
So, like you mentioned, WellBrain is a digital health chronic pain management platform. And what we want to do is change the paradigm 25 years out to incorporate the mindset of people thinking of emotional and mental health as a core component prior to pharmacological solutions or other types of solutions.
Okay.
So in our digital health chronic pain management platform, what we do is we enable physicians to choose from an array of evidence-based non-opiate modalities.
Okay.
We started out with a point solution of providing customized guided meditations for patients that they can use at home. It's an iPad app that physicians administer, and then they can get reimbursed for. And then patients use it at home, and then the physicians can track those activities.
So let's break it down. First of all, are you working with primary care physicians, primary care providers, or are you working directly with patients?
We're eventually going to work with primary care providers. We're working with pain physicians wherever chronic pain manifests itself.
Okay.
Chronic pain is defined as 3 months at home. It could be oncology, rheumatology, sports medicine.
So let's say you've partnered with a pain doc and he's seeing a pain patient.
Yep.
How does he use your software? How does he use your platform?
So it's an iPad app that's been optimized for the flow. Patient comes in. We help the physician track various components of anxiety, depression, all these other parameters and other areas relevant to their pain. And then that's tracked longitudinally. And then those are reimbursed. And then the patient gets introduced to a WellBrain app to use at home.
Okay.
And then there's all these other modules that the physician can use, including other types of solutions such as neurostimulation and getting accelerated pre-approval with insurance companies. So that's another solution the physicians can employ.
I guess the big question there is how well it works. If to pull someone off of an opioid dependence is obviously a big transition.
Yeah.
So what kind of success metrics have you seen?
So the success metrics we've seen is basically in about less than 5 weeks of time, we've shown clinical reductions in electronic health records of patients' opiate prescriptions by 14%, reductions in emergency room visits by 18%, And most importantly, the pain scores from 1 to 10, we've seen an average decrease by 30%. So if you're at 9, you drop to 6. So those are some significant impacts.
And remind me, what are they actually working through on the iPad?
Okay.
What are these sort of modalities?
So on the modalities on the business side for the iPad, it's specifically there's various modules for physicians to use, including behavioral health, including a longitudinal tracking of their psychological factors. Those are reimbursable. And then at home, the patient does these customized guided meditations or other types of queries on how they're feeling. And then the physician's office can follow up with them even while they're remote at home. And those are reimbursable events. So we've also solved the patient, payer, and provider economics.
All right. Okay, so let's talk about what's next for WellBrain. What are you most excited about coming out of 2019 and into 2020?
So the significant thing we're excited about is incorporating this telepsych component. What that incorporates is a lot of times, a lot of these pain patients have psychological issues, almost a huge majority of them. And we will solve this last mile equation because there's a critical shortage, at least in the United States, for psychologists. But we're going to enable that such that they can do instant telepsych sessions in conjunction with their pain provider. So it becomes a more concerted effort. It's not just the pain physician, but also this other secondary backup. And then making that very seamless for everyone involved. So we're really excited about getting that fully developed and up and running by the middle of this year.
Very nice. Why is it important to come to events like the StartUp Health Festival?
Oh, I think it's a fantastic nexus of like-minded people, and whether you're looking for investors or business development, there's a lot of portfolio companies in Startup Health that I don't even know about, but there could be potential business development synergies, or they might know of a hospital system that we may want to reach out to. So I think it's mutually beneficial. You give and you get back as well.
Yeah. Well, thanks for joining the live stream. That's all the time we've got.
Yeah.
I hope it's a really productive couple days for you.
Yep.
And thanks so much.
Yep. Thanks for your time.
I am excited to be inviting up to the interview chair Noel Zimmerman and Jonathan Creevy.
Yeah.
So glad to have you guys here. You are with Asia Biome.
That's right.
Okay, and I'm excited about talking to. I'm excited to talk to you guys just because this explosion in the gut biome market.
That's right.
You're using gut microbiome to get to the root causes of IBS, autism, ALS, multiple sclerosis, with the focus on the Asian market, right?
That's right.
Awesome. So what we like to do at Startup Health TV is we like to start with that big picture question. We like to start with your health moonshot. Kind of what's that big audacious goal that you're going after? So what is that for Asia Biome?
Yeah, well, I think for Asia Biome, we really identify with like what you said about the biome creating or causing a root imbalance in so many diseases. So our moonshot is to cure the dysbiosis, which is an imbalance of gut bacteria, and hope to help conditions of autism and diabetes and multiple sclerosis, like you mentioned, and IBS. So we're very excited to embark on this challenge and hope that in the next 25 years we'll see several of these products and drugs that we help discover on the market and helping people feel better.
So there's a number of microbiome companies, health startups in the market, but you're embarking into the Asian market. So what was it about that market that felt so important?
Well, we're not exactly bringing cures to the Asia market. We're actually finding discoveries from the Asia bacteria of humans.
Gotcha.
So there's a lot of companies in the microbiome space. They're researching U.S., Europe, etc. But there's not so many players in Asia. So we're one of the few and absolutely one of the first to be in the research space there. So we've got several people on the ground following clinical trials, following various clinics, and really looking for the key microbes that make a difference for different disease conditions.
Okay. Would you say you're in, I mean, are you in like a research phase right now, kind of figuring out what those cures could be, and then sort
I'll let
of
Jonathan
teeing that up for the next phase?
Yeah, so with our company, we've put together a really unique business model which combines offline clinical data and results with online bioinformatics and cloud analysis. So what that means is we're looking at the unique ecology of microbes in Asia, as well as the unique epidemiologies of the Asian continent, and figuring out what kind of microbes have therapeutic potential, and then understanding what those microbes are doing and if they can apply to treating disease globally. And we're excited that we've now actually developed a pipeline with microbes that have some known or even demonstrated therapeutic effect in diabetes, irritable bowel syndrome, and autism.
I'm just curious to know, where do you see the microbiome industry going in the next few years?
Well, the biggest milestone for the microbiome industry coming up is going to be the first FDA approval of a microbiome drug, and we predict that happening in the next 12 to 18 months. It'll probably be for the treatment of recurrent C. difficile. What's amazing is that C. difficile, an infection which affects over 500,000 people a year in the US alone, has an only 30% treatment rate with traditional medicine. But with the advent of microbiome, now patients can experience an over 90% cure rate from using microbiota as a drug. And so if that's what we can do with C. difficile, imagine when we're taking a look at diabetes, at autism, even neurological conditions such as Parkinson's, multiple sclerosis, the potential treatment and curative rates could be through the roof.
I can speak from experience that actually a microbiome treatment saved my grandmother's life of C. diff. And I saw it myself. I saw her go from nearly dying to it saving her life in a 48-hour period.
It's amazing.
And so that's partly why I'm so excited about the work that you're doing and for the potential of it. 'Cause just even having seen it one time, I think there's just amazing potential there. So what's one thing in 2020 that we can be looking forward to from Asia Biome that you're really excited about?
So in 2020, we're going to be filing our first investigational new drug application to bring a probiotic which treats diabetes to the market.
Awesome. Well, I think that's all the time we have. Really excited that you're here. Hope the next couple of days at the StartUp Health Festival are really fruitful for you. And that this sparks collaborations and some new things for you guys.
We're excited.
All right.
Thank you.
Yeah,
Thank you. All right. You can step this way.
Sounds good.
I'll take that. All right. I'm excited to welcome up Susan Bratton, CEO of Savor Health. Great to have you, Susan.
Great to be here, Logan.
All right. I understand you are helping patients fight cancer through nutrition. So we're going to get into that today.
Okay.
Really excited to have you. We always start these interviews with really kind of pulling way back and talking about those big audacious goals that give us kind of the why behind these companies. So what's the health moonshot for Savor Health?
So the health moonshot for Savor is to leverage artificial intelligence and machine learning to provide cancer patients with highly personalized, clinically and contextually appropriate nutrition support and nutrition management, symptom management, in order to help them be more adherent to therapy, have better outcomes, to prevent costly ER visits and hospitalizations, and most importantly, to empower them with independence, control, and a sense of hope.
Got it. How did you get into this? Did you come from the cancer background, the nutrition background, both?
Neither.
Neither?
No. I used to work on Wall Street. I was a healthcare services investment banker. And in 2009, I lost a very close friend to a glioblastoma. And long story short, I just could not believe that my friend was told nutrition doesn't matter, eat whatever you want. But as a healthcare person, I knew that evidence-based literature is how medicine is practiced. So I started looking into the literature and I found nutrition matters, and it matters a lot. And so I thought, well, if there are people out there like my friend who are struggling with this issue, I'm going to help them.
Got it. So you built Ina, a digital assistant, this AI chatbot, right?
Yes.
So walk me through, if I'm someone who is working through cancer, we're trying to recover from cancer, and I am talking to my chatbot, kind of walk me through that process. What's the experience like for a consumer?
So the experience for the consumer is like you and I texting with each other. So once they provide us with their phone number, Ina reaches out and says, "Hey Logan, how are you doing today? Are there any symptoms that are bothering you?" And you can say, "Yes, I'm having mouth sores." And Ina will provide you with tips to prevent and manage mouth sores, including things like recipes and other side effect management tips. But we also incorporate what are your comorbid medical conditions? What's your height and weight? What's your BMI? Do you need to lose weight or gain weight? And importantly, what do you want to eat, and what are other things like food allergies that concern you? So that it's contextually appropriate for you, not just based on your cancer, not just based on your side effects, but also what other medical conditions do you have, and what do you want to eat?
Yeah. Is that handled all through the AI chatbot in terms of understanding other elements of someone's pain and someone's recovery? Asking them questions?
Yes, so there's a intake process where we start with a couple of key questions, and then over time we build that longitudinal patient record to understand all of those other variables.
Got it.
Not all in one sitting, because these are very tired, very fatigued people. We don't want to make them answer 40 questions before they get anything of value.
Yeah. So let's talk about kind of where you're at now, kind of what you're really excited about coming out of 2019 into 2020, partnerships, traction, anything.
Sure. So coming out of 2019, I think the thing that I'm most excited about is we launched INA, and we launched INA with Bayer Pharmaceutical Company.
Oh, wow, great.
We also launched some major advocacy partnerships with longevity and cancer care. And we signed up 2 clinical trials, one with Novartis and one with MD Anderson, and those are starting right now.
What do those trials look like? You say you launched with Bayer. What does that really mean?
What it means is that INA is offered alongside one of their drugs as a support tool to help them be more adherent and to get through therapy.
Almost like
better.
they're prescribed it. They're prescribed the platform in a way?
It's not prescribed yet, but that's a goal.
That's a goal. Okay, all right. And in 2020, things you're really looking forward to?
Couple of things. I'm very excited about getting the clinical trial data. So by September of this year, we'll have preliminary data looking at the impact of INA on clinical endpoints.
Okay.
And the second thing is we're bringing on a big data science team, and so I'm looking very forward to kind of building out that component of the platform.
Nice. Why is it important to come to events like the Startup Health Festival? What does this mean for Savor Health to be here?
So Steve said something upstairs just a minute ago, and it was about collaboration and tackling really big, complex problems together. And the fact of the matter is we can't all do this on our own alone. And so this event is amazing because we're all working together and collaborating.
Yeah. I think that's all the time we have. I hope this next couple of days for you, Susan, are incredibly fruitful, and just couldn't be more excited about the work that you're doing at Savor Health and working on the Cancer Moonshot. So,
thank you, Logan. Great to see you.
Thank you very much. All right. Take care. All right. Our next guest is going to be James Richards. Come on up. Great to have you.
Hey, Logan.
All right, James. All right. I'm excited to be here on the Startup Health TV live stream, broadcasting live for 2 days at Startup Health. So, tell me what it is that is your health moonshot.
Sure. So, QuickScript's Health Moonshot is access to care.
Okay.
So, our mission is to provide price transparency and affordability with prescriptions to patients across the country, and that is our mission, and we're working really hard to deliver on that.
Affordable prescriptions sounds nice. I'm a father of 2, and I'd like to have cheaper drugs for when my kids get sick. So
Sure.
How are you building this system? What is this that you're building?
Yeah, so essentially what we've done is we've built a digital pharmacy focusing chronic disease verticals. And essentially we are allowing patients to purchase with full price transparency through their insurance on our mobile platform. And then what we're doing for the doctors is we build software to support the workflow process. And this is all supported by PBM infrastructure, which we built up over the last few years.
What's PBM infrastructure for someone who not in the industry?
So it's pharmacy benefit managers. Okay. So it's crucial in helping negotiate.
I mean, I knew that, but you know, our viewers might not know. No, I'm just kidding.
It's they're crucial in implementing pricing controls throughout the channels. with different employers, and ultimately at the end is passing the cost savings down to the patient.
Nice. You mentioned workflow. Kind of bring me into the day in the life of using QuickScripts.
Sure.
What does that look like for the pharmacist, the provider? How does it make my life better?
Yeah, sure. So what happens is the doctor sends a prescription to QuickScript Pharmacy, and then we initiate contact with the patient either through digital messaging, email, or phone call.
Okay.
And then we, do all our special sauce in the background, adjudicating the claims, using manufacturer rebates. Send a notification that the prescription's ready to purchase. They're actually able to choose price. Super easy, two-step clicks, and they check out, and then we deliver same day.
Okay.
For the physician, secure end-to-end messaging where they can communicate with us in real time.
Okay.
Through messaging system, and we assist in doing different workflows for them as well in the back end.
I feel like there's a lot of movement in the pharmacy tech space.
Sure.
Where do you see that heading in the next few years? Like, what are you excited about just about pharmacy tech in general?
Yeah, so it's a vital point, I think, in the industry right now, and there's a lot of great companies that are making huge impacts in the space. Really just helping get more access to prescriptions for patients, as well as delivering to them in a timely manner to really help them start treatment as soon as possible when they leave the doctor's office.
Nice, nice. Okay, let's talk about traction for a minute, kind of the things that you are most excited about coming out of 2019 and into 2020. What can we be looking forward to?
Yeah, so 2019 was a big year for us.
Okay.
Actually completed a merger with Pharmacy.
Okay.
Doubled our team, and then finished building up our infrastructure to.
You merged with whom?
Urban Care Pharmacy.
Urban Care Pharmacy.
Yeah,
okay.
So we'll be based out of Philadelphia.
Oh, nice.
And super excited about that. And so it was a great year in 2019. And
what's the healthy innovation ecosystem like in Philadelphia? You say you'll be based out of Philly?
Yeah, so the pharmacy's based out of there. It's really up and coming. You have some great incubators in Philadelphia, great health tech startup.
Yeah.
So it's a lot of positive movement coming out of that market. Yeah.
Speaking of positive movement, you're here at the Startup Health Festival.
Yeah.
Why is it important to be in a community like this?
Super important, for us to really have that support early on. When we joined Startup Health, we're still in the ideation stage.
Okay.
So I was talking to Steve and Unity this morning about this. Having support of this community was instrumental in helping us build up the infrastructure of the business and getting ready to launch.
Nice, nice. Okay, that's all the time we have.
Yeah.
So excited you could join me down here in the Startup Health studio.
Yeah.
And is there something else you want to say?
Just real quick
Final announcement?
Yeah, I actually just want to announce we are planning to launch at the end of this month.
Oh, nice.
So super excited about that in the New York, Pennsylvania, and New Jersey market. And so QuickScript is launching. And one more shout out to my classmates at Cornell Healthcare Program. They've been instrumental in helping me throughout this process. So thank you very much.
Nice, nice. All right. Glad you could come join. I hope that it's a really productive couple days for you at the Startup Health Festival.
Yeah.
All right.
All right. Take
I'll
care.
take that.
Cheers.
Thanks a lot.
Thanks, brother.
All right. Excited to have you joining us for the Startup Health Festival. I'm Logan Plaster, the editor of Startup Health magazine, and just inviting you into the festival, into the Startup Health studio to really get to know the health entrepreneurs who are in attendance here, who are in the Startup Health community. We're going to be interviewing over the course of 2 days nearly 100 of the top health entrepreneurs in the world right here, and we'll be streaming it live at startuphealth.com. You can join the conversation on social media. You can tweet us at Startup Health, use the hashtag Startup Health, and we would love to meet you online. I'm excited that today we're going to be joined by a series of really amazing industry guest hosts who are going to take this seat and really introduce these health entrepreneurs to you. And so I'm excited to welcome in the next hour Dan Kendall, the host of Digital Health Today. He is a friend of Startup Health and knows the industry better than most, and couldn't be more excited to have him here. So I hope you will stick around and catch the next hour, hosted by Dan Kendall. Thanks a lot, and we will be right back.
Hi everyone, I'm Dan Kendall, the host of Digital Health Today and the founder of the Health Podcast Network. We're broadcasting live from StartUp Health Festival in San Francisco, California. Really pleased to have you join us here on the launch of StartUp Health TV. We're going to go through 2 days of programming that you can find live at startuphealth.com. And I want to welcome our first guest. Please welcome Gail Port, the CEO of eHealth Analytics. Gail, thanks so much for joining me. Hi, welcome to Startup Health Festival.
Thank you, always great to be here.
So, Gail, I want to talk about what you're doing at eHealth Analytics.
Sure.
So can you tell me, first of all, the big picture mission that you're on?
Well, the mission that we're on is to help reduce the number of adverse events and recalls related to medical devices, which are showing triple-digit growth year over year and adding billions of dollars to the cost of healthcare in this country.
That's a very admirable ambition. So how are you going to go about doing that?
Well, we use predictive analytics. We have data from the FDA, all of their adverse event data. We have machine learning algorithms that we've used to cleanse the data and develop Patient Predict and MedDev Predict, which helps create a medical device formulary that lets people know which devices in patients with, even with patients with multimorbidities and polypharmacy, are going to have the most effective device used. And this ranges from the most complex implantables to things like surgical tape. There are billions of dollars being spent every year on revision surgeries, and we think we can make a big dent in that.
Now, why is it that you decided to take on this particular problem?
Well, glad you asked that. As the proud owner of multiple joint implants myself, this is something that I'm especially interested in. And it came to our attention that there are millions of devices that the public is not aware of that are being recalled because of adverse events every year. I don't know how effective my knee joint implants or my shoulder implant is. My doctor doesn't either. And especially, say, in a Medicare patient, that the typical Medicare patient might have 5 different chronic ailments that they're dealing with, taking a dozen medications. Nobody, including device manufacturers, the payers, the providers, know how effective these devices are going to be in patients like that. And when we realized that, we said, we've got to do something to fix that, to let people know.
So, speaking in terms of real impact, how is your product actually going to make a difference over the next 12 months or 5 years? Can you give us some insight on that?
Well, for example, one hip device that was used caused 23,000 recalls. If somebody had known in advance that that was the case, we could have saved payers over $1 billion a year over what they spent.
That's amazing. That's amazing. Now, we're here at the Startup Health Festival in San Francisco, and I understand that you have an announcement. Can you tell us about that?
Yes. We've developed a strategic relationship with OR Hub and their product Surgical Spotlight, which lets surgeons and hospitals and healthcare providers know in advance exactly what devices are being used in every procedure, what the predictability of a recall is, and what it's going to cost them pre-surgery. And lets them help pick the most effective device for a patient in any given procedure.
That's brilliant. Well, congratulations on that partnership and that announcement. I hope you get a lot of traction here at the meeting.
Yeah, we hope so. And we hope it shows other people as well that our analytics can be used to help power other products as well.
Well, it's January 2020, the start of a new year, start of a new decade. What do you think we can see from your organization over the next 12 months?
Well, we have several pilot projects that we're finally been able to secure with a number of provider institutions, with a major payer, and we're on the verge of a relationship with a dental care company in Europe. So we're excited about that. We never thought that dental care would be something that would be of interest, but they approached us, and we're excited about expanding into Europe.
That's brilliant. It's always better when you get pulled into a new market rather than go over and try to set up all the infrastructure that's required to enter it. Well, that's terrific. Well, people can find out more about your organization by going to startuphealth.com and searching for eHealth Analytics.
Analytics.net.
Excellent. Great. Okay. Very good. Well, listen, Gail, thank you so much for joining us, and I wish you a very successful meeting here at Startup Health Festival.
Thank you.
Thanks. Joining me next is Howard Rosen. Howard is the CEO and founder of LifeWire. Howard,
Dan,
thanks so much for joining me. Welcome to the studio. Let's go like that.
Thank you for inviting me.
Howard, thanks for being here. So we're here at Startup Health Festival. It's a big 2 days. Tell me what it is that you're working to do at LifeWire. What's the big moonshot?
Well, I guess to put it in terms of moonshot, what we're looking to do is to provide access to care to any and all patients, wherever they are, whenever they want to be communicated with, using whatever device that they want, communicating however they want to communicate.
That's brilliant.
And all without any software. It's truly cloud-based. There's no software. It's instantaneous. So think of it in terms of population health management, but providing precision medicine. So it's able to be specific to each individual's needs as that evolves over time.
Excellent. So why is it you decided to try to tackle this problem? Access is a massive problem all around the world, but why did you decide to tackle this?
It's interesting. I guess it came down to, because I come from outside of healthcare, but in communication. And so to me, I think on a broad basis. And in terms of, because the issues are so broad and change all the time, I thought it's better to see, can we come up with a broader solution set to do this, to then allow our clients to choose how they want to communicate or what they want communicated or the issues they want to deal with. Because they knew better than I did as to what was the most important element to each one of them.
So talk to me about how you're actually going to do that. How are you actually building this solution, and what is your product?
So the product, it's truly a communication platform. So it really allows patients and providers literally having an ongoing dialogue like you and I are having now, but on an automated remote basis. And what's being communicated are our clients, in case providers and payers, their protocols, their assessments. We're automating those processes and using those rules and the AI engines to determine ongoing dialogue, more information, pass them on to third parties if necessary, as they desire.
So how do you see this product, the solution, making an impact in the industry?
Well, we've been very fortunate that we've been doing it already. We work in both the federal and the commercial space in mental health and behavioral health, and we found terrific and exciting results in the area of post-traumatic stress, high-risk suicide, even maternal care. And even this past year, we've expanded in the area of Hep C with a number of our clients and hepatitis C, so it's been very exciting.
What are you expecting the next 2 days of the Startup Health Festival to mean for you and your organization?
Well, the next 2 days, as it was when I attended last year, where I actually met other health innovators, where we actually announced today a new partnership with one of them in the whole with psychoanalytics in the whole area of dealing with mental health assessment and using our system as that engaging element to engage the patients and the providers.
Excellent. I think I'm speaking to that organization a little bit later
in
today.
About 10 minutes, I believe.
That's terrific. Well, wonderful. Congratulations on that partnership. I look forward to learning more about it.
Thank you very much.
So we're here at the beginning of a new year, beginning of a new decade. Yeah. What can we see over the next 12 months? What sort of big impact do you want to make with your organization?
Well, some of the impact is some new technologies we invented last year that are actually being rolled out this year. One being called Whisper Text as an example. This is a different means of communicating securely and privately, where multiple individuals may share an individual device, but no information is recorded on that system, so it allows the security and privacy, which again expands that whole area of utilization and engagement of the patient themselves. And continuing the area of expanding in areas such as hepatitis C and others for the sort of broader statewide kind of programs.
Excellent. Well, if there's one thing that you would like all of your potential customers to know, is there anything that you'd like to make sure they know here on this broadcast?
That's a very good question. It's really just the key to all success is engagement of the clients, and it's engagement of the entire ecosystem. So it's the patients, it's their providers, their payers, and their IT department.
Excellent. Well, I know people can find out more about this company by going to startuphealth.com and searching for LifeWire.
That's
Where
correct.
else can they find more? LifeWire.com?
www.lifewire.group.com.
LifeWireGroup.com.
Yes.
Well, thanks very much for coming and spending time with me here in the studio.
Thank you, Dan.
Enjoy the rest of the festival. Thank you. Up next, we've got David Haddock. David, please join me here in the studio. Welcome.
Hi, Dan.
David, you are the CEO of Psych-E Analytics.
You said it just right. Thank you.
We were just talking about you with our previous guest. That's fantastic. Yes. Well, you have a platform that helps primary care providers treat substance abuse and behavioral health issues. Big problem. Big problem. Tell me about that moonshot that you're working on.
Well, the idea is that patients will be better served if the physicians understand the body, mind, and spirit connection. And they've been trained to do that in college and in medical school. So we try to fill in that gap so that they don't have to be concerned that they'll get stuck in an area that'll just keep the patient there and never ruin their whole schedule that day.
Right.
So we give them a report in advance of the day, at the beginning when they do their morning huddle, so that they can decide what other resources they're going to need during the day, whether it's behavioral health consulting, or it could be the case manager or social worker, or whether it's just a simple case of a medical situation that they're ordinarily able to handle.
Excellent. David, just move the microphone a little bit more in front of your mouth and make sure that all the audience can hear you just fine when they're listening in at home. So I want to understand that a little bit more. So tell me, just going back to that moonshot, why is this so important for the world that you tackle this problem?
Well, if you ignore the behavioral health issues that patients have with chronic disease, those patients cost 5 times as much to treat as a patient that doesn't have a behavioral health condition. If you ignore that condition, it's even worse. So the idea is to support them so that they really understand how they can participate in their self-care, and so that the doctor gets a better relationship because the patient acknowledges, this guy knows what my problems are. Have you ever left a medical office and asked all the questions you wanted to ask? We always zip the lip and say, oh no, he doesn't want to know that. By the time they've taken our questionnaire on their smartphone at home or wherever else it might be,
right,
they've been trained to understand that the physician is really interested if they have social isolation or bereavement or their anxiety over their job or their children.
Mm-hmm.
All these things interfere with their ability to take care of themselves, and they also cause a lot of the medical symptoms that show up. We call it somatization.
So David, why did you decide to take this on? Why is this important to you?
Well, personally, because I have a family history of mental health, and my first wife had a delayed postpartum depression that was not diagnosed, and it actually ruined her life.
Wow.
Because she was on the wrong meds for a couple of years, and the meds did as much damage or more damage than the underlying condition. So I'm really grateful that I had this opportunity on my 7th or 8th startup to do something for mental health.
That's great. It's a big problem, and it's something that I believe is now becoming more mainstream in terms of understanding this is something we need to provide as part of a health care system.
Yes, the government, we passed this law called the Parity Act in 2008. It took CMS 10 years to write the rules for it, and now it's an obligation, but doctors still they don't know what to do with it, so we're trying to give them, in a 30-second snapshot, what they need to know to have a productive visit with that patient.
Well, we're here in San Francisco for the Startup Health Festival. What announcements do you have for your company?
We're very happy because Startup Health has led us into 2 partnerships just this year. One we're announcing today with LifeWire, and another one we announced earlier in the year. And without that connection to other entrepreneurs, we'd be out there by ourselves. And so being in a community, in a group of innovators, we have found to be just so dynamic and so helpful. And now, of course, we have a chance today to meet dozens of potential investors.
Well, that's great. Congratulations on those new partnerships, and I'm glad that being a part of the Startup Health family is really working out well for your organization.
It is. The coaching is good. We really appreciate that, and the meeting other people and being a part of a team that's going to make a change. We're very happy about that.
Well, we're here at the start of a new year, the start of a new decade. Anything else that we can expect that you want to achieve over the next 12 months?
Well, we've been introduced just recently into the student health services market, which is of the greatest concern. Colleges and universities have an accelerating problem with behavioral health issues, depression, anxiety, and suicidality. And we think we can make a huge difference in that market and prevent more problems. Our real goal overall is prevention, getting people identified early when they have mild to moderate conditions that are too easy to overlook. That's the main goal for us.
Well, I admire you for doing that. I'm glad that you're a part of it. Is there anything else you'd like to make sure that the audience hears about your business and what they can do to engage with your product and service?
Well, they can just go to psycheanalytics.com, and we'd be happy to follow up with them. And we changed our technology so we don't have to deal with EHRs. This is another big plus this past year. We go straight to the patient's cell phone, then it goes straight into our survey, and it goes straight to the doctor's office. And that's been a big breakthrough, because otherwise we had to put a tablet in the waiting room, and it was pretty awkward.
Right.
So this is really handy.
Well, they can find more at your website. They can also find more about this company at startuphealth.com. Wish you a lot of luck over the next 2 days and the year ahead.
Thank you very
Thanks so much, David. All right, our next guest, we've got Jennifer Meller. She's the co-founder and CEO of Navimize. Welcome, Jennifer. How are you?
Good. How are you doing?
Come on, grab the mic there.
Thank you.
Good to see you, Jennifer. Welcome to the Startup Health Festival.
Thank you. It's been great being here so far.
Did I say the name correctly? Navimize?
Navimize, yes.
Navimize. All
Yes.
right. Well, you are eliminating the waiting room. Tell me,
Correct.
first of all, before we get into how you're doing that, tell me about the big moonshot, the big problem that you're working to tackle.
Sure. So we're tackling access to care. So certainly waiting in a waiting room is a big problem because patients either will not come to the doctor's office if they know they have to wait and have to miss work, or they'll come to the doctor's office and leave. So that's the big moonshot that we're tackling.
Why is this something that you wanted to tackle? Why was this important to you?
Sure. So I'm a physician and I've been in practice for a long time, and this was always a huge problem in my practice. So I would see how when patients would wait and I'd run behind, that they'd get frustrated, it would frustrate my staff, it would be upsetting to me. So it's a real problem. It's an even bigger problem today for physicians with patient satisfaction now being linked directly to reimbursement, with online reviews. Now patients, one bad review can really hurt your practice and your reputation. So huge, huge problem today for everyone.
This is something we've talked about for decades. I mean, it's a subject of comedians and their stand-up acts and everything
Correct.
about waiting in the doctor's office and,
Yes.
and what that experience is like. So I'm really glad to hear that you're working to address this. So tell me a little bit of the how. How are you actually going to fix that?
Sure. So we've created a technology platform that integrates with electronic medical records. And it pulls data straight from the EMR, so there's no interruption to the physician or staff's workflow. And we're able to actually predict delays as they're happening in real time. Then our platform takes that information and transmits that to patients in text messages, so that if you have a 2 p.m. appointment, you'll get a text at 1:30 saying, hey, the doctor's a half hour behind, don't come at 2, come at 2:30. Patients are happy, online reviews improve, satisfaction scores go up, etc. And then our kind of big picture vision is, as we expand our footprint, we're gathering data to actually figure out how to intelligently schedule patients in the first place, to really optimize scheduling and efficiencies and eliminate waits from the bottom up.
Well, it sounds like a pretty all-encompassing solution. How difficult is it actually to implement?
So implementation, actually, once we're integrated with the electronic medical record, is pretty quick. It's a turnkey solution for practices and health systems where they flip a switch and it's on. It's really more of the administrative burden of getting through the health system, getting all the parties, legal and IT and all the health systems, all that stuff, to all the parties to agree to move ahead. Once the agreement's in place, it's fairly straightforward, technically speaking.
Jennifer, I understand you had a pretty good year in 2019.
We had a good year.
Can you tell me a little bit about that?
Sure. So big exciting news for 2019 is that we partnered with Athena Health. That was our first electronic medical record integration. That partnership gave us access to their 160,000 providers and 100 million patients. So we've got paying customers, our first revenues now, and we have a couple of exciting deals coming up for 2020 as well.
How do you top that? What a great year of working with Athena Health and
great.
getting access to all those potential customers. So
Yeah.
what do you have coming up for the next 12 months?
Yeah, so we have a couple of very large groups within Athena that look like they'll be coming on board shortly. We have some partnership deals with other companies that'll put us in multiple different health systems, and we're looking to expanding to additional EMR integrations for 2020.
That's brilliant. That's brilliant. Anything else you want to make sure that the audience can hear about your organization?
Yeah, we're excited to end waiting in the doctor's waiting room. Huge pain point for everyone. They can contact us just at info@navimize.com, and we're going to be adding a lot of exciting features as the year progresses.
Excellent. Well, they can go directly to your website. They can also find all the companies that we're speaking to over the next 2 days by going to startuphealth.com. So I wish you a very successful Startup Health Festival and a very successful 2020.
Thank you very
Jennifer,
much.
thanks so much
Nice
for joining
to be
me.
here. Thank you.
Cheers. All right, next up, we have Jacqueline Iverson. Jacqueline is the founder and head of clinical development at Senjam Pharmaceutical. Have a seat.
Thank you.
Jacqueline, thanks so much for joining me.
Thanks for having me.
Welcome to the Startup Health Festival. We're all about moonshots here. We're trying to take on big challenges and solve big problems. Can you tell me about what you're working to do?
Sure. Senjam Pharmaceuticals strives to improve people's lives
by creating innovative pharmaceutical products in the over-the-counter and prescription strength.
Okay, that's what you do. Tell me why you do it.
Well, we do it because we want to reduce pain and inflammation. And our lead product is a product that is not only a non-opioid pain reliever, but it also reduces opioid withdrawal symptoms. So we are hoping to reduce the largest opioid epidemic in U.S. history.
Can you tell us, those numbers are astronomical, and it's having such a huge impact in the U.S. and in other parts of the world as well.
Yes.
Can you give us some of the insight about where things currently sit in terms of the scale of the problem?
Oh, the scale of the problem is huge. It will probably take us another generation to get out of this mess. So, the scale of the problem is that, first of all, the access to medications is not very easy, whether it's geographic or financial in the United States. There are some products that are available that provide some relief, but still so much more research needs to go into the space before we are ever going to see people being able to reduce their dependence on opioids and lead a full productive life.
Now, you're the founder of this organization, SunJam Pharmaceutical, and the head of clinical development. Yes. So why did you decide to take this on personally?
Oh, that's a great question. So I'm a pharmacist by degree, and I also did research at Memorial Sloan Kettering in pain and pharmacokinetics. And it was at that time that I realized that we treat pain instead of trying to prevent it in the first place. I really wanted to bring pharmaceutical products to the market that people could take and they could reduce the effects of pain and inflammation that occur due to everyday events. This could be from the common cold, from the effects of alcohol, or from the effects of opioids themselves. So this was a way for me to use my knowledge and my head and my energy to say, let's bring new pharmaceutical products to the market that can have a mass appeal and be used around the world.
I love those sorts of stories with understanding that problem really, really well and seeing it firsthand. So was there an inflection point or something that happened that said, okay, this is it, this is my time, I need to go out and form SunJam Pharmaceuticals?
There was a time when I said, if I don't do it, somebody else will, and I want to be the first to do it. I thought that what we're creating is a bit old and stodgy, and we could create something for the next generation of people that is not only effective and non-opioid, a pain reliever, but can also have the lowest amount of side effects.
Can you tell me about the impact? You guys have do you have some results that you can share?
Yes. So for our products, they must go through the FDA approval system. And because we are repurposing small molecules, we already know that they are safe in humans. But we can use this expedited FDA process in order to get our drugs to the market faster. So we have a platform of agents for different indications, and we hope to start with our platform of agents and expand them around the world so that the greatest amount of people have access to them. And just recently, 2 days ago at JP Morgan, we signed an agreement with a South Korean company who wants to take one of our products from phase 1 clinical trials all the way to commercialization. We will be able to use that data in their clinical trials and bring it back to the United States for immediate FDA approval. So taking just one product from Korea that they plan to pay for, we are able to use that energy and raise more money in order to bring all of our products to FDA approval. We're very excited about that.
That sounds great. Congratulations on that.
Thank
now,
you.
I understand, this almost doesn't even sound true, but I understand you're launching a drug that addresses hangovers?
Yes, our first product, that's an over-the-counter product, happens to be a combination of two products that are very safe, that when you take it prior to drinking alcohol, it can reduce all the unwanted side effects of alcohol the next day.
That doesn't even sound like it could happen.
Well, trust me, we've tried it
okay.
And it works. So we're very proud of that product because it can
really help people who want to socialize during the evening, and yet they need to be productive the next day, whether they have family soccer games to go to, or whether they're at a conference and they want to enjoy a drink, but need to wake up the next morning and perform.
I know a lot of people who are watching this, it's January, they're probably wondering how they can get a hold of that. So what is the way that they can get a hold of that drug?
Oh, well, they can't until that South Korean company makes our product so that we can bring it to the FDA.
They're going to need to wait a little while.
That's right.
Okay. What does 2020 have in store for you?
Well, first of all, 2019 was huge. We received our first U.S. patent on this prevention of alcohol hangover drug. And we plan to follow up with 11 other countries issuing our patent. And this is very big because it's very rare for an over-the-counter product to achieve a patentability, giving us 20 years of exclusivity. So that was a great success in 2019. And in 2020, we hope that we receive a National Institute of Health grant for $3 million that will allow us to bring our product for opioid withdrawal into human trials by opening up an investigational new drug application. So we have a lot in store, and we are hoping to raise some money. And by listing our products, our platform of products on the Red Crow listing platform, so that individual investors have an opportunity to take part in the future of pharmaceuticals.
That's brilliant. Well, good luck with that. Good luck on the grant from the NIH.
Thank
I hope
you.
you get that. People can find out more about your company by going to startuphealth.com and search for SunJam Pharmaceutical, right?
That's it.
Excellent.
Thank
you so much for joining me, Jacqueline. Enjoy the conference.
Thank you.
Okay. Next up, here on the Startup Health TV, we've got Miguel Johns.
Yep.
Miguel, thanks very much for joining me.
Thank
Welcome.
you.
Got a mic there. Now, Miguel, you're the founder and CEO of Diabetes Care.
Yes.
Tell me about, first of all, tell me about your moonshot. What are you trying to do with diabetes? It's a huge problem everywhere. Tell me what you're trying to do.
So our moonshot is to provide high quality diabetes education to people worldwide.
Okay, that's a great cause. I personally have been affected by diabetes in my family, so it's something I know fairly well. My personal knowledge has gone up quite a lot. How are you actually going about doing that?
Yeah, so we have created a video-based diabetes education program that's powered by machine learning and delivered using social media.
Okay, tell me more about that. So is it, first of all, is it type 1, type 2, or all sorts of diabetes?
All sorts of diabetes.
Okay.
Our education is video-based, and so we're seeing a lot of diabetes programs, management programs, new devices, new technologies arising in the market, but there's still a significant problem when it comes to people being educated about what they can actually do about their personal situation. And so our goal is to create entertaining enough content that fits in today's modern communication world with bite-sized videos and social media so that people are willing to actually spend their free time learning about diabetes.
Well, that's great. So what is the business model behind it? Who's actually paying for the service and how do they actually access it?
Yeah, so we've got two tiers to our business model. The first tier, and what we're hoping to accomplish while we're here at Startup Health and in 2020, is based on sponsorships. So right now we're reaching nearly 1 million views every month on our content. So we're looking for partners in the device space and the medication space who have an interest in our audience, which are people with type 2 diabetes, mostly, a few people with type 1. Now, as we work through this process and understand how our technology can improve the lives of these individuals, we are measuring health outcomes. So the second tier to our business model is to pursue health plans as customers.
Excellent. So Miguel, tell me why this is important to you. Why did you decide to become a founder of this company?
Yeah. So my dad has diabetes, grandmother has diabetes, aunts and uncles all have diabetes. When my grandmother was diagnosed, she actually wanted to start living healthier, so she stopped drinking pop, but she told me she was going to be starting to drink fruit juice and chocolate milk. And so, unfortunately, we know those have just as much sugar as pop does.
Right.
And that opened my eyes to realize how uneducated people are around the topic and what's actually good for their health long term.
Now, you're focused here in the U.S. market initially?
So we started in the U.S. We are promoting a lot of both English and Spanish content in the United States. And as we started doing that, we had a rush of users come from across the border in Mexico.
Oh, okay.
And so now we've got 20,000 users in Mexico, and that's almost where about 950,000 of our monthly views are all coming from Mexico currently, where diabetes is just as big a problem as in the U.S.
Excellent. So how do people find out about this service and access it?
Yeah.
Who are listening, who might be interested in using it themselves or sharing it with people they know?
Yeah, so you can search our Facebook page, which is where our first touch point happens. We've got a Facebook page called Diabetes Care in both English and Spanish. We're putting out 2 bite-sized videos every single week on a wide range of different topics, whether it's medication, getting physically active, eating better. Those are going out on Facebook. They're reaching people with diabetes or an interest in diabetes. From there, we're engaging those users using Facebook Messenger and WhatsApp, starting conversations, gathering information, and then sending them down an individualized path that we hope will lead to better health outcomes. That begins with education, and in 2020, as we establish more partners, we'll eventually start feeding those users into different, more intensive programs based on that individual's needs.
Excellent. Make sure you hold that microphone in front
Yes.
so that everyone at home can hear you. So in 2019, Miguel, you changed the name from
Yes.
KingFit to Diabetes Care. Why the change?
Yes, just so it was a lot more focused on the end user. We wanted to get out of the world of just focusing on employers and health plans and large organizations and get down to the consumer where the action actually happens. We need the end user to take action before any of these programs can work. And so we wanted to make our name recognizable for what we were doing. And now, although KingFit is still the name of the organization, Diabetes Care is the name of the newest product that we rolled out in 2019.
Excellent. So we're here at the beginning of a new year, beginning of a new decade.
Yes.
What are some of the things we can expect to see from you over the next 12 months?
Yes, so to start this year, we're very, very excited because we're reaching 1 million views every month on our content, which was the biggest feat we needed to tackle to make sure that this product would actually work. Can we get people to engage outside of their regular entertainment hours? So that being accomplished as of today, our next step is to align ourselves with the right strategic partners who have a high interest in our audience so that we can work with them and continue to improve the lives of our users and our viewers by giving them the products and resources that they need to continue to take those next steps.
That's brilliant. Well, I wish you a lot of luck as you work to do that. It's a very important problem that you're working to address. I'm sure that this is something that you're building something that you wish your mother and father had access to some time ago, right?
Yes, definitely.
Excellent. Well, good luck in doing that. And people can find out more about Diabetes Care by going to startuphealth.com and searching for Diabetes Care. And they can also go to diabetescare.com.
.io.
.io.
Yes.
Diabetescare.io. All right, Miguel, thanks so much.
Thank you.
All right, just to remind everyone at home, you can tweet about this by using the hashtag StartUpHealth. I just want to also quickly announce our next guest, Dr. Samant Virk, who's the CEO and founder of MediSprout. Hi,
to meet you, Dan.
Doctor. Good. Thanks very much for joining me.
Sam is good.
Sam is fine?
Yeah,
okay,
absolutely.
very good. Very good. Thanks for joining me, Sam.
Thank you for doing this.
And my pleasure. So we're all about moonshots here
Yes.
at Startup Health Festival. That's one of the things that I love about Startup Health is
Yes.
the 25-year vision. Tell me about your vision for MediSprout.
Yeah, we started MediSprout because we wanted to create a solution that affects the things that are the biggest problems we have in healthcare, cost and quality, right? And so our vision is to do that through virtualizing healthcare. And our moonshot to do that is, we believe in 10 years, in the next decade, we can virtualize 75% of all medical office visits. There's no need that people need to go into their doctor's office anymore. We believe today it could be 1/3, but the way that we're building our technology, we're integrating devices and apps that patients use, so we can get their information together with the patient and their own doctor on a virtual call. And that's how we plan to affect that change.
So that's an interesting metric, that 75% of the in-person visits might
Sure.
go away over the next 10 years. What is the real impact of that, though? What does that mean to individuals, to payers, to providers?
Yeah, so the impact of that is, we think that the way that healthcare is structured now, affecting that change of reducing cost and improving quality is just really challenging. We believe this is a new mechanism where we can do this in a very thoughtful way. The one thing we know in healthcare that works in terms of quality of care is the relationship with your clinician. And if we can use virtual care to enhance that relationship with the technology that we have available to us, we think that we have a plan to show how we can reduce costs and by improving that continuity of care, improve quality.
That's excellent. And I understand you have partners that are working with you alongside this. Are you based in New York?
We're based in New York.
And you have a partner there as well, right?
Yeah, we have a partner there as well, meaning like a...
Mount Sinai?
Yeah, Mount Sinai
Mount
Sinai is our partner. We're really proud of that relationship. It was one of our early relationships. And we have a lot of traction there where we've shown cost savings and a lot of patient satisfaction and provider satisfaction. We also recently just signed a very exciting collaboration with a large community healthcare system. It's one of the leading community healthcare systems in the country, where we'll develop use cases to affect the other 1,500 community hospitals in the country, which are really struggling to provide care to their communities. So we're really excited about both the Mount Sinai relationship, which is evolving, and this new relationship we have, which can really help us create impact across the country.
Mount Sinai is an organization I've known for some time, and they're really thought leaders and doing a lot of great innovation. So congratulations on working with them.
Thank you.
So as we look look back on 2019, are there any big accomplishments that you want to talk about?
Yeah, a lot happened. For us, our existing customers doubled their volume of visits. We signed dozens of new customers, but the collaboration agreement I was just mentioning was one of the big things for us from 2019. It took a little while to get to a place where we signed that agreement because we wanted to make sure that we were both incentivized to accomplish the goals that we set out, which is improving continuity of care on a large scale, right? So with this collaboration agreement, we will create use cases with this community hospital system, which we can then go out to the other, as I mentioned, 1,500 community hospitals in the country and provide them a virtual care solution that they can implement as well. So that was one of our big accomplishments that we rolled out there. And specifically, there's a diabetic employee health diabetic project we're working on with them as our launching point. That'll be one of many use cases.
Brilliant. Sam, I'm curious about you personally. You trained a long time to become a medical doctor. This is not something you just decide, I'll just spend the summer doing this. You spent years doing that, and now you've shifted gears entirely to become the CEO and founder of MediSprout. Are you trying to get yourself out of a job? Was there something about trying to reduce doctor's office visits, and that's what you trained to become? What did you see or experience that you thought there's got to be a better way or a different way, and I can help build it?
Yeah, Dan, I think about this a lot. I love practicing. It was the thing that it drove me every day. I loved my training actually, and I loved my private practice and my academic practice. But when I realized, there was a frustration that I couldn't really define in terms of my daily practice. But when I realized that I was spending only 1/4 of my time actually providing care to my patients, and 3/4 of my time doing other stuff, I realized I wasn't effectively providing care to people, and I had to do something to change it. Myself, my colleagues, we are our best medical resource. I argue that we can provide care as good or better than any technology, but we're not being utilized. We have to do something to change that paradigm, and that's my mission. Through this virtual care solution, I think we can do it.
And what I love about what you're doing is that you are a doctor, so you experienced some of this firsthand, you've seen the problem firsthand, and I understand also that you have doctors that are helping to design the solution that you're working to do.
Yeah, we really are a clinically driven organization. My colleagues are physicians as well. We really try to vet down what the problems are we're facing every day and address them. When you sit in an office, and I say there's nothing like sitting in an exam room, sitting across from a patient, realizing I can do a lot more to help them, but the structure around me does not allow that. It's a powerful motivator. So that's why we have other clinicians helping us design and implement this tool, because I think that when you have that experience, it dramatically impacts the way that you can grow it.
Before I let you go, I just want to hear a little bit about what you have in store for 2020.
Yeah, so 2020 is a big year for us. We're going to be raising funds for the first time. Everything's been self-funded to date. And the reason we want to do that is we are ready to scale. We've really thoughtfully taken time to design this solution. We've said no a lot more than we've said yes. We have everything in place to push go. So our fundraising is a big part of this. And then as an extension of that is scaling. We're ready to scale. It's a software as a service solution that brings a consumer feel to the relationship between a provider and patient. And we're ready to grow that and change the conversation in healthcare from just creating solutions to creating solutions that actually, as I said, improve cost and quality of care, because we need some fundamental change, and 2020 will be the year that we do it.
Well, I look forward to hearing about your success over the next 12 months. Good luck
Great.
on the fundraise. And
Thank you.
for everyone who's watching this, you can find out more about Sam's company by going to startuphealth.com and searching for MediSprout. So Sam, enjoy the rest of the festival.
Dan, thanks
Good
so
luck.
much. Appreciate it.
Cheers. Okay. Thanks very much for tuning in here to Startup Health TV. Our next guest is Jenny Gallagher. Jenny is the founder and CEO of Helpful. Jenny, welcome.
Hi, Dan.
Hi. Welcome to the show.
Nice to meet you.
Jenny, welcome to Startup Health Festival.
Thank you.
So I want to hear about what you're doing at Helpful, but first of all, let's talk about the moonshot that you're under, the problem that you're trying to solve. Can you give us some insight about what it is?
Yeah, exactly. So Helpful, we're on a mission to wipe out loneliness and social isolation, and particularly for older adults.
Okay. Can you tell me why that was important to you?
Yeah, exactly. So it came out of my own personal experience. I was working in Washington, D.C. for AARP, and my mom was back here in California, and getting older, and she needed some help, and there was a day where I talked to her and she just confided in me how sort of lonely and empty her life had become despite having people who were coming in and helping her with day-to-day tasks. And so I had this idea from Helpful, and that was it. You know, that was sort of the inspiration I needed to start on this journey.
That's great. Well, I hope your mom is doing well. The loneliness issue is something that affects millions of people all around the world. It's not simply a U.S. problem.
Right.
And it really has a lot of effects. And even when people receive in-home visits or they're very connected with all the technology we have, we still can have feelings of loneliness. So can you tell me how you're actually going about solving that?
Yeah, exactly. So Helpful is a community network, and it's a place where members can both give and get help. And they share their interests, they share their experience, and just enjoy spending time together. And what makes us different from other options, like maybe an Honor or maybe a Papa, is that we run on time tokens. And time tokens are important for a couple of reasons. So first of all, they make the proposition of getting needed help much more affordable. Because every time one member helps another member, they get time tokens, and they can use those time tokens to get help. But they could also, for instance, you could help a neighbor get some time tokens and then maybe give them to a parent or a grandparent. Members also, they can donate them to our community fund. So we have a community fund for members in need. And also there's some members that say, look, I just prefer to buy them. That's always an option. But the ability to be able to get time tokens makes it much more affordable. And the second thing that's great about time tokens is reciprocity. So it gets to that point that you were mentioning about, still there's something missing. So not only can members get help, but they also can give help. And just to give you an example, so we have this member, she's in her 70s and she has this neurological disorder, so she's in a wheelchair, and she'd been using Helpful to get some help around her apartment and rides to appointments and that sort of thing. And she was asking us about this idea of giving help. And she said, look at me. I mean, what can I do? And we knew from her profile that she had been an editor for 30 years. And so we said, gosh, you live 2 miles from a university, and so I think there's this idea of superpowers of we may not think we have them, but everybody's got something. Right. And so now she's been helping members like with their first book and other kind of writing projects. And for her, it's not just about the time tokens she gets, but it's that satisfaction of connecting with another person and that comes from helping another. That's so meaningful.
That's so great. That's such a gift for both the giver and the recipient,
right, exactly,
isn't it? So how did you develop that sort of pay it forward model?
Well, I had been working at AARP, and there are a lot of great solutions out there, and I feel like there's a lot, I think of like Maslow's hierarchy, right? So there's a lot of great solutions that focus, we're here at Startup Health, on health. Am I well? Am I taking my medicine? Am I safe? Am I fed? But it's those higher order things that really make life worthwhile. And so, of being able to connect with another person, to be able to continue to do what you love, to continue to have this sense of purpose and contributing into life. And it just seemed that was often gets sort of pushed out, especially as people get older or if they're disabled. So this idea of, it's sort of through giving that one receives, if you will, right. that of being able to solve a problem in a way that just hadn't been really addressed as far as I could tell.
It also helps, I think, to make the giver feel needed or feel like they have those skills, it sort of
Sure.
revalidates
Yeah.
them in that stage
Yeah.
in their life.
Yeah, we have a lot of people that just do it as a convenient way to volunteer. And you know, you move to a new city, you don't know anyone, and you're looking for a way to be able to plug into a community, and they love it for that. They can donate their time tokens to our community fund, so it's kind of a win-win.
So any big wins from 2019 you want to talk about?
Yeah, so we completed our third pilot, which was with Banner Health, and we were engaging with their full risk Medicare Advantage population, and we're able to build on some earlier really promising data that we had that showed that members who were 60 and older who had used Helpful on a regular basis, so maybe once a quarter, were experiencing 20% lower outpatient healthcare utilization as well as costs after joining our network.
Wow.
So we were happy to get the additional learnings that we got from that pilot. We also were invited to speak at an international conference on social cohesion that was sponsored by Bertelsmann, their foundation, which is a global media company. And it gets to the point that you mentioned earlier, which is that one of the things that was so gratifying was the amount of interest we had from the participants and everyone there, literally from all corners of the world. So it really underscored for us this is not just a U.S. issue, it really affects people pretty much everywhere.
Yeah, and I imagine as people become more distant from their relatives as well, physically,
Right.
that it becomes more of a concern and an
families
issue.
are more diffuse, yeah.
Yeah,
My
so-
co-founder's parents are in India, you know.
Yeah,
and
wow, that's a real long distance. So what can we look forward to in 2020?
Yeah, so we are taking all the learnings from our three pilots and have been working hard, and we're going to be making some great strides with our product in terms of making some enhancements there. We're going to be releasing a new app soon, our iOS version of our app, and then we're also looking forward to taking our commercial relationship to the next level with some of our healthcare partners.
Excellent. Well, that's really good. And I know people can find out more about your organization by going to startuphealth.com and searching for Helpful. It's help-F-U-L-L.
That's right.
And I really wish you a very successful 2020 and enjoy the rest of the Startup Health Festival.
Great.
Thanks
so
for
much,
joining
Jay.
me.
Appreciate it. Thank
Cheers.
you.
All right, that was Jenny Gallagher, the founder and CEO of Helpful. Next up, we have Joseph Schneier. Joseph is the CEO and founder of Trusty Care. Joseph, thanks so much for joining me. Welcome. Welcome to the studio.
Thank you.
And welcome to Startup Health Festival.
Great, glad to be here.
So you're simplifying health and insurance decisions and making sure people don't go into bankruptcy because of health expenses.
Right.
That's a massive undertaking. The health expenses, especially in this country, are enormous. So tell me why you're doing that. What's the sort of the big reason why you decided to take this on?
I worked for about 5 years running an organization that was working with older adults. And throughout that time, I spoke to thousands of families, and seeing the financial devastation of older adults and their children and families because of out-of-pocket healthcare costs was really the impetus that got us started to start the company. Yeah.
Was there a particular inflection point or story that you just said, okay, now's the time, and were you waiting for the right idea to come along? Why did you decide to do it?
I actually had a personal experience that really brought home for me what this experience was like for these families. My younger brother got into a car accident, and he didn't have any health insurance. And we were at the hospital. He's in the ICU, and the doctors are coming in saying, "Hey, we might have to release him because he doesn't have any health insurance, and he's not going to be able to afford this." And the process of needing to get him signed up for Medicaid while he's sitting there and we're wondering if he's going to survive was the moment where all of these stories that people have been telling me came home, and I was like, whoa, this is actually a serious issue that somebody's got to work on. Somebody's got to try and solve this. Yeah.
Well, I'm glad you decided to take up that mantle and take it on. It certainly is a big task. So tell me how you're going to go about solving that. Tell me about your service and your solution.
So we're right now focused on the largest growing demographic in the U.S., the older adult population. So the first thing that we did was we knew that we couldn't solve everything. So where in the market could we have the most impact? We realized it's with this older adult population. So we've built out a system that we're calling a precision benefits tool. And what it does is it develops what is kind of like a credit score for you, and it's your health risk score. And from that, so we get this personalized view of who you are, what your desires are for your health, and then we match you to all of the benefits that are out there, the insurance products that are out there that best provide you coverage, which is the best first thing you need to do to reduce your out-of-pocket healthcare costs, is to make sure that you're not going to incur them. So that was one of the things that we learned was when we did a deep dive analysis that most of the costs were preventable if people had gotten the right products in advance of the problem occurring. Yeah.
Okay, so I understand you're working on some sort of TurboTax model. What does that mean?
Yeah, so it's similar to TurboTax. What did TurboTax do? They took all of these government systems and files and fragmented system and really simplified it so that for the consumer doesn't have to understand tax law in order to fill out their taxes. So in a similar way, we've developed a system that is the simplest thing for the consumer-facing portion of our product. It asks you a few questions, syncs up some data into our system, and then we automate providing you a really clear answer about what insurance choices you should make and what benefits you're eligible for in order to prevent incurring out-of-pocket healthcare costs.
So we just finished 2019. What are some of the things you're most proud of from that year?
So a year ago, we had just launched the company when we were at StartUp Health. And so this year, coming here to StartUp Health this year has been a real journey. And some of the things we're the most proud of, we're selling into a network of 10,000 brokers, a network of 400 banks and credit unions that are adopting the product. So seeing that usage has been really encouraging, and seeing that people are willing to pay for your product is really encouraging. But then there are the individual stories. So we had one woman who came to us, we put her father through the system, and they were able to identify several $1,000s of savings just by using our system. And seeing that impact on an individual life is really the thing that gets us going.
That's a significant difference for an individual, as you say. And while I'm really sorry to hear about what happened to your family and your brother specifically, I'm really glad that you tried to make something good out of that is allowing you to then have a positive impact on other people's life, like the example you just gave. So as we look ahead into 2020, what sorts of things can we expect now?
In 2020, we would like to be reaching at least 20,000 lives, and we think that we're on track to be able to do that. So for us, each individual, that's a big number, but each individual that signifies a whole network of families that will be more solid financially because of our products, and that's what gets us going.
Well, I'm glad you're working to make it easy. 20,000 is a big number, but when you take a look at the individuals that you're going to be impacting, there's a lot of individual stories that's going to have a real meaning, so thank you for doing that.
Yeah.
People can find out more about your company, Trusty.care, by going to Trusty.care, and also by going to StartUpHealth.com and looking for Trusty Care. So, Joseph, thanks so much for your time. Enjoy the rest of the festival, and good luck in 2020.
Thank you.
All right, next up on Startup Health TV, we have Jean-Ann Booth. Jean is the founder and CEO of Unaliware. Jean-Ann, please join me.
Hey.
Welcome, how are you?
I'm good, how are you?
Welcome to the studio. There's your microphone there.
Thank you.
Jean-Ann, you go
Yes,
by Jean-Ann?
I do, it's a Southern thing, kind of like Billy Joe Bob.
I get it. I'm from the South myself, so I get it. Jean-Ann, it's great to meet you. You're the founder and CEO of Unaliware, but you're built on voice-activated Kanaga Watch in order to give independence with dignity to seniors.
That's correct.
All right, tell me more about that. What is tell me first of all about the problem you're working to solve and the moonshot that you're aiming for.
Sure, so our moonshot is to extend independence with dignity for millions of vulnerable people all over the world. And what we actually focus on is independent but vulnerable populations, like my mom, who's the reason I started the company. Cognitively capable, but physically frail. That's what we do.
All right, so tell me more about that why. Was there a particular experience that you had with your mom that made you realize this is something you really needed to undertake yourself?
Yes, absolutely. So actually my background, I came into healthcare from engineering, 30 years in semiconductors. So I sold one company, one of my semiconductor companies to Apple, another one to Texas Instruments, and funny enough, after that I was retired. But I came out of retirement as my mom turned 80 because she was a model, she was very, very slender, and of course as she aged, slender became, well, downright skinny. And we looked at products in the marketplace and there wasn't anything that a model was willing to wear. They were just too ugly, too stigmatizing. And so Mom actually became our senior user experience advisor, and she helped us design and develop the Kanaga Watch. So the funny thing about our name and what all So we're the friend who speaks to you.
Excellent. Great name, great meaning behind that. I see you brought a couple devices with you, so can you tell me what
did.
you have? That's
I
great.
did.
You're the first person to bring something we can play with and look at. So what do we have here?
So what we have here is our new LTE, 4th generation cellular version of the Kinega watch. This is our 2nd generation. We're currently in market today with wearers ranging in age from 16 to 100, so it's quite broad. But this one brings us on to the 4th generation cellular networks in the
These are
US
both
and
the
Canada.
same? These are both the same watch?
Except for this one is champagne gold with a champagne gold band and button, and this one is black with a black band and button. And what I'm wearing is what I think is going to be the most popular, which is rose gold with a shimmer band. Ooh.
Oh, you had me at rose gold.
That's true. It looks like for a lot of people.
Yeah. Brilliant. So how does the wearer use this? How do they charge it? What's been the response from the people who are wearing this?
Sure. You know, the charging part is actually the reason I came out of retirement to start this, because it wasn't about just building a smartwatch for grandma, which is what Time Magazine called us. It was more about actually our patented battery system in the band that means you never have to take it off to charge. So it's easier when you're actually wearing it. I'm going to put the mic down.
Here, why don't I hold it for you?
There you go. And you just simply lift and take the battery out, put it on the charger, take one from the charger, and put it on the band. And off you go.
It's brilliant.
So, thank you.
That is a brilliant solution. That's great.
So what that means is that you never take the watch off to charge, which is super important in our demographic because the number one cause of injury death among seniors is falls, mostly in the bathroom, mostly at night. So even if you had a traditional smartwatch, it'd be charging when our demographic is most vulnerable.
Wow, that was a really clever insight that
Thank
you
you.
had in the design of that product, and I'm really glad to see that you've developed this, and it's very easy to do. You obviously did it very quickly here while you're on camera.
And after having surgery only a couple of weeks ago.
And with an incapacitated right hand. So tell me about 2019. What was 2019 like for you?
2019 was a development year for us because that's when we developed the 2nd generation watch. And it is very representative of feedback that we got from the 1st generation, the 3G watch, which was that one was lovely, but a little heavy. And so this one is very, very light. You picked it up, right? It's very light. Yeah. And it's stylish, right? So it comes in the different colors. It's very easy to use. And that's what this one's all about. That's probably not... Oh, it does fit you.
It does fit
Funny.
me, yeah.
Okay.
So there you go. Slender wrists, I guess.
Yes, you
so
do.
It's very easy to put on. Very easy to put on.
Yeah, and we have 2 versions of the mesh band. So you've got the plain mesh band there, and the one I'm wearing here, because of the fact that I had my surgery, is a little butterfly clasp. I'll give you this again.
Okay.
And you can just open it up
Brilliant.
or
Very
close
easy.
it, and there you go.
That's great. So I understand that you're now in pre-order. So everyone who's watching this at home and wants to get a hold of one of these great devices and actually see how light and easy it is to use themselves, they can actually pre-order these, right? Is that?
Yeah, we
is that correct?
primarily sell through the traditional channel for medical alert devices, but we do sell a little bit direct to consumer, and those are the pre-orders that are up on our website right now. It's unaliwear.com/order now.
All right, well that's terrific. Well, good luck in 2020 and selling lots of these devices. Sounds like you've come up with a great solution.
Thank you.
And it's really going to serve a lot of people.
Thank you so much for having me.
Good luck, Jean-Anne.
Thanks.
All right, so that is the end of my hour on Startup Health TV. Thanks very much for joining us. You can follow all the action on all the social media channels by searching for #StartUpHealth. Again, a reminder, I'm Dan Kendall, the host of Digital Health Today, and also the founder of the Health Podcast Network. Very proud to have over 20 different podcasts in the healthcare industry available on Health Podcast Network, including the wonderful Startup Health Podcast. So in the next hour, we're going to be able to have Saran Rothberg. Now, Saran I actually met at this very conference a year ago. She's a marvelous person, great human being, and I'm really looking forward to hearing her hour of hosting as well. She's the founder of the Comedy Cures Foundation. She has a really powerful story herself about her own diagnosis and the journey it's led her on, and the journey that she's helping to empower and inspire others through her work at Comedy Cures. She survived early stage 4 cancer, and she's a survivor, a health advocate, an author, a speaker, and a philanthropist. So don't go away, we're going to take a short break. When we come back, Saran will host another hour of great startups. Thanks for joining us.
Hi, I'm Saren Rothberg, and I'm a stage 4 cancer survivor. You are joining us at StartUp Health. This is an unbelievable festival, and we are live on StartUp Health TV. I've got unbelievable guests for you, so you're not going to want to go to the bathroom, you're not going to want to pick up the phone, you're going to want to watch. My first guest is Jerry Wilmick, and I can't wait to talk to Jerry because I have lived through the senior care drama. If you have a family member who's aging, or you're aging, or you love someone that's aging, you must hear Jerry. Jerry, thank you. This is so exciting. I want you to talk to me about CarePredict, because if I had CarePredict when my father and mother were aging, this would have changed my life.
Yeah, CarePredict is a product offering that allows us to measure the changes in activities and behavior of a senior.
Amazing.
And this senior can be living in their own home, they could be living in their own home getting home care, or even in a senior living community. What we do that's incredibly valuable is that we've been focused on measuring the activities and behaviors of seniors, which has been well characterized now to be the earliest sign of a health decline. You know, most technologies in the marketplace have been focused on vital signs and physiological measurements, which are great for diagnostic purposes, but our wearable, what it does, it allows us to measure the subtle changes in kinematics of the senior's wrist. And after training for 2 weeks, it knows mom is eating, drinking, washing her face, combing her hair. And so, for instance, if she was depressed, she would spend less time outdoors, which this can pick up the direct sunlight. Less time eating, maybe skipping meals, sleeping less or sleeping more compared to her baseline. All that information now can arm the caregiver to provide the best care possible. It's quite amazing, actually.
It gives you peace of mind. I mean, as a caregiver, there's almost an ability to rest because you are not checking on them 24 hours a day if you don't hear from them driving over. It allows you to know what's going on.
Exactly. You know, and now with, on average, a caregiver lives about 280 miles away from their loved one. So now you actually know mom's okay. You know, my grandmother right now lives in Cleveland, Ohio, and I would love to have this. You know, if she used this product, we would know. She's sleeping, she's doing well, and then, you know, if something does pop up, the system continuously monitors that and flags it, and then I would, you know, make a phone call, and then the whole family care circle could then get involved and make a decision to how do we help her.
So talk to me about statistics. Is it actually lowering falls or preventing hospital stays?
Yeah, so in 2019, we did a really detailed case study where we looked at 6 communities, over 500 seniors, 3 that had CarePredict installed, 3 that were in a control group. And then we measured KPIs month by month for 24 months. What we found is the CarePredict installed communities, we reduced hospitalization rate by 21%.
That's amazing.
Yeah, it's incredible. And the average length of stay was increased 91%, with also an 85-day increase nominally. Which is incredible because now those seniors that are living in assisted living are having a better quality of life, living in assisted living longer, and not moving to skilled nursing as quickly.
So the artificial intelligence and all the data gathering is actually giving seniors more independence.
Correct. Exactly.
And it's giving information not only to the family members, but to the medical care facilities.
Correct. So, you know, we've launched this product. We developed all of our predictive tools and models in the context of senior living, because we wanted to confirm, you know, if we predicted a senior was at risk for, say, a urinary tract infection, we then could have the staff in that community confirm that, in fact, they did have the urinary tract infection. So that's how we really validated our models. And now we launched our product at CES for direct to the home last week, and we won the CES Innovation Award. And yes, it's very, very exciting. It was awesome.
Bravo.
So now we're shipping directly. So seniors that want to age in place, 90% of seniors do, can now have our product wearable and the beacons in their own home. And loved ones like you can make sure that they're doing okay.
I'm so excited for you. Thank you for telling our community about this. Startup Health is excited to have you here. So what's next? Where are you going next with Care Predict?
2020 is a huge year for us. So we've begun now installing with leading home care providers and actually moving very high volumes. We're moving from 10 to 100,000 units. In the United States, we're also installed in Japan. So it's going to be a rapid year of growth for us, which is really exciting because more seniors will be able to use this product and their caregivers can be given that information to give that best care possible. So it's going to be a wild year. We're very excited to get the product in seniors' homes now.
I think it's going to become industry standard worldwide, and I'm so excited. And I'm so excited that my relatives can use this going forward. Thank you.
Thank
Jerry
you so much.
Womack, thank you for coming to Startup Health. We're
Thank
so
you.
excited.
We're having a great time at the show. Really
Enjoy
appreciate
the festival.
Thank you.
Okay, next up we have two incredible gentlemen who are changing the face of healthcare, particularly for the Black male community. I have Kevin Dender and Jeff Johnson. Kevin is the CEO of Henry Health, and Jeff Johnson is the Chief Cultural Officer. It is their mission to increase the life expectancy of Black men by 10 years over the next 25 years. Gentlemen, welcome to the Start Health Studio.
Thank you. Thank you for having us.
Startup Health Festival is so glad to have you.
Great to be here.
So tell me why this was an urgent message for you.
Well, 5 years ago I experienced a period of depression myself. And I saw 3 therapists before I could find a therapist who really understood me. And after I did, I started to learn as I talked more publicly about my depression that so many other men had suffered from depression too. And I have a public health background, and I was able to make the connection between the low life expectancy of Black men and unmanaged stress and untreated mental health issues.
But there's such a stigma with men and mental health, but particularly in Black culture about mental health.
Well, and it's been changing. And so younger generations talk about it with a level of freedom that our parents and grandparents never did.
Wow.
And there are books that are being written and athletes that are talking about it, and there's a level of transparency about it that creates an opportunity for us to talk differently. But I think more than that, people want to thrive. They don't just want to survive. And so if we're able to, in a real way, create a platform that speaks to a vehicle to them having power by operating in joy, then it's not just about therapy now. It's about how do I remove all the barriers to having the kind of life I know I deserve to have.
So if I am a Black male, which I'm probably the palest white person in the world, but if I'm a Black male, how do I access Henry Health? How do I get the services?
Well, right now we're providing services in DC, Maryland, and Virginia. And people can visit our website at henry-health.com. But our first version of our app is actually in the App Store, and we're awaiting approval. But we started providing services on a third-party platform this past spring.
So walk me through what it would feel like.
Absolutely. You want to take that?
So there's 2 ways to look at it, right? Ultimately, our goal is to provide teletherapy. And so you have the ability to go onto the platform, you're introduced to an option of therapists, you have the ability to go through the process of selecting a therapist, and then you're able to begin that process. But there's also this wraparound, because we understand that sometimes you need a bridge to get to that therapy. So meditations, daily affirmations, engagement to resources and information. But the beauty is that the content is so culturally specific that you see yourself in it. And I think that's been the problem. The clinical ecosystem doesn't tailor to some of those cultural issues that Black men specifically are dealing with, and so I don't feel like it's for me. So it's as much as it's the process of engagement and actually receiving therapy, it's also about, do I feel like this was made for me, or do I feel like it was made for somebody else? And that's why Henry Health is so important, because we're super serving African American men.
And I think one of the things that I also would pull out of that is what we're talking about is building community. Community around showing up whole, living with joy, and operating in power.
So explain to me how you're going to grow it. How is this going to expand?
Well, so we'll always be available in the Apple Store or as an Android product, but we're selling directly to employers, large employers, as well as universities. So we want to see this like as an offering in insurance through your payer or through your employer.
So is there going to be a Henrietta Health?
Well, you know what's interesting? I mean, when you think about the fact that African American men have the lowest life expectancy, imagine a world when black men are whole. And so Henrietta benefits when Henry is whole. And so if we can super serve men, then whether they are married or fathers or members of communities, when black men show up healthier, not only is there an impact to the broader black community, but there's greater impact to where we're working, job satisfaction and productivity. And so we really are trying to solve for trying to really create this space where not only do we increase life expectancy, but how do we increase the vibrancy of communities by increasing the potential of black men through health, through mental health.
And how early is this going to start? When could I start using your app?
Well, again, people...
If I were a black, if all my freckles ran together and I became male.
So again, we are providing services already, but we actually have a call for partners out right now in the DC, Maryland, and Virginia site. And we're looking for sites to start testing our app as early as March. And we'll test it over the spring months, and we're planning a full launch at the top of the summer.
For 18 and above, 21 and above, what's the age?
So, you know, it's interesting you would ask that
question.
because we are actually serving an adolescence right now.
Beautiful.
And so it's
Beautiful.
It's not just about black men. We're also going to be providing couples therapy as well. So, you know, it's really for black men and the entire community.
I'm so excited to follow your success.
Thank you.
This is so needed. You are answering a call. And the world thanks you for that. And Startup Health thanks you. It's such an honor. I'm going to say, I was there. I interviewed you right at the beginning. Really nice meeting you.
Thank you. Such a pleasure.
Thank you.
And thank you.
See you at the festival.
See you.
It's just one incredibly dynamic group of founders after the next. We're at the Startup Health Festival. This is Startup Health TV. You can hashtag us at #StartupHealth and let your friends and family know that you're watching history here. These founders are disrupting and changing the way we are going to be handling our wellness for the next generation forward. I just want to introduce you to an incredible female disruptor. It's wonderful that we have women coming up and really showing what they're doing to make the wellness experience better. This is Rachel Traubman. Rachel is the founder of Upside Health. She's designed an app called Ouchie, and I have a very, very deep personal interest in this app because I have a family member who lives with chronic pain and has had chronic pain since a child. So I can't wait to talk to her. If you know anyone who is managing a chronic pain situation or you're caring for someone, get them right now to this broadcast. Rachel, welcome. Hi.
It's great to speak with you.
You too. Welcome to Startup Health TV.
Thank you for having me.
I know that this started from a personal reason, as I'm so interested from a personal reason. Please tell us about how you got this Ouchie app.
Sure. So at Upside Health, we're dedicated to really scaling and eliminating the devastation of chronic pain from an economic and emotional perspective. And personally, I was in my early 20s when I was diagnosed with a painful connective tissue disease. But I found myself at an unfortunate, albeit kind of weird advantage in that my mom has lupus and my brother has cystic fibrosis. So I grew up in a family that lived with chronic pain, and I was able to quickly realize how you can live with a chronic pain condition and not be controlled by it, but also what are the best resources to help the whole health system be able to provide that great care that I was able to get.
It's interesting because your family normal was dealing with chronic pain. And for families where it just comes out of nowhere, they're blindsided and they have no resources. So the fact that you've decided to take your personal family journey and transform the experience for other people is magnificent.
Thank you. I mean, I think that, and it's obviously chronic pain is such a personal experience. There's no real one-size-fits-all to effective treatment and effective management, but it's also about resetting expectations. As much as that sounds terrifying, it's not. It's just learning, if my pain were 50% less, what would I do differently?
But having chronic pain is so lonely because it's not like wearing a cast. People think
invisible.
you're faking. It's invisible. So talk to me about what this app will do to help people living with chronic pain.
Yeah, so a lot of what we're doing these days is actually helping healthcare providers help the chronic pain patients, because they're stuck. They're like, their hands are tied in terms of what they can do during a 20-minute visit or less, a 10-minute visit, to effectively help it. And a lot of what the chronic pain patient suffers with is not just the pain itself, but the isolation and frustration that it causes. And so what we've done with our Ouchie app is give patients a place that they can find the resources that help them when they need it most. So responding to their particular needs at their particular time. And one of those key components is access to others. People who are going through similar challenges have found successes, and using each other for a support system in a place that's not just your family, where you don't feel alone, and where you can be seen for both your successes and your challenges. Because that's really important. You're going to have bad days, but also working together to find more good days.
What's interesting is that it's not just a digital diary. It takes it to a whole nother level. It helps you build a community. And I remember when my daughter was early in her experience with chronic pain, it was so lonely. It was so incredibly lonely. So to be able to talk to other people who have this invisible drama is so helpful.
Yeah, and to do it in a structured way, right? I think that sometimes forums or social communities can serve a purpose, but it can be limited in scope because there's no goal. So what is kind of missing from that? And so it's hard for health systems, payers, insurance companies to recommend something like that, because there needs to be that goal. And so to be able to create this environment where patients are all working together towards their personal goal, and to feel like there's someone always on their team 24 hours a day that is there to support them, is incredibly important.
So what data are you gathering?
Yeah, I mean, we're gathering a lot of data about the qualitative and quantitative impact of pain. So how it's impacting mood, sleep. We've gotten really interesting insights about the correlation between chronic pain patients and cats, or art, and the impact that various art therapies have had on the patients. But then also how pain score is impacted by introducing integrative wellness techniques into the pain experience, and how that's impacting provider workflow and their ability to deliver quality care that they want to deliver.
This is so helpful because it helps the patient articulate in so many ways what they're going through, and gives the provider an ability to help them in a much more reliable way. Because if you're having a good day or a bad day and you're at a doctor, you might not remember the other 5 bad days because you block it out. And now the healthcare providers can really see what's going on. And I think it would make treating so much more effective.
Right. It's less like, shooting dart bars against the wall and seeing with sticks. It's being able to get real-time analysis as to what's working for this particular patient, and be able to create customized treatment solutions, but also be able to say, look, when you've done these sleep stories, like, yes, you might not have thought your pain level was going down, but like, you've had a better sleep, your mood's improved, and let's do this together.
Incredible.
And so we're really excited about what's ahead and what we've created.
I'm so happy for you. I'm so happy that you're making this difference in the world, and I can't wait to recommend it to as many people as possible.
We can't wait to help support them on their journey.
Thank you so much, Rachel. I told you.
My new friend.
Yeah, I can't. I'm really making unbelievable friends here. Not only for my own personal family, to support my own personal family, but I help so many caregivers and patients through the Comedy Cares Foundation. I am a stage 4 cancer survivor and I am a caregiver of different generational family members living with health challenges. So the founders that are coming here to the Startup Health Festival are looking at real problems, and they are creating immediate solutions using the most innovative technology. So I am excited to have my next guest. Her name is Beth Sanders, and I am a storyteller, and I love storytellers, and Beth has created a way to improve the senior life and experience by storytelling. Beth, welcome to Startup Health TV.
Thank you so much for having me.
Yes, as a fellow storyteller,
yes.
I would love for you to tell your story and talk to us about Life Bio.
Well, thank you. So Life Bio is capturing life stories, and we're helping especially seniors. And we know that they are facing loneliness. They're also facing Alzheimer's disease, and those are a couple big problems we're trying to solve. But every person has a story to tell, am I right?
Yes, they do.
They do. And so we're just helping people reminisce and share and be deeply known, especially as they're reaching the end of their life or they're facing a life-threatening illness.
How are you doing
So it ties
that?
in healthcare.
How are you doing it?
What we're doing is we have a template that walks people through the biography process. What are the right questions to ask, right? It came from my own experience with my grandmother. I was asking her questions and I realized that I didn't even know my own grandmother. And how many of us feel that way, like our own family is a bit of a mystery to us. We only see them in one way. And they're a whole person.
So when is the right time to do this?
It's now, immediately. People should not wait till they're 92 to tell their story. No.
And how would they go about doing it?
So lifebio.com is an online tool that families can access, or tech-savvy seniors can use it in an online or web or app. They can even journal it, and we even interview people over the phone if they can't do the other methods.
Are these stories kept personally, or do you have the option to put them out to the world to see?
They're primarily for your close family and friends to know you. And let's say professional caregivers are delivering care to you, they should know who you are. And in the case of like Alzheimer's disease, that the adult child wants to be sure that the caregivers know mom or dad like a whole person, right, in care. And I think a big thing too now is loneliness. Storytelling is a natural way for people to connect. So we're working with a payer right now to solve the problem of loneliness and really connect people to each other through storytelling.
You call it reminiscence therapy?
Yes.
That's how, so they start to reminisce about their lives, and it makes them feel
better.
Better.
Yeah, they're more, they're happier, they're less depressed, they're less lonely. Loneliness leads to all kinds of other problems, right? So we're doing all we can
and
to
you
connect.
see a lot in the senior community. I work a lot in the senior community with storytelling, and you see that the short-term memory is not there, but the detail in what they did at their prom or who was their first kiss is in the greatest of detail, and it's so exciting. And I see that the seniors come alive because they feel empowered by the fact that they can recall, whereas they're struggling maybe to know where they put their keys. So there's an empowerment factor to what you're doing.
You're right. You're right. And isn't it something to say, walk me through your neighborhood. Tell me about your home as a child. What was your first job, and what was a day like at your work? Like you said, it empowers them to say what they can do.
What are some of the other questions that you ask?
People are very important to them. They'll talk about their grandparents, of course. And as a grandparent, to have them talking about these people that have been really important in their life. They love to talk about how they met their spouse, what they would do with their friends when they were little kids. We are all storytellers at whatever age. and it's time to tell the story.
And then do they get it in written form or audio form?
It can happen in any of those ways, audio, video, printed. We actually print people's books for them. So imagine walking into a nursing home and seeing a bio for each person, or having a book in their room where they can share who they are with the staff in those buildings.
So personal, so valuable, and so intimate. It's such an intimate way to impact mental health among seniors.
Right.
Thank you so much.
Thank you.
Thank you, Beth.
Thanks for the interview. Wonderful.
You are joining us at the StartUp Health Festival. You are watching StartUp Health TV Live. I am completely blown away by the guests that I'm getting to interview today. And I have somebody that I am so interested in speaking to, because he turned his early childhood diagnosis with dyslexia into being a superstar in neuroscience and impacting brain health in a way that's staggering. And I am a retired special ed teacher with an expertise in learning disability and dyslexia. So to watch somebody that I could have taught shine in this field and create so much impact, it's such an honor. So I'm going to introduce you to probably the smartest person within 10 feet of me, Adam Simon. Adam.
Hi, how are you?
Nice to meet you.
Hi, how are you?
Hi, just to know that as a child you were struggling, and to see what you've done to the world. Please tell us about Sorora.
Sure. Our moonshot is for brain health assessment, and as a biomarker expert at Merck, Big Pharma, I learned that we were doing things in a way that didn't make a lot of sense to me. We were taking snapshots and images of the brain and trying to diagnose what's going on. So my company Sorora is trying to transform brain health assessment using biosensor technology that makes movies and dynamical measurements rather than static images of the brain.
So this is real time.
Yeah. So if I were to show you, I'll put the microphone down. This is an example of a single lead of EEG. We can build in an accelerometer, we can add a microphone, we can build an array of biosensors that will allow us to characterize what is going on in the brain of a subject while we give them a series of tasks. Much like a treadmill test for the heart, we do the same thing for the brain. We'll probe the visual cortex, we'll probe the auditory cortex, prefrontal and executive function, and by probing different circuits, we're trying to figure out where is the dysfunction that a given individual might have.
So we come from a family of people that get concussions.
Okay.
Way too much.
Yep.
Way too many concussions.
Sure.
Would this help?
Yes, so we started in Alzheimer's disease and then made a pivot to traumatic brain injury and concussion. And so we are developing the clinical evidence that EEG in combination with eye tracking, in combination with voice recognition, can lead to an ability for a clinician or a physician to more accurately diagnose a mild concussion that might have gone undetected, especially if the subject is cheating to stay on the field or cheating to get out of school and not have to go to the classroom.
So is this going to become state of the art? Is this going to be in every hospital or down to every doctor's office? How is this going to be
Our real
used?
aim is to democratize neurodiagnostics. And so we'd like to get our platform and our inexpensive devices into every family care physician, every pediatrician's office, the school nurse's office. So if two third graders collide on the playground at school, there's a way to have an objective assessment as to whether there's a traumatic brain injury or not.
It's so exciting to me that your fascination with brain health came from being a child.
Yeah, It was a real struggle being dyslexic. I got ridiculed and bullied in first and second grade.
I'm sorry,
No,
by the way.
that's okay.
As a retired teacher, I'm so sorry.
No, but it is what it is. And but at this point, my dyslexia has turned out to be a gift because I see things in 3 dimensions. I don't see limitations, and it gave me a very nice technical quantitative ability to think that I probably wouldn't have if I didn't have the reading disability that dyslexia gave me.
I want to play this interview in every learning disabilities classroom because it just shows that you can take a challenge and turn it into the greatest gift, not only to your own self, but to society.
Absolutely. I view my dyslexia as a huge gift, and if it weren't for that, I don't know if I would have gotten a PhD from the University of Chicago in physics, but that's what propelled me through all the way.
So what would the experience be like for the person, the actual patient that's using this?
Yeah, so we have about 11 clinical studies, and what the subject would go through, right now it's laptop based. They would sit in front of a laptop and answer a series of questions. They would have tasks with things moving on the screen. They'd be wearing a headset. We'd have verbal questions that they would verbally respond to, and the microphone would pick up not only their words, but their ums and hus and other audible but non-verbal cues. We could then simultaneously measure 3, 4, 5 different biomarkers while they go through a battery of tasks. We might have them stand and lift 1 foot and have an accelerometer in the headset, and instead of having a trainer or a coach evaluate how many mistakes you made, we could digitize at 100 times a second and get a very objective measure of your postural stability. So it would be it would be very easy and pleasant for the patient. It's all non-invasive, and most importantly, we want it to be doesn't require cooperation. It's sort of like a circuit, the brain being, we want inputs and we want to measure the outputs. And if we can figure out where that is disconnecting, then we can make a much more accurate diagnostic report to give to that physician or clinician so they can make a more accurate assessment of what's going on in the brain.
Thank you for doing this, and thank you for being able to explain it. Some high technology, right? Deep, big science, and bringing it down so that everybody in the startup health universe can really understand the innovation that you're working on. I appreciate it.
Absolutely, and thank you for the opportunity to speak with you.
Thank you,
Greatly
Adam.
appreciate it. Thank you now.
Adam Simon from Sorara. So that's it for me, but we've got so much. Oh, we have Asaf came. Yay! I was hoping you would come. Thank you. I get one more victim. Hi, Asaf. I'm really excited to introduce to you Asaf Shalvi. I was looking for you. I didn't see you there.
Right here, right
Perfect.
Here. I was looking at you.
And you're from Philly. Your company's in Philly.
Our company is in Philly and New York.
Philly and New York. I'm a Philly girl, so I'm really excited. I saw where your offices are. This is so important because we were just listening to upstairs on the main stage the crisis in nursing and in support care and healthcare. And SwiftShift allows incredible innovation to happen so that there's less burnout and there's a better matching of healthcare providers. And I have hired way too many healthcare providers in my life as a stage 4 cancer survivor and also as a caregiver, and had so many bad matches that I couldn't wait to talk to you because I want the world to know how you are going to prevent burnout and also the better synchronicity of caregiving.
Cool. So first of all, before I start to talk about SwiftShift, I just want to take the opportunity to share how Startup Health really changed the trajectory of SwiftShift, because we are in a Startup Health event. When I joined Startup Health 2 years ago, we were short on cash. The harder I worked, it seemed that the less progress we were making. Our technology wasn't delivering to our customers the kind of value we wanted to get. And for the first time in my life, I didn't manage to solve problems. And then we joined Startup Health, and the first workshop I remember and the scorecard surprised me. It wasn't about financial metrics or strategy or go-to-market. It was about mindset. asking ourselves as entrepreneurs, how are you doing? Are you taking care of yourself? Are you creating positive relationships? Are you creating relationships at all? Are you making sure to take care of your private lives? And that was a light bulb moment for me. I decided to really invest in my mindset. I started to go to the gym, spend more time with the family, create real relationships with my clients, with my employees. I realized I was very transactional and short because of the stress. And I think it's happening to a lot of entrepreneurs when their venture becomes real. And there's people now that are relying on you and investors that are watching you. You start to operate from a level of fear. You're afraid to lose what you have. And when you as entrepreneurs start to make decisions based on fear, I think this is the end of your moonshot, because it's all about taking risks and realizing there's an opportunity and going after it, full speed ahead, no matter what. In the last 2 years, I've changed the management team of the company, brought in a machine learning expert from one of the top ride-sharing platforms in the market, completely rewrote the platform to be machine learning powered and enabled, signed a huge partnership agreement with one of the large home care providers in the country, and the business is growing and is on a trajectory to actually deliver on the moonshot promise. So thank you for Startup Health, and credit where credit is due. To your question, it's all about relationships. Home care is a tough business. Doesn't pay very well.
Very big burnout.
And the care teams don't know each other sometimes. They go in and out of their homes and they just leave each other post-it notes sometimes about what the patient went through. Did he eat? Did he get medication? And there is also no relationship with the agency, with the case manager. There's no real relationship. It's phones, it's text. They tell them what to do and where to go, but there's no real connection. And it doesn't work this way. People that work in healthcare, in home care, get their satisfaction, wake up in the morning and smile when they know that they help somebody, when they feel that they're part of a team, when they can see how their work delivers results. And our platform does exactly that. We have a platform that allows caregivers, skilled or unskilled, to join the platform, create or join a local care team, get a license and employment sorted out with a partner agency. This is the partnership I just mentioned. We have partnership with agencies that hold licenses across 25 states and manage their clients as a team together, have a relationship with the client, with their families, and with their peers. And through that, create positive impact on the client and on themselves, and progress in their career and own their little micro business. Does that make sense? Or
yeah, what I find so interesting, just having hired so many healthcare workers, is that
for yourself or for others?
Myself, yeah, as a stage 4 cancer patient and now survivor, and also as a caregiver, is that what you're doing is you're professionalizing it, but at the same time it's very personal. And I think that balance between personalization of healthcare and yet the professionalism that you're creating and the consistency is an incredible innovation.
What was the biggest pain for you when you were receiving healthcare, home care specifically?
So as a patient, you're exhausted and you don't want to have to retrain every person.
So it's
that
the turnover,
comes into
the turnover and the lack of reliability, consistency.
100%. And if somebody if somebody has to be replaced, the amount of energy when you're not feeling well that you have to, give forward to get that person up to speed.
Because nobody really knows you consistently. And this is where reliability comes from. Reliability comes from relationship. If your caregiver cares about you, then they will make sure that they will stay with you for as long as they can. And if they have to be replaced, they will make sure that this replacement happens in a way that helps you, because it's their name on the door.
But it's also in the reverse, the stress of the professional caregiver. You are helping to break down that stress because they are so much more prepared when they show up for that particular job.
Yeah. And is it as simple as a group chat that people can say, listen, I had a tough shift and it was horrible, and everybody says, here is a hug.
Yeah,
or,
and it's not just a scribbled note on a little lined piece of paper.
Yeah, exactly. So it's all about creating that relationship to drive quality, reliability, and eventually helping people consume less home care because you work with the client to put targets and hit them and make sure that you're delivering on your goals, on the client's goals.
Fantastic. Thank you.
Thank you.
I'm really glad that you came to Startup Health and you told us your personal journey with how impactful Startup Health has been on your moonshot. We're excited to see how far you go now that your culture and your internal workings are flourishing. But thank you so much.
Thanks for the opportunity. Thank you.
I'm Saren Rothberg, and you have been watching, hopefully, and totally enjoying and learning from Startup Health TV. We're going to have more streaming over the next 2 days. There is an incredible lineup of people that are coming that you can learn from. Thank you for joining us. Saren Rothberg for Startup Health TV.
Hey, this is Marty McCary here in San Francisco at the StartUp Health Festival. I'm learning about new companies, meeting entrepreneurs, and we've got a bunch of them right now. Right now we've got Kelly Thomas Drake. Come on up here, Kelly. Love to learn about. Good to meet you.
Nice to meet you.
Thanks for being with me. Have a seat, and feel free to use this. So tell me about your company. Now, your company is about sharing electronic health records and information, something we haven't really gotten right in healthcare. Tell me what your company, it's called My Purple Folder. Tell me what sort of got you into this and what it does.
It should be easier to be a patient and or a caregiver, as well as a physician. What we do is we create a universal digital healthcare master key for patients to easily and seamlessly navigate their own healthcare. So the reason it's called My Purple Folder is because I kept all my grandmother's information in a purple folder when I was taking care of her when she had cancer. And this is in homage to that. The majority of my family are all physicians, and they've been turned into input specialists, data input specialists, rather than specializing in what they do. Patients and caregivers, their family members, have been turned into, like Atlas, file cabinets with a bureaucracy of information. And what we're doing is we're simplifying the process for all of them, all in one stop.
So you got into this because your grandmother was sick or dealing with some conditions.
Yes.
And in order to keep track of everything, you decided to literally get a purple folder and keep all her records in there. And then you thought, hey, there's a startup company that could address this.
And what's interesting is that I didn't think of it in terms of business. I thought of it in terms of looking for something that would help me in my time of need at that intervention. And instead, it turned out where everybody needs this, especially with chronic illness, disease, especially with just dealing with different things. I don't have any chronic illness, but yet I have about 17 different electronic medical record systems that I have to interact with, just because various physicians everywhere have their ways of wanting to decipher information. We leverage and connect existing patient data, and we don't have to store the information either. We make it visible. We use a little bit of blockchain. We use a little bit of AI. We use a little bit of... You also should not have to be a medical laureate, Nobel laureate, in order to understand what's going on with you.
I see you've got the purple flower there, and that's in line with the company My Purple Folder.
Yes.
So tell me, is this compatible with all electronic health systems out there? And how's it different from what's out there now, like Apple has their own little product, and how is this different?
So the way that it's different and the unique identifier is that we don't just list out medications, we don't just list out diagnoses and treatment plan, we make it visible so that you can interact with it. And so in an already traumatic instance that you're going through with yourself or your family member, you don't have to feel intimidated and or stupid in that instance. You can just tap and click and see what's going on with yourself, with a family member. You can share through an encrypted expiring link. We connect to the back-end electronic medical record systems as a proxy, and we don't have to store the information.
I see.
Because we are not another redundant electronic medical record system. We leverage and connect so that you don't have to. You should only have to just deal with being a patient.
So let's say you're a non-Silicon Valley person.
Yes.
You don't really know what encryption and blockchain means.
Okay.
Explain in everyday terms, this is an app that does what and how do you use it?
So My Purple Folder is an electronic healthcare mobile app system that helps you simplify your healthcare life.
Do you actively put stuff in there, or does it directly connect to electronic health records?
So what a patient does is they connect to My Purple Folder, they establish an account, we create the universal digital healthcare master key, and we do the heavy lifting digitally because it's a bidirectional data system. So that abstraction layer is such that wherever you have care providers, wherever in your healthcare universe, we will connect to that. And every time you look at it on your phone or your personal device, you see everything in a centralized way. It's visible, it's easily clickable, and you can engage with your illness.
I like easy. I like that part of it.
Oh, it's the easy patient care button. And so therefore, you can just do that through establishing an account. We do the heavy lifting. You don't have to do anything but just let us know where you have disparate healthcare system records.
It's designed to help.
That's it.
Designed to help.
It's designed to simplify.
I like it. Kelly, thanks for explaining that. Great to meet you.
Nice
Thanks
to
for
meet you
coming
as well.
on. Great, thanks. I'll take that mic from you. Thank you. Great, good to meet you. Okay. Great, so we've got some more folks, so don't go anywhere. We've got, great to see you, Kelly. Thanks for being here. You can walk off, yeah. We've got Jam Gachar. Jam Gachar, got it right. Good to see you. Great to be, thanks for being here. Good to be with you.
Thanks for having me.
Thanks. So tell us about Think, which is your company and what you're trying to do in healthcare and how you got into this.
Yeah, so Think's all about attention. And so
attention,
how you pay attention. We're looking at people's eyes.
I have very little attention.
We're going to help you.
Okay.
So you look at people's eyes, see they're paying attention. So we're interested in objective measures for attention. Right now, it's very subjective. And attention-related disorders can affect everything from ADHD to concussion to dementia. It's a very prevalent neurological problem that we don't have good objective measures with.
We don't really measure your attention span.
Right, span, how well you pay attention, which can get affected by sleep deprivation. A lot of people are on the job sleepy and they don't perform well because they can't pay attention.
I've always gotten a full night's rest every night of my life, so I'm not really familiar with what you're talking about, but go ahead.
Yeah, I'm a surgeon as well. So we have residents, and you know what happens to residents, right? Okay. So Think is really has the analytics and the platform to measure attention very quickly with eye movements. And we basically use VR goggles with eye trackers in them. And we present a dot going around a circle, and within 60 seconds of putting the goggles on, you have a full report of how well you pay attention.
So it's like an eye test, but for attention.
Yeah, most of your eye tests are static, right? The thing is just there, it doesn't move. And you know, you go to the DMV to have your eye tested. Well, most things in life are moving, they're not static. When they move, you have to predict. And what we're measuring is prediction, which is really attention.
Okay.
And you have to be in the future to interact in the present to be aware of the past. Because it's impossible to be in the present.
What do you use this information for?
So we use it right now for concussion. So we're doing a lot for eye tracking impairments, FDA approved for eye tracking impairment. So we have it right now. All the Pac-12 schools use it. We have a lot of other schools.
For sports injuries,
sports injuries,
trauma,
it's a platform, concussion,
motor vehicle accidents,
and
falls.
Yeah, a lot of hospitals, MGH, Cleveland Clinic, Stanford.
Okay.
They're all using it. We have teams using it. We have NBA. We have it. They're really using the NBA is using it for performance.
Wow.
So once you know somebody's attention, you know, we can pick players and we can actually try and improve their attention. So a lot of different uses for this technology.
Wow. Is it done right after the injury, or is it done more to follow patients on a chronic?
No, we can do it right away, right after, but it can also work any time afterwards as well.
How did you get into this? What type of surgeon are you?
I'm a neurosurgeon, so I operate in the brain.
Is that brain?
That's brain.
Okay.
So my DNA is traumatic brain injury. So I'm also president of the Brain Trauma Foundation. We do the national guidelines for traumatic brain injury.
Oh, great.
But part of traumatic brain injury is concussion.
Yeah.
And so we notice a lot of people with concussion have attention problems. And we can measure it very quickly with eye tracking. Now eye tracking is known to be a parameter that's changed after concussion. So you should be measuring eye movements, you should be measuring vestibular function, and you can correct it. So the Stanford athletes, I take care of all the Stanford athletes, generally within a week they're better because we exercise them, we give them treatment for their impairments, whether it be vision or vestibular problems.
Would you say this sort of applies math and science to what we've been kind of subjectively doing for a while?
That's a very good way of putting it. A lot of the neurological examinations, sort of subjective way of trying to get at people's orientation and attention, this provides the metrics. And we also can give feedback and improve your attention.
Interesting, wow.
So you're welcome to come anytime.
Okay, thanks. Well, maybe I might need it.
Okay.
So that's great. Jam, great to meet you.
Great meeting you
Thanks
too.
for being on the program here.
Thank you.
Cool to learn about new things. So
Thank you for having me.
My pleasure. So it's great to learn about so many interesting innovators out there, docs and everyday folks. So now we're going to move on to Javier Cardona. Javier's got some interesting work. Actually, Leon Eisen. We're going to jump to Leon Eisen, CEO and co-founder of Oxytone. Great to meet you. Marty
Great to
McCary,
meet you.
nice to
Thank
meet you.
Nice to meet you, actually.
Great. So tell us a little bit about how you got interested in this space and what does Oxycone do?
Actually, our mantra is access to care. And the main problem that we all talk about patient satisfaction, but we're not talking about physician satisfaction. Physicians get overwhelmed, and when patient became patient immediately paired with physician or physician's group. So in this case, we have to talk about satisfaction of both sides of healthcare delivery. And our company just closed this loop. We deliver for the patient real-time care, immediate care, and we deliver for physician real-time information. We call it information care circle. And this is what we are doing. We developed world's first FDA-cleared pulse oximetry monitor and then extended to more vital signs. So actually today, we take almost all parameters, vital parameters from the hospital shelf and put on wrist.
Were you looking at your own pulse oximetry?
Yeah, it's not only pulse oximetry, it measures blood oxygen saturation, pulse rate, heart rate variability, skin temperature, and soon we add pulmonary rate. So actually having all these vital signs in real time generated by the patient, we can apply machine learning algorithm and we build patient baseline and we can identify any deviation from the baseline in real time.
So is this the product here? You're wearing it now? Is it this watch or is it simply the backbone to it?
This watch, so we start sales half a year ago. And currently we have more than 25 big companies and healthcare systems as our clients, including payers, hospitals, sleep monitoring companies. So actually our main target market is COPD patients, CHF patients, sleep apnea, and actually we entered into occupational health business as well.
I see. How big of a problem is undiagnosed sleep apnea?
Actually, we deal with diagnosed sleep apnea. So when patients become diagnosed with sleep apnea, they can use our product to identify sleep apnea. But most important, today, all sleep apnea measurements happen at night. But there is no any understanding why sleep apnea event happens. And we found that it happens like result of the stress day before and how it influences on patient day after. So we have all the information around.
Can you look at someone's information and say, here's a stressful period in their week?
Exactly. This is what we deliver, but we correlate this information with other vital signs. So we give physician full information about patient in real time. So our mission, and we call it, unlock patient intelligent data just in one click on 1,000 patients just in one click. So a physician doesn't have to be overwhelmed. He can just unlock data, get one number, and decide on patient intervention. And by the way, in a second, we have any information how this intervention happened and what results. So very unique. We're only worldwide doing this. Again, this is a FDA cleared product.
Okay, good. How's your oxygen saturation doing right now?
Very well, 99%.
It's a low stressful interview, isn't it?
Yeah, but I'm okay. I get used to it. And what I have to add, we are Israeli-US company, so all development of this unique product happen in Israel, and sales office here in the United States.
Okay, great. So if you have a device then you were looking for the software, the systems to monitor. That's where your company comes in.
Yeah, so we have all solution. We call it full end-to-end solution. So other company have only software. They're looking for data. We generate data by device. So we have three innovations: device, if they clear it, then data is goes to the cloud, and physician has 1,000 patients just on one page and can watch in real time what happened with these patients from the home. So it's the same monitor like in hospital, but from the home. That's amazing.
Okay.
And the next innovation is our machine learning algorithm that enables to identify any deviation from the patient baseline and automatically alert any stakeholders about what happened.
Right. Thank you so much, Leon, for explaining Oxytone to us. Really interesting. Good luck with your company.
Thank you. Happy to be here.
Thank you.
Thank
Good
you
to
very
see
much.
you. Okay,
Thank
take
you.
care. All right, so now we're going to go on to meet Yossi Shohak. And Yossi is Javier. Javier's back with us. Okay, Javier, come on down here, Javier. Javier Cardona, I'm Marty McCary. Good to meet you.
Good to meet you.
Looking forward to learning about your company here. So I understand you're working specifically in the field of this company, Undoctrace.
Yes.
And you're based in Bogota, Colombia. I love Colombia. The Bogota folks are wonderful. I've spent a lot of time there. Fundación Hospital, wonderful place. And you're working on a technology that can help patients get care in other places. Tell us about it.
Yeah, exactly. That is exactly what we do. The problem is that in Latin America, access to healthcare is so difficult. It can take you from a day to a week to just talk to a doctor. So what we're doing with our technology is basically enabling AI to optimize doctors' times, but also improve user experience by symptom assessment correctly, because we now know that if we help you identify your symptoms correctly and tell that to the doctor, you'll get a better outcome, medical outcome, right? So instead of a regular consultation that, let's say in our countries take 10 to 12 minutes, the first 3 or 4 minutes are what do you have, for how long, have you also have this or that. So all this symptom assessment is done by the platform itself. Then a triage is performed inside the platform, and the doctor, which is going to talk to you, already knows all this information. So we basically optimize doctor's time, and as I said, improve user experience, and that's why we're able to serve 300,000 people every month, and we keep on growing.
Wow, so you're doing very well in terms of your reach and number of patients and doctors that you're able to help. You know, I've often thought it is kind of strange when patients come in to see you that we ask questions that could be asked before, and we could have a more efficient assessment. For example, sometimes I'll ask a patient, how old are you? Well, that information could be filled out by them before they come in, and instead of spending that time, you know, pulling it out of them, and then sometimes they tell you, well, take a guess. Higher. No, it's lower. No, it's... We could be a lot more efficient with information that's shared quickly. It sounds like that's what your company's doing.
Yeah, that's like on the demographics, that's one part. But also, let's say a patient comes and say, I have a headache. So the doctor is going to start like, where the hell do I start, right? Mm-hmm. So the platform is performing, so you have a headache, in the front part, back part, or upper or lower back pain. So it's a completely different story. So that's the whole AI symptom assessment that we're doing. It's built on a medical knowledge graph that we're building for a couple of years after serving thousands of questions from users.
And it doesn't replace the doctor, it simply uses screening questions to allow the doctor to be more efficient.
Exactly. Basically what we're doing is, since we're tackling the access problem, what we're doing is amplifying the doctor's capacity. So we're able to serve more and more people. And not only symptom assessment, but then triaging and pre-diagnosis. So the doctor is being assisted by the technology. And basically we can serve more and more people.
Is this your work, Undoc Trace, is it mostly in Latin America or is it available in the United States?
Well, it is for Spanish speakers. So it is, we're out of Colombia, but we're serving around 200,000 people in Mexico. We're serving around 50,000 people a month, Spanish speaking in the US, which is a big market. We're talking about 50 million people Spanish speaker in the US. So yeah, we're tackling the Spanish speaking population that is roughly 500 million people around the world.
That's great. What are your dreams? What would you like to see done in the next year?
Well, this year we want to see the scale for platform. We're ready to scale. A year ago we were serving 50,000 people. Now we're serving 300,000 people a month. So my guess is that we were able to serve 2 million people a month on our platform.
And what have you learned in the iterative process of putting this out there in the market, getting feedback? What have you been changing based on the feedback?
Well, the business model is always a challenge, especially in our markets that are some years behind. So it's very clear for us that we have a business model based on consultations that can be paid by the B2C users, can be paid by insurers, and can also be paid by employers. So it's basically a simple model that with a big margin that is enhanced by our AI, which optimizes doctors' time. And that's a big learning, and that's why we're ready to scale.
Okay, great. Javier, great to meet you. Good luck with your company. It's great to learn about it. Good luck. Okay. Great. Okay, and now we're moving on. We've got Yossi Shohak. Is that right? Shohak. Okay, great. Great to meet you, Yossi. Thanks for being here.
Yeah, thanks
great.
for the opportunity.
So now you're with Maverick Medical AI.
That's correct.
That's your company.
Yeah.
And Maverick Medical AI is a platform that sort of combs data through to identify the real key clinical insights in the medical record. Is that right?
That's correct.
And the idea is to be able to do sort of a snapshot of a patient by having this extraction. Is that the idea?
Yeah, that's the idea. We would like to be able to read any type of clinical text, understand that as a physician, to a physician level, and be able to structure that so we would be able to provide insights to physicians, save their time of reading the entire medical records, making them create better decisions.
So what is the problem that it is trying to address? I can think of sometimes a patient will give me a stack of records, here's my chart, and you're like, okay, I got to go through all this to figure out what the key points are.
Exactly. So, as you said, there are so many documents for patients, specifically for our elder population. And medical notes are being spread all around, different type of systems. And most of the data is unstructured. So in order for a physician to get a real sense about the medical condition, he needs to read the entire medical chart. It is well known that primary care physicians spend about 6 hours a day reading and handling their EMR systems.
And what? 6 hours
a day?
Oh
6
my
hours
gosh.
a day. That's,
where have we come?
Exactly, and that's in the U.S. That's a statistic for the U.S. And we want to help them being able to get the right and relevant information at no time. So once the patient is coming to get a treatment or to get a consultant, the physician will be able to talk to him, to look at him, and not on the computer. We're all familiar with the way that physicians are looking all the time at the computer and doesn't really interact with the patients.
So Yossi, how's it work? Do you sort of scan all the records into a website or a cloud, and then the software works to extract the key information?
So not far from that, we take the data from the EMRs, and we're running a very sophisticated AI technology, which is being patented as I'm speaking right now. And we know how to understand clinical language by specializing each one of those clinical languages and create a separate algorithm for them. And once we cover the entire medical domain, we know how to process those reports. So when a physician comes to the office, he opens the EMR and you're going to see the right summary that is relevant for him.
That's great.
Yeah.
What would you love to see in the next year with your company?
So we started to work with payers, helping them doing a better billing and a better reimbursement, and also providers helping them make better decisions. So more tractions of customers and more specialties support from my R&D team.
That's great.
Yeah.
Well, Yossi, best of luck with this company. Thanks for trying to help us doctors make us more efficient during the day. It's great work, so great to meet you.
Thank you.
Okay. Take care, Yossi. Okay, great. So we're going on to Jessica Corbin. Come on in. Hey, nice to meet you. Marty McCary. Pleasure. Have a seat. Good to meet you.
It's so wonderful to be here.
So we're talking about your company, Revita5.
Revita5. Like revitalization.
I have an Egyptian accent, so you got to forgive me a little bit.
You are forgiven. Yes, so Revita5.
Great. So one of the cool things about this conference is we get to learn about so many cool things happening in healthcare.
Yes.
Tell us about your company and how it all got started.
Happily. So Revita5, our big moonshot is to cure the human energy crisis and to eradicate burnout. And so this is a major issue for organizations. It's about a $300 billion issue. And organizations are trying to solve it. And they're using things like gym passes and meditation classes and surveys and consultants. But none of these options, until we came along, are tracking human capital at the physiological level. And that really is tracking what teams are prime for more peak performance and then what teams are really susceptible to burnout. And so we've been working with organizations like Activision Blizzard and Autodesk and Smarty Pants Vitamins and a series of others. And we're still at the early stages. We're about 18 months in just with enterprise. But the World Health, and you know this because you're in medicine yourself, the World Health Organization came out and they released their first medical diagnosis for burnout, which by definition is mismanaged workplace stress.
Yeah.
So it's hit a tipping point.
Yeah.
And it's not like we can positively think our way out of this. We got to track it, we got to be smarter about it, and that's what we're solving, and that's why we're here.
So what would you say is the primary pain point that Revita5 is addressing?
I'll address that from two different perspectives. From a corporate perspective, we're addressing the fiscal fallout associated due to burnout, which is absenteeism, high healthcare costs, and burnout-related attrition, which is very costly. But I am very human-focused. We're data-driven but human-centered. I am very human-focused. Reducing the suffering for individuals is very important to me. And so burnout is an umbrella term for a series of symptoms, including exhaustion and fatigue.
Moral injury, loss of autonomy, sure.
I mean, and so many people are up against the ropes and they blame themselves for it. So a passion set of our organization is to educate people about their mechanism, really teach people how performance actually works, taking the stigma out of recovery. Because one of the biggest things is that people think that if I slow down, I'm weak. But truly, if you want to be great at anything, you have to time efforts to perfection, and you have to take your recovery really seriously.
Do you get sort of success stories where you get feedback on what you're doing, and what would be an example of one of those stories?
Well, just quantitatively, we can see that within 5 weeks, we have gotten organizations to increase their heart rate variability, which is a core biomarker that we track. We can get them to increase that, which is equivalent to like resilience, right? By 5% in just 5 weeks. Now, add that up over time, we're getting some serious gains. And overall health and well-being, performance, it's really inspiring what a little bit of insight and then those 1% little changes in your behavior can actually result in.
Oh, wow. That's cool.
Yeah.
That's neat.
Yeah.
So what's next? Have you thought about other applications that can sort of fall under Revita5?
Other applications.
Or other areas that you'd like to move into?
Well, I think our big focus for 2020 is really identifying all the change makers and the leaders that are willing to step into the unknown a little bit, because what we're doing is new. It is unknown, and there's a lot of resistance to the unknown. So we want to call out all the leaders, the executives that really want to move their organization from being impulsive to evolutionary, from reactive to responsive. Those are the people that we're targeting. So if you're a leader, you have an organization, we want to talk to you. If you want to be one of those evolutionary leaders, we want to be your go-to corporate health solution.
That's great. I love it. Jessica, good luck. Thanks for coming on and telling a little bit about what you're working on.
I appreciate it.
That's great.
Have a
great.
good one.
Good. You too. All right. Well, we're going to keep going here. I'm Marty McCary. I'm the editor of MedPage Today, and I'm learning about startup companies here at the Startup Festival. We've got Marcelo Venegas here. Hey, great to see you. Nice, good to have you here.
Likewise.
Great. So, tell us a little about what you're working on. This company called Know Now.
Yes.
And how'd you get into it, and what does it do?
So I founded Know Now Health. I'm a practicing physician. We got together with 5 other physicians who we trained together in the Bronx, in New York, and our whole moonshot is access to care.
Okay, you do primary care?
I do primary and specialty care.
Okay, great. What specialty?
So I do HIV care, and
Okay.
I've been practicing doc in terms of HIV care for the last 14 years now.
God bless you. Thank you for what you do.
Yeah, thank you, absolutely. So for us, it's really about access to care, and it's looking at health disparities, and we got together and we said we want to create a solution to the problem using technology. So we created an app that was launched in last year, July of 2000.
To help people navigate to find primary care?
Right, so we created, first we started doing STD testing and what is called PrEP, which is 1 pill a day to prevent from getting HIV. And of course, PrEP came out almost 5 years ago now, and the number of people who use PrEP is very, very low. And so that was just the beginning.
People just feel resilient. They don't need to take anything like
well,
that?
you know, it's really a public health approach to a serious disease like HIV, you know, and so it's a bigger conversation, and we got noticed by the AIDS Institute of New York, and they said, we want you guys to work on a better solution to the big problem we have. So we said we're going to use our technology to democratize technology, and what we ended up doing is using our own app or technology, we're using it and getting it available to federally qualified health centers, in New York, and insurance groups jumped on, and now we're actually using our app in Latin America as well.
Is that right?
So yeah, it's really exciting. Yeah, so we're working with a group. I'm originally from Chile.
Oh, okay.
And we're working with a group in Chile that does street health, and so we got the app to them as well. And that app is really just a great way to communicate through telehealth, using texting with patients, but also a way to communicate and to have data. And so we talk of EMRs here. A lot of places, underdeveloped countries, don't have EMRs. And so we're essentially becoming their EMR.
Okay, so how's it work? I mean, obviously, there must be a way to identify at-risk populations and then recommend the app to them or advertise the app?
It's people who've been doing this for decades, you know, so, you know, like the FQACs are a safety net here in the United States.
So they've got their own HIV populations
Correct.
and at-risk populations, and they can offer the app.
Absolutely.
Okay, so if you're a primary care physician or a doctor that's focused on one of these at-risk populations, or you take care of an HIV population, this may be of interest to you.
Yeah, so let's, especially like weekend hours, after hours. I just saw a patient the other day, he's like, I don't want to come see you because AIDS is part of the clinic name. And I said, you know, maybe in 2 months we'll have the app up and going. And then for one particular organization I work with, we're getting the app to them. And then you don't have to come to the clinic. We can see you from your living room, you know?
So it's addressing that stigma that still is out there.
Absolutely.
That's a real barrier to care.
You're disabled, you're a working parent, you know, telehealth, as we already know, so many other companies, our goal is to get it to those people that serve underserved communities. You know, we're really passionate about that. And, you know, it's really, you know, 30 million uninsured in America. You know, if you're poor, you already have less health than somebody who is better off. You know, and so we really want to get out to those people who need that care and that technology that may not be getting.
Well, Marcel, what a great idea. You know, for all the downsides of new technology out there, here's something that can actually address the barrier of the social stigma, that access barrier.
You nailed it. Yep,
and
that's exactly it.
So that's so cool.
Yeah,
that's really cool.
And then the other part to it, that it's not just technology; it's who's behind the technology.
Yeah.
So I think the providers we have are excellent. The people we're working with provide excellent care, and so we're really excited about that.
Great. Well, good luck, Marcelo.
Thank you
Great.
so much.
Thanks for sharing about your company here.
Yep.
It's called Know Now.
Know Now Health.
And it's available. It's out there on the web, and doctors who take care of these populations can be ideal doctors to use this.
Definitely.
Great to meet you,
Thanks,
Marcelo.
Marty.
Okay, great to meet you. Thanks for your work.
Thank you.
Okay, great. I'm Marty McCary. We're learning about startup companies here at the Startup Festival in San Francisco. Danny Hu is with us now. Danny Hu, great to meet you.
Lovely to meet you.
Thanks for coming on the show and talking about your company here. So tell us a little bit about it. The company is called SameView.
Yes, so we're SameView. I'm from Sydney, Australia. We operate across Australia and New Zealand. I'm also the father of two children with disabilities. And SameView is an online platform for disability coordination for families like mine. So we help families connect all of their team members together, their professionals, their educators, their support workers. We get them working as a team so that they can achieve their goals faster with less resources, and most importantly, for the parents, less effort, less stress.
You guys must have gotten this idea from your own life then, I would think. There's certain things that you just thought they could be done better. What's an example of one of those things?
Well, absolutely. I mean, our youngest son was born with a rare disease, and his team is about 37 different people. And they don't talk to each other.
Different docs and caregivers and...
Different doctors, different therapists. And those people just add up, but they never talk to each other. And so it's always on the parents, the caregivers to manage all of that communication. And teamwork is good for achieving any goal in any environment. So the idea was, well, why isn't it in disability care?
I think a lot of people ask themselves, how can we coordinate care better? But they run into the challenge here that nobody's really interested in paying for care coordination. How has the app been able to address care coordination?
Yeah, we try and keep it very low cost. We're also fortunate in Australia that we've got a world-leading national disability insurance scheme for all families now. And we're very focused on just getting that teamwork to work. So without building too much, we just get everyone on the team to have a common view of the family and also a common view of the goals that they're trying to achieve.
What's an example of some of the success that you've seen from people having more coordinated care? Is it focused really towards kids with special needs and their family members?
Yeah, so we've started with a focus on young children, because in early intervention you're investing big for lifelong outcomes, and also children with rare diseases because they've got more complex teams. And by far our biggest and most proudest achievement from 2019 was that we saw a case of a young child achieving a developmental goal faster with the help of SameView, and that's simply by giving their family and their team just better connectivity to each other, being able to talk to each other more often and work together.
That's great. So I would think there's a lot of resources out there, not enough, but still there are a lot. How do you find out when you've got a child with special needs? How do you find out about all the different services and programs and experiences and
That's such a great point, and there is a lot out there, and it is extremely difficult to find it. When you come into the world of disability, there's no course. You're just on it. And so we hope that through SameView, with the data that we have, that in the future we'll be able to be there from day one for families and arm them with the data and the insights to help them find the knowledge that they need, find the people that they need to achieve the goals that they want to achieve.
What were you doing before this company?
Yeah, so I'm an electrical engineer, and I used to work in emergency management, so managing disaster type situations, and that's really where the idea came from. My wife and I discussed why is it that professionally at work I can get a multidisciplinary team to work together towards common goals, but in our personal life we didn't have that with our son.
That's great. If you had to identify a moonshot for 2020, what would you say that is?
A moonshot for 2020. I mean, for us, it's all about children's health. It's about making that as effective as possible for families. And for us, I guess our focus in children's health is in bringing that confidence to all of the caregivers.
That's great. Eric, keep up the great work. It's great to learn about SameView, and if you know of anybody that has children with special needs or disabilities, this sounds like something that's worth looking into. It's called SameView. Good luck to you in your work.
Thank you so much.
Great. Good to meet you, Eric. Okay. All right, great. And so Eric Gombrich, thank you very much. Okay, Eric is you're with us now. That was Danny Hugh. Now we're dealing with Eric here. Thanks for being with us.
My pleasure.
Okay,
my pleasure.
Good. So Ticket Health is your company, and you're trying to help organizations and their populations. Tell us about the problem that you're trying to solve.
Yeah, we think there's a fundamental problem that actually transcends any one of the moonshots. It applies to all of them in that getting accurate, honest information from people in the care process is a real challenge for healthcare providers as well as other individuals that are supporting people in the population. Could be teachers, could be members of the community organization, whatnot. The way that questions are typically asked, not just by physicians, but also in the context of surveys or assessments, can be very threatening to individuals and stigmatizing, and they start to shut down and not provide the actual honest information that individuals need to provide appropriate care to them. And we're solving that problem.
When did it become clear that there was a need here that can be addressed with technology?
Yeah, it's a great question. So it actually goes back to the founding of the company and the pediatrician, Dr. Sandy Whitehouse, that instantiated this idea roughly 20 years ago in her clinical practice when she realized she was struggling to get information from her patients, of course, children at that time, asking them things like how much pain are they in, do they have anxiety, things along those lines. She realized she wasn't getting accurate information, and so she put herself back into school, got a degree in communications, and then came back and started ideating in partnership with researchers around the idea of, rather than asking text-based questions, using imagery, icons, graphics, etc., to facilitate a more honest communication with the patients. And she found in these clinical research projects that it resulted in higher sensitivity and higher specificity both in the data collection process.
Okay. So how's it work? Who's the ideal person for this technology?
Well, it's any organization, quite honestly, that is trying to provide some level of care to a population. So in the classic healthcare sense, it could be a clinic, it could be a hospital around a particular population. They're trying to get information. For example, let's say the hospital is trying to do chronic disease management. They're trying to get to the root cause of why an individual is not taking their medication, they're not quitting smoking, they're not sticking to their diet, whatever it is that's supposed to be happening. Because some of the reasons for this could be based in traumas in their past, it could be related to social determinants of health issues. I can't afford the medications. These are things a lot of people don't want to just open up and offer as honest information, and that trips up the process because it puts the physician or the clinician in a position where they can't actually address the root cause of the problem.
So it sounds like a combination of maybe shame, pride, barriers in communication could all result in people not getting the care
That's
that
exactly
they
right.
deserve.
Yeah, that's exactly right. And when you start to take in different ethnicities, different cultures, different genders, all of these things, it gets more and more complex. It becomes an exponential problem. And just having a text-based question written in one language doesn't solve the problem. In fact, it exacerbates it.
And literacy rates, I assume, are variable.
Exactly. So by stripping out the text and making it more iconographic, you can start to transcend these issues and still normalize the data behind the scenes across a population, regardless of these variables and their demographics.
So I've heard the term digital empathy used with your company. Is it essentially trying to measure empathy using images and pictures so that digitally you can get feedback to figure out where somebody is at whatever point?
That's a great question. Actually, we see digital empathy, and it's a term that we've coined for use with this, is actually imputing the empathy into the design of the assessment or the survey. And it's not just the survey as a document, if you want to think of it that way, even if it's digitized, but the process. For example, you might consider, can this individual, given the context of the situation they're in, actually answer 25 questions before they become exhausted and burned out? Maybe we need to break it into 5-question blocks over a period of time.
So it's sensitive to the literacy level of the individual.
Correct, and the context of the individual.
Yeah. That's great. Eric, keep up the great work. Sounds like a really cool idea. Good luck with it.
Thank you.
Hope you do well.
Thank you. So do we.
Eric Gombrich, great to see you again. So good luck with your
Thank you very
company.
much.
Okay, see you. Okay, great. So I'm learning about startup companies here and having a blast. This is Marty McCary. I'm the editor of MedPage Today here at the San Francisco Startup Health Festival, and learning about a lot of interesting stuff out there. Blown away at all the new ideas, entrepreneurs coming up with a pain point in healthcare, trying to address it, and having a great time out here. So thanks for being with me. We're going to go to a break now, and thanks so much.
Hello, everyone. I'm Stephanie Maris, and I'm here at the StartUp Health Festival for another hour of StartUp Health TV. I am Director of Entrepreneurship at the University of California, San Francisco, which is one of the world's most famous and acclaimed centers for life science and healthcare research, and we're starting companies. So I'm very happy to be here and see all the exciting new companies coming out at StartUp Health. And I'm going to be introducing you to several of them during my hour. And so I want to invite my first company. Scott, please come in. Nice to see you.
Hi, Stephanie.
Okay,
Nice to see
all
you.
right. This is Scott Cravens, who's CEO of Julota.
Yes.
Say it right? Okay.
That's
Good. Welcome.
Thank you. Thank you.
So tell us a little bit about what you're doing.
Sure. And first of all, Julota is actually a acronym for just love on them always. Julota is a community interoperability platform that's on a mission to eliminate siloed patient information and connect individuals to the broader care community outside of the hospital, but with the hospital.
So tell me what the problem is that you're solving.
The problem is that 10% of the population uses 60% of the healthcare resources. And so if we can just get them to the right place, the right provider, we can save over $1 trillion a year in healthcare costs nationally.
And how are you doing this?
How we're doing
Tell
it
us
is...
about it.
Yeah. So what we do is we connect individuals with case managers, with EMS, with law enforcement, with other partners in the community. We're doing a pilot project with the YMCA, with food banks, and so we're really addressing the social determinants of health. What I like to say is in the future, what you'll see is emergency departments focusing on healthcare emergencies, while EMS focuses on social determinants of health and getting people the right treatment, whether it's food for food insecurities or addressing loneliness in the elderly with charities and faith-based organizations. So it's getting people solving healthcare within the community, which is the most cost-effective and efficient way to do it.
So are these people heavy users of the healthcare system?
They are. In fact, one of the co-founders was a 30-year ER physician, and the other co-founder was a lead architect for MapQuest and iTriage, who lost his sister to opioids. And so the two of them got together and said, we can solve this problem with one system. And that one system is to get a community around them and then automate the communication with them. So when an event happens, it flags something in the system to trigger somebody else to respond. So say a EMT goes in to treat a diabetic and they notice that there's no food in the house. So what that EMT would do is just register within the software that, hey, can a food bank respond to this individual? And so it'll alert several area food banks plus the case manager, and then the first food bank that responds, they end up bringing in the food. And the case manager is notified to come out and make sure that food was delivered and see what other issues need to be resolved. But it automates the response.
So we only have a few more seconds, so tell me what you're up to in 2020. What are your
in 2020, the big thing is we're going to do, we're focusing on statewide rollouts as well as multi-county rollouts, because the larger the implementation, the more rapid the adoption at the local level, and the more partners that get involved. And the more partners that get involved, the more cost-effective and efficient the whole system becomes, and the more people that are helped, and that's where it gets fun and rewarding.
Where are you operating now?
We're in Colorado, Washington, New Mexico, Texas, Florida, Virginia, with more to come this year.
Great. Well, thank you very much. It was very interesting.
All right, thank you.
Okay, bye. See you. Okay. Great. Well, that was an interesting new play on how to take care of some of the population that doesn't hear very much from us typically in digital health. And I want to next introduce Grace Chen, who is co-founder and CEO of LucidAct. Good to meet you, Grace. Okay, yeah. So tell us about your health moonshot. What are you doing? What problem are you trying to solve?
Sure. The moonshot we have is we want to provide access to care to patients wherever they need it and whenever they need it.
Okay, well, tell me more about that. What does that mean?
Sure. So LucidAct is building an AI-powered assistant for nurses and care coordinators to help them improve patient engagement through remote patient monitoring devices. So far, we are mostly focusing on community health centers and nursing homes.
Okay. So a patient signs up for this. What happens? How are they using this system?
Right. We want to make it super easy for the patients to use. You know, typically in the past, when you get blood pressure cuff, you need to have a smartphone. You need to have download an app, and every time you measure yourself, you have to launch the app in order for the phone to notice your data. So our device make it super easy. The patient doesn't even need to have Wi-Fi at home. They don't need to have a phone, and we have a kind of gateway kind of device in patient's home, listening to the device measurement at all time, and then submit it to our cloud, and also make it accessible for the care team, primary care doctors, specialty care physicians, or nurses and care coordinators, and they can react if the data is out of range or something bad would happen. They can react faster than.
So you're monitoring the patients through this app, and then the data is going into the cloud so their care team can know what's happening. Is that right?
And the care team also makes 20 minutes phone calls with the patients every month. These are the patients with chronic conditions. And then they record their conversation, update care plans on our platform, and we use AI to analyze what they wrote down and really kind of flag the patients of their social determinants. Do they need transportation all the time to see the doctor? Do they have housing insecurity? Do they need grocery shopping? So those kind of information, typically the care teams are just too busy to go back to read 3 months of data. So we need so we use technology to utilize that and to give them notification.
So you're selling into the hospital, is that right?
We're selling to not the hospital specifically, the primary care clinics and home care agencies. Like mostly the kind of care teams outside of the hospital, managing patients at home. That's where we see the biggest need and biggest gap.
And so what's happening in 2020 for you?
Oh, 2020 was an important year for us. We launched our product to 25 plus clinics using our solution.
This coming year,
2019.
Okay, 2020, we're going forward.
Sorry, 2020, we already have contracts in place, and we want to launch our solution at 5 different community health centers, working with patients, Medicaid patients who, low income, they have more needs than like other patients. So that's our goal.
That's your goal. And how many centers are you in now?
We're in 35 primary care clinics right now. 2020, we want to go to bigger institutions, especially the federal qualified community health.
And what's the geography, or what part of the U.S.?
We're focusing on just California, northern and southern part of California.
Okay. Yeah. Okay. Well, thank you very much.
Thank you so much.
Nice to meet you. Okay.
Thank you
for your time. Yes, of course. Okay. Okay. Well, moving onward. So now we've heard from the first 2 companies that are actually focused on the lower income populations. That's very interesting. And we have a different kind of company in front of us now with Emilio Goldenhirsch. Emilio, please join me. CSO and co-founder of MindCoteen. Emilio, good
nice
to meet
meeting you.
Yes.
Thank you.
Okay, so what's your moonshot? Tell us what problem you're trying to solve.
So right now we are helping people overcome addictions, specifically smoking addiction, nicotine addiction.
So other addictions as well, or smoking?
No,
is
right now we are very focused on nicotine addictions. We have
Okay.
plans to expand to vaping as well, but right now this is for cigarettes.
Okay. So big problem, no solution, lots of people are trying. How are you going to be different?
That's correct. It's an unsolved problem. That's why we are trying to make an integral solution. We developed Mindcotin, which is a personalized and self-managed digital therapy, where we combine our virtual reality, mindfulness-based exposure therapy product, which is a headset made of cardboard where you use your smartphone.
Do I get to try this on?
Yeah,
No.
of course. Of course, you can try it. You see, you have your
Okay.
smartphone.
Okay. All right. Uh-huh.
Yeah,
okay.
exactly.
I got it. Okay.
And we help people, we get people to crave in the virtual environments. And at the same time, we add a layer of mindfulness-based relapse prevention where we work with those cravings to inhibit them. And the impact of this after using virtual reality is that the person can actually acknowledge the cravings. And through the smartphone, we have coping skills and we guide the smoker and support him or her to quit smoking.
So I don't understand how this works. I'm sitting in my office. I'm going to put this on my face, or do I do this at home?
Yeah, you do it at home.
Okay.
Preferably, you use your own smartphone you use with it. So in the morning, we set up a 10-minute session where you actually train yourself. Through the smartphone, we have coaches that guides you in the preparation to setting your quit date. And once you actually quit, we combine several evidence-based treatments in order to increase the efficacy and the adherence of all the programs. So first you train, you set your quit date, and then we keep you stay quit or maintain without smoking after that.
Okay. And how do you want me to crave it before you administer these fixes? How do you do that?
So the environments that are seen in the virtual world are regular situations that any smoker will crave, like the coffee in the morning, like a family lunch and the food after that, and different stress situations that we already know that you will crave.
So that's the VR that makes me crave.
That's our technology that we patented and how we actually help you train your brain to retrain it.
Okay. So what kind of traction do you have?
So we conducted first clinical trials where we had a very good results, 33% efficacy rate with 120 people, and then we started commercializing this product. This was in the last 6 months. With corporations, mainly, we have more than 1,300 people that we help either quit smoking or reduce their consumption.
So you're selling at the corporate level, and the argument is we're going to be saving you money in the healthcare costs because
exactly
people
every
won't stop.
smoker represents more than $5,000 extra cost for any company.
Yeah.
So we help them diagnose the full situation regarding smokers. Then we deliver different, each one of these for every smoker that are wanting to quit.
And you're not located in Silicon Valley, I take it?
Yes, we are located
You
in
are?
San Francisco,
Okay.
correct. All the team, the co-founders team are located in San Francisco. And our team, that is the technical team, the support team, and so on, is in Argentina. We are 3 from Argentina, but living here.
Excellent. Well, I wish you luck in 2020. I hope you can help my son stop smoking.
Well, you already know what to tell him, so we are able to do it.
Okay, excellent.
Thank you very much.
Thank you. Okay.
Bye.
Bye. All right. Well, I'm hopeful that that solution is going to make the difference in my son's life because he's tried lots of stuff. So good to hear about a new approach. So our next company is Matt Peters. The name of the company is, let's see, Matt, I need help. What's the name of your company?
It's called Rose, Smarter Mental Health.
Rose, okay. All right, thank you for joining me.
Yeah, thank you.
So you're Chief Medical Officer
That's
of
right.
Rose.
Yep.
Tell us a little bit about it. What's the problem you're trying to solve?
Sure. So Rose has built a digital ecosystem that's looking to provide a solution in the mental health care space. So what we've identified is that there is a major issue within mental health care of finding the correct provider for a particular patient at the right time, and then helping the patient and provider work together to provide a mental health care service that exists across time rather than just being when you're in your appointment. Within mental health care, appointments are hard to come by. There's a big lack of providers. And so we're trying to help the patients and providers work together to provide more efficient and effective care.
So it's a matching.
So there's two major components of it. The first is a matching component where, based on the patient preferences as well as based on the evidence-based research that's out there for who might be the best provider for a given patient, we have a list and a resource of providers that we're able to offer the patients. The second component is a patient-facing mobile application and a clinician-facing dashboard. That's meant to be used, the dashboard is used during the session. So the patient comes into the room, the provider and the patient are able to work together to determine what information is going to be collected in terms of assessments, journaling, etc. Make those choices within the patient-facing or the provider-facing dashboard and push it out to the patient-facing application in real time.
So this is, we're still live. We're going to be, I'm the patient talking to the provider, and at the same time we've got this digital assist to help.
Yep, so the idea is you're still getting the in-person care that you would normally receive. So the patient and the provider are still meeting together, they're still deciding what the care is going to look like, but they're using these resources that we've developed to collect the data in between appointments. So let's say you're seen at an appointment and then you're not being seen until 2 weeks later. That whole time the app is collecting data. So data on mood assessments, journaling, we're building in digital phenotyping to collect things like heart rate, sleep, etc. And then you go in and see your provider after that delay, and they are starting with a bunch of information that in the past they never had before.
Interesting. What kind of traction do you have?
Yeah, so we have 80 clinicians that we've onboarded in the last month. Our MVP just went live, so it's in the Android store and in the Apple store. Those 80 providers, I would say we have around 250 patients that are actively using the application. We completed a phase 1 clinical trial that was very successful. It showed that 80% of the patients used the application every day, and 100% of the clinicians used it at every visit. We also have traction within the reimbursement space. So this is a solution that providers can submit to insurance companies and be reimbursed for. So mobile health data monitoring is something that there are codes for now that providers can collect an ancillary revenue stream, which they've been pretty happy about.
Great. What's happening this coming year?
So this coming year, we're going to be integrating digital phenotyping and digital biomarkers within the application. We've signed a large contract with an employee assistance program, so we'll be rolling out to their 3,500 clinicians and over 20,000 lives that they take care of. We got accepted into the Hopkins HexSite Accelerator program, so we're going to be integrating within Hopkins and into their primary care space. It's a app that works for primary care and works for those individuals as well. So within the next 6 months to a year, we'll be in a number of primary care sites and also taking care of a bunch of employees.
Well, great. Good luck with it. Sounds like an exciting year.
Yes.
Thanks for coming
thank
by.
You. Nice to meet you.
Okay. Bye. Okay. Great. Well, we've seen a couple of companies now that are focused on mental health of some sort. So we have a smoking cessation, and now this last one we heard about was the relationship between the client and the practitioner, and expanding that with some digital feedback in between. So good to hear of these new things. So next I'd like to introduce the founder and CEO of Amy Health, Alan Gale. Alan, thanks for joining.
Stephanie, how are you?
Good. Tell us what you're doing.
So we're helping find a cure for aging as a disease, and we're using all the best methodologies that we have available to us right now to make sure that people can live as long and healthy as possible.
You got my attention. What are you going to do for me?
Well, we start with a really comprehensive view. So we incorporate nutrition and key biomarkers that are indicators of aging, and we help identify all the nutrients that one is supposed to be obtaining from their diet, starting with a series of photographs. We compare that against science-based guidelines, and then we come up with a set of recommendations to help fill in any gaps. So what foods can you add, or what targeted supplements can you add to also help fill those gaps? And then we validate through biomarker testing. So for example, right now we have a one-drop blood test that helps make sure that your cellular health, especially for your brain, is really at an optimal level.
Okay. And this is in practice someplace, or?
It is. So we launched in 2019, and we built our first prototype system, which we've gone live. We brought in some key partners to basically help fill out all the needs that we have, looking at the input needs from foods and supplementation, as well as the output biomarkers, and using professional, medically validated dietary protocols.
Well, I was going to ask you about that. How have you validated the biomarkers and what they're presenting to you?
So it's very important for us to be very steeped in science.
Yeah.
So we use biomarkers that look at key brain nutrients, for example, like your omega-3 and omega-6 levels, and make sure those are in the right proportion.
Okay.
We'll be incorporating other biomarkers, especially ones important for brain health initially, over time this year. So gut biome and genetic biomarkers are also very important. And then we add that to our dietary analysis to make sure that you're getting all your core nutrients, to make sure that you're satisfying the basic needs to hold off from all the major chronic diseases that contribute to death.
And where's this science from?
So the science comes from many places. So the science largely starts with clinical trials that look at the effect of these different biomarkers as indicators for brain health and overall body health, as well as things like the dietary reference intakes to help guide your nutritional intake. But we recognize that every piece of science isn't necessarily applicable for every person on an individual level.
Right.
So we start to make sure that you satisfy at least those basic needs, and then we, again, validate with biomarkers, but then have the ability to iterate and modify your dietary protocol over time to make sure that your biomarkers ultimately go to where they should be to help ensure that you have a long and healthy life.
So this is food as medicine.
It is food as medicine, and it also is a really important missing link in the treatment of chronic disease. We understand how complex the body is. There's lots of intermediary systems, your genetics, your gut microbiome, and your metabolics. And those are largely driven by your diet and lifestyle factors. Yeah. And it's one of those missing pieces in traditional medicine that's now finding a very important place in people's lives.
So we have 20 seconds left. Tell me, what's the one big goal you have for next year?
So this year and next year, we're expanding our platform, bringing on key partners, additional solution partners especially. We're working with large networks of practitioners who are then promoting our protocols and our platform to their patients to really help have a much bigger effect on society at large.
Okay, great. Well, thank you. Good luck with this. It sounds
Thank you very much.
promising.
I appreciate the interview.
Yeah, thank you. Okay. Well, while we're lining up the next presenters, we're going to have a quick break and be right back in a few minutes. Thank you. Hello again, Stephanie Maris, Director of the Entrepreneurship Center at the University of California, San Francisco, and I am here at the Startup Health Festival in San Francisco with thousands of entrepreneurs and investors, and very excited to be in the TV studio just down from the main floor and interviewing Richard Hanbury. So Richard, welcome. You are CEO of Sana Health. Tell us about it. What is your moonshot?
Thank you. Pleasure to be here. Our moonshot is to end chronic pain by 2030.
Wow.
So if you divide up pain between acute and chronic, acute is the signal that's coming from your brain, and chronic is how your brain then adapts to that signal to then exacerbate that pain over time. And we believe we can undo that chronic element of chronic pain.
That's very exciting. So, and lots of people have worked in pain and tried. So tell me what's your approach and how are you going to be different?
Yeah, so I had my original injury in the Yemen. I was driving down a road in a Jeep. I had a choice of a head-on collision next to a petrol truck or to go off a bridge. Went off a bridge, 60 foot into a riverbed, car crumpled up like a Coke can, and spinal injury THT10 and a ripped aorta. 4 days later in the UK hospital, I then was clinically dead for 8 minutes, coma, came back from that.
Oh my God.
And all of that resulted in a nerve damage pain problem that was so severe I was given a 5-year life expectancy.
Wow, how long ago was that?
That was 1992.
Oh, good for you. All right.
So by 1993, and standard of care is the same 27 years later.
Wow.
Medtronic and Abbott will claim that their internal spinal cord stimulators are a lot better than they were back then. There's not a lot of evidence to suggest that that's correct. But basically, standard of care is opioids, gabapentin, internal stimulators, external stimulators, and then eventually meditation. And what I realized was that with pain levels at 20 and meditation ability at 0, you can't get there without help.
Yeah.
And so I studied the work that had already been done on long-term meditators. I realized there was very specific frequency patterns in the brain that they were producing, and I set about hacking that. So what we've ended up with is neuromodulation using light and sound that produces those frequencies that you have if you've been meditating for 20 years. So this is the current version of the device, and you have light coming through closed eyes and sound through your ears.
How often do you wear it, or for how long do you wear it?
So now I'm a health and wellness user because it totally fixed all of my underlying pain.
Fantastic.
We've just done a fibromyalgia study where we told people use every night to help them go to sleep, and then during the day, whenever any of their symptoms, so pain, depression, anxiety, fatigue, when any of those are too much for them to enjoy their life, use the device. So they started using 5 times a day, 15 minutes a time, and then at the 6-month mark, they were down to once a day, maintaining all of their the 50% reduction in symptoms by using once a day.
And so this is a clinical trial you did?
Yeah, so that was a 20-person clinical trial. We've got a 120-person clinical trial on fibromyalgia coming up with Duke this year. And then we've got Mount Sinai, who've already started a neuropathic pain study. Cleveland Clinic are going to run a multiple sclerosis study on multiple sclerosis pain.
Yeah.
And then Walter Reed is going to do a lower back pain study.
Very exciting. How did you come up with the right science behind this? Or
Well, really, it was trial and error. Once I had the blueprint of these are the frequencies that a long-term meditator has, the other thing that was critical, which actually means that you can only do this with audio-visual stimulation, is that they had all the long-term meditators had perfect symmetry between the left and right-hand side of their brains at the frequencies between 1 and 30 hertz. And I was looking at my brain in the same system, and my brain was massively skewed to one side rather than the other. At the time, I didn't know, and I frankly didn't care that that was everyone else in chronic pain. I just was like, okay, this is mine, this is where I need to get to.
Yeah.
And then once I'd fixed myself,
Yeah.
and I haven't had a minute's nerve damage pain since 1993, I was like, okay, so I really have fixed myself.
Yeah.
Who else can I help with this?
That's
and
amazing.
so that's been it's been 27-year journey since then to how can we roll this out to help other people. And the biggest problem we had was the original design was all worked out on EEG. And there was no wet electrode at home EEG that's ever succeeded. Muse is the best dry electrode system, and it's great for meditating, but it doesn't tolerate movement.
Unfortunately, we have to stop, but I'd love to hear more of this story because it's so fascinating. But good for you for doing this. Congratulations, and I wish you the best of luck with this company.
Thank you very much.
Okay, thank you.
Have a good day.
Thank you. All right, so we're going to have a break here, and then we'll be back with more interesting stories. Thank you very much.
And we're back. I'm Logan Plaster, the editor of Startup Health magazine, and I couldn't be more excited to be coming to you live from the Startup Health Festival. It is 3 o'clock on day one. Things are still going strong, and I'm excited to be bringing you the next hour of programming here down in the Startup Health studio. So I am joined today, right now, with Angela and John Dayton of MedForums. I understand you're creating an educational platform, which we can get into, that really kind of pulls things together for clinicians specifically. Okay, so we like to start in our interviews to really talk about first that big passion, call them health moonshots. Kind of what's that big audacious goal that you're shooting for with MedForums?
So our moonshot is really to streamline the connection between physicians, education, and the credentialing process in order to really ease the burden associated with accessing and digesting the education that they're mandated to take advantage of. By offering a platform that really allows them the opportunity to see the informal and formal resources that are available to them. Okay. So on a daily basis, they can access what they need when they need it.
Okay. So, John, you're a physician, you're a practicing physician.
Yeah, emergency physician.
Yeah, walk through how this would make your life better.
Sure. The idea actually came out of a bad experience. I went to a board preparation course that just wasn't great. I ended up taking a lot of time off to be there, kind of opportunity cost. I ended up needing to take another course to feel like I was ready, and came away from it thinking, boy, I wish someone would have warned me. I probably should warn somebody else. Conversely, there's great stuff out there that I need to hear about, and rather than relying on a flyer in the mail or something that's elevated on Google based on the tricky words or SEO, I wanted to find a way for physicians to refer to each other the best courses.
Okay, awesome. So that's the problem. You experienced it personally. What are you building? What is MedForums?
So MedForums is truly a resource data analytics platform, really that provides social proof associated with the education that's available. There are thousands of resources available to physicians. They don't have the time to really do their own digging in on exactly what is going to work for them, so they're relying upon their peers to make those recommendations.
So is this like a Yelp for
Perfect.
CME sort of idea?
I would say it's a Yelp for medical education resources. Okay. So CME is only one part of medical education. So starting at like your first year of medical school, you have your USMLE prep that you need to do because you have tests coming up. In residency programs, you're going to have your board preparation you need to prep for so that you can pass your boards and ultimately practice medicine. Once you're practicing, not only do you have your continuing medical education, but you have your maintenance of certification, your lifelong learning skills assessment, and not to mention those daily tidbits of information in order to stay up to date. So it's more than just CME, right? It is like the Yelp for all of the medical education, informal and formal.
Okay. So you're a startup, you're getting started, tell me where you're at in 2019, coming into 2020, and what you're really excited about for the next year.
So in 2019, we are 14 months old.
Okay.
And this last year, we had over 550,000 physicians on our site,
awesome.
With 286,000 of them being unique users.
Okay.
So we're getting a lot of traction within the physician, element. A lot of that comes from partnerships we're developing with medical schools and residency programs, specialty societies, health systems, all of those locations and organizations that our audience is part of.
Okay.
And then we started off with 368 resources that we just kind of scraped from the internet that John knew about, his colleagues knew about, and started from there.
Okay.
And we're already up over 1,600 resources by our clients that have uploaded to our platform.
Okay, awesome. I love hearing the importance of those big partnerships. That's really the theme of this festival, collaboration. So if there's one thing you're looking forward to for 2020, what's coming next? What should we be looking forward to?
Yeah, so I would say in 2020, we're excited about the pipeline of not only clients that we have, but also the partnership development with the health systems and being able to supplement their current learning management systems in order to provide access to clinicians within their clinical workflow.
I think this is your first Startup Health Festival. What's important about being at an event like this and sort of meeting the kind of people who are here?
It's great to be able to, the app's been really nice because we can say, oh, this is a healthcare system that we want to connect with, or this is a practicing physician, we'd love to get their input, and then we can see the other folks in their background, and that's been really helpful.
Awesome, awesome. All right, that's all the time we have. Thank you so much for being here, John, Angela. I love what you're building.
Thank you.
And wish you the best of luck as you continue.
So much.
All right,
Appreciate
you can take care this way. All right, awesome. Okay, we're rolling forward, and I cannot wait to bring up our next guest. We're going to be talking to Sina Charaza and Akash Magoon. All right, welcome. You're from Naya Health. I can't wait to hear what you're working on. We've got the co-founders, two co-founders of Naya Health.
That's right. Thank you for having us.
All right. So you're optimizing the design and distribution of health plans. Okay, this is what I understand.
That's right.
We'll get into that. You've got one of these platforms that can be difficult to understand, and so it's good that you're here and you can explain it to people yourselves. Okay. So let's start with the big picture. Let's start with the why. What is the big problem you're trying to solve? What's your health moonshot?
Sure. So we operate within the Access to Care Health Moonshot. And just in the last 6 or 7 years, the number of underinsured Americans has grown from 23% to 29%. And a lot of folks think that maybe that might be in sort of underserved, marginalized populations, but it's actually within employer groups. As costs are rising, coverage is decreasing, and so we work to basically optimize the distribution of these plans so that we can put the right plans into the hands of the right businesses.
Okay. And where are you at in that process? Like, what does the product look like right now?
So we offer a platform to insurance companies where we benchmark health plans against every single employer in the country, as well as micro-populations, to better understand where are folks underserved and how can you find plans that are best for a set of micro people within different communities.
Why is it important to really understand micro-populations?
Because oftentimes health plans are designed for the masses. There's oftentimes pockets of people that aren't served, and allowing payers to understand where those lie within the industry, also against their competition, is actually really important in designing and optimizing networks.
Okay. Let's just say I'm a small business, or I'm a mid-sized business, and I've got employees. Kind of walk me through how this makes my life better.
Sure. So I think the status quo today is you'd receive a list of products and a price sheet next to it, and you'd have a really hard time looking at, okay, is it really Cigna? Is it Aetna? Is it somebody else? And what are the implications about each of these individual decisions? It's not my day job to understand that, right? So Naya comes in and equips the right level of intelligence to say, by choosing Plan X, the closest, or the wait time for an OBGYN will be X as opposed to Y. And like, what are the implications of these decisions? We bring that transparency to that very opaque process.
Nice. Every year, the head of HR at any company makes the most difficult decision around choosing health plans for their employees, and typically they're given a spreadsheet of like all the plans and the prices, and really no transparency into like which one's the best one, and making that decision is really hard. And most of them are making the decision on price, and typically choosing the cheapest one, and we're looking to bring data around which one's actually the best one, and being able to say that maybe the second cheapest plan is 20-30% better for your employees is something that we're really motivated to do.
Interesting. Very cool. Very cool. So what are you most excited about from 2019 coming into 2020, and what should we be looking forward to from Naya in 2020?
Sure. So 2019 was a pivotal year for us. We raised our first round of capital, closed our first customer relationship. 2020 is really about double clicking on the same. We want to grow with a couple of large payers, carriers, intermediaries, do a larger round of capital so we can scale and develop our team, and also as of just this month, we have a free product that we've rolled out for folks to enjoy, to develop, and be able to use data on companies in a more clean and actionable way. So really excited to just double click on all of those in the year ahead.
Nice. Very cool, guys. Okay, well, that's all the time we have. Excited to have you here at the Startup Health Festival. Excited to have you down into the studio, okay? And I hope that it's a fruitful next couple of days for you here. And thanks for coming by.
Thank you for having us.
All right. As you guys take off, we are still broadcasting live on StartUpHealth.com, and excited that you can join us here as we continue to interview health transformers. The next person to take the hot seat is going to be Lindsay Williams. Come on down, Lindsay. Lindsay Williams is the acting director at HLI, Human Longevity Inc., and I am so pleased to have you here. HLI is a fascinating company, and you can let us know what's going on, okay?
Yeah.
How you doing, Lindsay?
I'm good, thank you.
As you may have heard in the previous interview, we like to start with that big picture question, that sort of why question. So when you think about HLI, what's the big moonshot-sized question, the problem that HLI is addressing?
Yeah, I think the goal at HLI is really to shift the paradigm in healthcare from a sick care to a well care and really reduce preventative medicine and personalized medicine to practice.
I don't know, what does that look like? I've heard people talk about, sick care versus health care, and I think it's a very interesting and important phrase to use. It kind of stops people in their tracks, you know? It kind of stops them. And I don't know, why do you think that that's important to identify?
Well, I think in this example, we traditionally treat patients once symptoms have become apparent, right?
Yeah,
when you know you have a disease. But the goal really is to move to pre-symptomatic diagnostics, where you would know a decade or more before the onset of a disease and would be able to take measures to prevent that disease.
Yeah, okay. So HLI trying to help me understand what's going to happen to me 10 years from now. Now walk us through what it actually does. What does Human Longevity Inc., has it built?
Yes, so we have an amazing assessment called the Health Nucleus.
The Health Nucleus, okay.
Yes, and what the Health Nucleus does is it's a comprehensive state-of-the-art assessment at our facility in San Diego, California. And effectively what that does is whole genome sequencing, whole body MRI, and a battery of other types of blood-based testing that is integrated using our mediated AI platform. Wow. And integrated by our physicians to identify health insights that can impact your health and your longevity.
So a really awesome body scanner.
Yes.
Do I ride into it like an MRI, or do I walk into a room and have it scan me?
Listen, you have to come see it. It's amazing.
I think I've seen a picture. It's pretty impressive.
It is very
impressive. Blue lights, very futuristic.
Yes, our facility is unparalleled for sure.
So I come in and I get a scan. It's comprehensive MRI plus all of this genomic testing. Okay, so what do I get back?
So you get an integrated health report, and that I think is really what's fantastic about what we offer. Really being able to utilize all of the technology, machine learning, all of this AI, all the fun buzzwords, right?
Yeah. All in one awesome
All in one
test.
awesome place. And I think the important thing is that we are doing this in a way that's actually actionable for you as a patient, right? And I think that gives you insights about your own health and allows you to make decisions proactively about your own health care that can impact your longevity and ultimately help people not just to live longer, but to live healthier longer.
Can you think of any examples of kind of a reading that I would get back that's extremely actionable now? Like kind of life changes I might make?
I'll use my own.
Oh, you've done one?
I've done one.
Okay.
Yes, and not to put it out there, but I guess we'll go there. I actually have a heterozygous variant for ApoE4, which is really a hot topic right now because it increases my risk of Alzheimer's disease when I get older. So obviously right now, right, there's, one would say, well, what do you do, for that? But there's more and more research now that's showing that you can reduce your risk by taking specific, changes in your lifestyle and diet.
Yeah.
So I now am empowered as a patient to not only know my specific disease risk, but make specific changes and choices in my lifestyle to address and reduce my risk long term.
And I'm guessing that you have.
I have.
You saw the numbers and it was actionable for you.
And I will continue to stay on top of the research that comes out about ApoE4 and about Alzheimer's to make sure that I'm always at the forefront of knowing how I can continue to reduce my risk long term.
Interesting. Okay, so HLI built this awesome test, giving actionable data. Where is it at right now, coming into 2020? Kind of what are the big hallmark things that we should be looking for from HLI that you're excited about?
Yeah, I'm excited about really expanding our commercial operations. I think we are working on some strategic partnerships that we are going to be looking forward to announcing later in 2020, and I think it's really going to be a banner year for focusing on not just the expansion of our availability. I think we've made a lot of changes in the Health Nucleus facility that are going to allow for more capacity, which is amazing, so we'll be able to help more people, but also just from an expanded commercial and focus perspective that really we're putting ourselves in the market and we are making this available to patients.
Yeah, I mean that device seems incredibly useful. What's the vision in terms of accessibility to it?
Yeah, accessibility is definitely something I think that from a long-term perspective, really looking at healthcare as a whole and understanding that there is a a massive transformation that has to happen to truly move from sick care to well care, but that we're at the tip of the spear, and that's an exciting place to be. So we're looking forward to leading the charge.
Nice, awesome. All right, that's all the time we have. Thanks so much for coming by, Lindsay. And I can't wait to see what HLI does next.
Absolutely,
all right,
thank you.
All right, take care, and thank you. All right. Moving on, we are going to be joined by Mark Cavicchia and Clarence Carlos from RC21X. Is that right, guys? Come on up. Excited to have you here.
Nice to meet you.
I understand you're on a mission to become the global standard for measuring and assessing brain performance. Okay, and we're going to get into that.
Yes.
Great to have you here at the Startup Health Festival in the Startup Health studio. Welcome. As you may have heard in the previous interview, we like to start the interviews really pulling back and thinking about the why, what we're working towards, what's our health moonshot. So what's that big, audacious goal that RC21X is working towards?
Well, I think you said it, and our goal is to be the standard for the world in measuring and assessing human performance from a neuromotor performance standpoint.
Okay. Human performance.
Yes.
Okay. Versus with the focus on brain assessments and.
Yes.
Yeah.
Yeah, that's correct. I mean, as opposed to a lot of tools in the marketplace, we're not trying to be a diagnostic tool. We are an assessment tool, and we eventually we'll get to the point where we can help people determine the best times for them to sleep, for them to work, eat, or exercise.
Okay.
Also, to make them very mindful of what's going on throughout the day in their lives. Okay. So this is a tool that you can use on a daily basis, weekly basis, or monthly.
Okay. Well, I would personally love to have a tool that helped me understand my mind and its relationship to sleep and work. So tell me, what's the product? Walk me through exactly what it is and what you've built.
So we have a tool, it's called Roberto. That's named in honor of Roberto Clemente. We're from Pittsburgh. He was a humanitarian. And actually, Clarence came up with the idea to develop the tool because he had actually a very close friend of his had a sudden loss of his son, teenage son, to a misdiagnosed head injury.
Okay.
So we've built a tool. We've taken a number of clinically validated neuropsychological tests, and we've turned them into a very quick 6-minute series of video games.
Okay.
We've also applied the science of human performance through our partnership with the University of Texas at Arlington and their Human Performance Institute. So we're looking at the human body as a system that can be measured and assessed just like any other system that you would measure and assess. And the next phase for us, like I said, will be to take that data, integrate other data that you're collecting, and enable you to make better decisions about you and your lifestyle.
Got it. It sounds like there's a lot of different people that you could market this to. Who are you focusing on right now?
Yes. We're focused on corporations, companies, big insurance companies, lots of employees, to be able to assess themselves on a daily basis. Like Mark said earlier, if you know where your peak performance is at a certain time of day, and then you know where the trough is, we know there's things that got to intervene before you get to that trough to reduce injuries, accidents, and lost time in a job. So people are really interested in knowing about their brains when you come at it from a perspective of making it a voluntary program in their companies and being the best they could possibly be.
Yeah, absolutely. So take us to where we're at now with the company. What are you excited about coming out of 2019 into 2020? Traction, hallmarks for this point in time?
Well, I think there's a couple of things. We just entered into a partnership with one of the largest insurance brokers in the United States. We're now starting to talk to some device manufacturers about, again, integrating their therapeutic products into our platform.
What kinds of products are we talking about?
Products that would focus on helping people sleep, helping people reduce stress, or products to help them improve their cognitive.
Okay. So you would be the platform. You'd be the data backend for a device like that?
So if you think about a loop, right, you have measurement and assessment, and you have therapy. So the question always becomes, if I'm using somebody's product, how do I know it's effective or not? And that's kind of where our tool comes in, where if you're starting a new medication, if you're starting some sort of hardware usage, or even software usage.
Right now, every year, your physician wants to get the biometrics of where you are, from your A1C to your cholesterol to your body mass index, and
other biometric screening tools, but nobody has the brain and the human performance perspective that covers the whole entire body so that they can make better decisions for wellness in their health.
All right, and RC21X is bringing that to the table.
Absolutely.
Yes. Awesome, okay. Well, that's all the time we have, guys. I hope the next couple of days are incredibly fruitful for you, and we're excited about what you're building and where you're heading in 2020.
Thank you.
So thanks for stopping by the studio.
Pleasure, right.
And you can set your microphones right here. All right, thanks, guys. All right. We're broadcasting live from the Startup Health Festival. I'm Logan Plaster, the editor of Startup Health magazine, and we'll be continuing to broadcast at startuphealth.com throughout the rest of the afternoon. I'm excited to be inviting my next guest up, Jason Pyle, the CEO and co-founder of Vive Benefits. So come on up, Jason, and I'm excited to learn more about what you're doing. Okay, I understand you're helping fight medical bankruptcy.
Well, we hope we are. 60% of people in the United States, the reason they file for personal bankruptcy is unexpected medical costs. It's the number one problem by far and away when we talk about financial instability of households. And when you think about this other frightening statistic, which is that only about half of families in the United States have only about $500 worth of liquid assets in order to deal with any kind of emergency. It's just a huge problem that we're dealing with in the United States right now.
I've read recently that globally it's even more in terms of the impact of medical bankruptcy on families. It's just an oppressive issue throughout the world.
It's absolutely true. And one of the things that's gone on in the last 15 years that we don't talk much about is the huge transference of risk from companies, employers, insurance companies, onto the individual for their healthcare payments. So if you go back 20, 30 years ago, a lot of people in the United States had pension benefits and different kinds of healthcare benefits that would take care of them through these problems. But now, with the rise of things like high deductible healthcare plans, many families are on the hook for as much as $3,000 or $4,000 of out-of-pocket risk and don't really have any means whatsoever of dealing with that if that contingency exists.
Yeah, well, you're preaching to the choir. I've dealt with high deductible plans in the past, and anybody in this room could understand the strain of high healthcare costs. So let's get into how Vive Benefits is trying to crack the code on bringing down medical bankruptcy.
So what we are, Vive is a employer-sponsored health plan for employees. And what we've done is we've combined a couple different products, including a managed health savings account, credit products, different kinds of banking products, all wrapped into a single Vive member MasterCard. And that card is issued to every one of our members and will cover all out-of-pocket expenses for that member all the way through their deductible corridor to the top of their high deductible plan.
Okay. So what's the magic sauce happening behind the scenes that makes something like this possible?
Well, our founder was a financial engineer by training.
It sounds like there's some wizardry going on.
There is some wizardry
back
going on, and I'm not the wizard. But
that's fine. You can give me the high level. It's fine.
It's a combination of financial products and an integration of financial products that simply have never existed in one package before. We're able to, in our plan, make loans to individuals in our plan at 0% interest with zero fees. And so one of the things we do in our plan is make sure that all the members have a single monthly payment. And whether they're saving money into their HSA or they're paying back their loan, the monthly payment remains entirely the same.
Got it.
And that's really important for most families that are living on a budget and are trying to deal with financial instability.
It's huge. It's huge. All right. So take me to where you're at in 2019, coming into 2020. What are you most excited about what Vive's doing?
Well, we went live commercially on January 1 this year.
Oh my goodness.
So we're...
All right, congratulations.
Thank you. So the company piloted its product in 2018 with a subsidiary of Dignity Health, awesome. US HealthWorks. We spent all of 2019 getting it commercial ready from the learnings that occurred there, doing all the partnerships and financial partnerships required to put this plan in place, and then launched it live commercially with our partner Finet Dermatology on the 1st of January.
Awesome. Okay. Well, congratulations. So for 2020, what are you looking forward to then?
Well, one, I'm looking forward to taking the members that we have and that we just launched and keeping them financially stable throughout the entire year.
Yeah.
We're really excited about that.
Yeah.
And it's a neat mix of people in this company, all the way from very low-paid and vulnerable employees, all the way to the very high-paid doctors that work in this business. Interestingly, some of our first loans were that we made out were to some of the highest-paid people in the company.
Interesting.
Everybody has cash flow problems.
Yeah.
So we're really excited about that and taking care of them. But what I'm really excited about in 2020 is expanding our commercial footprint and doing a much, much larger commercial launch come January 1, 2021.
Very nice, very nice. All right. You're here at the Startup Health Festival. Why is it important, if it is, to be a part of events like this and communities like this?
Well, Startup Health has been a partner of this company since its inception. So they've been very close with our founder, Ron Widener, have been very supportive. When I came on board as the CEO, as one of the first group of people I went and talked to out in New York, we really like the partnership, we like the community, we like the startup community that Startup Health has brought together, and all of the various partners in the healthcare community, the health plans, the health networks that Startup Health represents. It's all been a fantastic group of people and kind of a conglomerate of individuals and businesses that have helped us all along the way.
Awesome, awesome. Well, I think that's all the time we have. I love the work that Vive Benefits is doing. It's just such important work to kind of give extend some hope to families that are struggling with healthcare costs.
Well, I really appreciate your time.
Yeah, I appreciate it. So I hope it's a fruitful next couple of days. All right, thanks for stopping by, okay? All right. So we are still broadcasting live from the Startup Health Festival. I'm Logan, and I am excited to invite into the studio our next guest, Kathy Cather, CEO of Parallel Profile. Welcome to the studio.
Thank you.
How are you doing today?
Doing well, thanks.
Is it the Startup Health Festival? Are you you having a good day so far?
It's wonderful and exhausting.
It's exhausting?
Yes.
It's the afternoon. We're pressing through.
Next year I'm going to take the 9 a.m.
All right.
Oh, sorry, I forgot the microphone.
It's all right. That's what happens in the 3 to 4 hour. We need some espressos here. So you are the CEO of Parallel Profile, and you're on a mission to address drug reactions in a smarter way, I understand, okay? Right. So in our interviews, we always pull back and start with the big why question, kind of what got you into this? And the way we talk about that is to talk about health moonshots. So what would you say is Parallel Profile's big health moonshot?
To end adverse drug reactions, they kill 128,000 people a year. Wow. That's 3 times as many people as die from breast cancer. Another 2.7 million are admitted inpatient to the hospital. That doesn't count all the ER visits where people are treated and left. So these are serious, harmful, often fatal episodes, and they come from people taking a properly prescribed drug that works for most of the people. And these side effects are rare, but it's still 128,000. It's still a lot of people, with the definition of rare, right?
How did you get into this? Why are medication errors important to you?
Well, I've been in quality improvement in healthcare for my entire career. I've been aware of them for 20 years. Used to report to the board on them every month.
So you've seen the numbers.
I've seen the numbers over the years, and then it started happening to people I love. And there were 3 strikes. The first one was my husband.
Oh wow.
He was rushed from the ER into ICU. They told me to call my children and have them come say goodbye to their father.
Wow.
Because of my background, I started pulling his chart and doing this stuff, and I said, oh, take him off this drug.
Wow.
Take him off this drug, this is what it is. And the surgeon said to me, I've been prescribing that drug for 12 years and I've never seen an adverse drug reaction to this drug. It's not this drug. And I said, well, you're not seeing it this time.
Yeah.
So who knows how many other times.
Yeah.
Against doctor's orders, I took him off the drug, and I had to sign paperwork to do that legally and all that. And 72 hours later, he was released, and that was 10 years ago.
Wow.
6 months after that, my mother was put into a coma by another drug, which, according to a Mayo Medco study, is common.
Okay.
And over 20% of people who are taking the drug don't metabolize it normally. She was among them.
Okay.
And then the third strike was my friend who died.
Oh, wow.
So I went.
You've seen it.
Saved 2, lost 1.
Yeah.
And I went, this is a lot more often than I thought.
Yeah.
So I started looking into it. I saw the numbers. I saw the 220 billion.
Yeah.
I saw the number of people who are affected that were actively working.
Yeah.
My area of expertise is employer benefit programs.
Okay.
I knew that if I went to my former clients and said, what do you think about this? We can save you billions.
Yeah.
That they would be interested. I was right. They are. They're very interested. So what we're doing now is we're integrating with PBMs, and instead of you having a formulary that says, if you take Crestor, it's a $5 copay, but if you want Lipitor, it's a $25 copay. Instead of that being for everyone, your is a $5 for Crestor, but mine's a $5 copay for Lipitor because I don't want a financial disincentive to not take the right drug.
Okay.
So it happens at the pharmacy counter. It's what
You've
it's automatic.
incentivized taking the right drug.
Right.
Very smart. Very smart. Okay. What does the product look like right now? How would you describe kind of what you've built? You've told me kind of what it does, what the benefits of it are.
Yeah. It's online.
Yeah.
Anyone can order a parallel profile for a price, but if your employer offers it and you're eligible because you're on 4 more drugs, or you have enough, you're taking one of the 24 really dangerous drugs, or you're taking a really expensive drug. Sometimes.
So it sounds like it's kind of like the brain behind the system.
Right.
And you can offer that up.
And then each employee gets a promo code. So that it's totally private. Their employer doesn't know anything about their genetics. It's secure. They get the promo code. They put it in on the site. And then they get the results online. So anytime they're in the pharmacy or in the doctor's office, they can pick up their phone, type in the first 3 letters of the drug, click on it, and it'll tell them immediately whether it's red, yellow, green. Now first they have to do a genetic test. So they get a swab, and they just rub it on their cheek, send it back, and then in 2 weeks they have it for the rest of their life. They know what drugs are safe.
Interesting. How do you feel like, we've talked to a couple of entrepreneurs in the pharmacy tech space and just the role that personalization is playing in the way that drugs are changing. How is that going to change and make things like parallel profile even more important? How's that going to change what you're working on?
Well, it's really terrific because as soon as some of these designer precision drugs are out there, then you're going to be able to know and your doctor's going to know immediately. One of the things that happens, it's great to have that, but sometimes you need it now.
Yeah.
And to stop and wait 2 weeks while someone sequences your genes and come back and wait, and sometimes you're in the ER.
Yeah.
Sometimes you had an accident.
You need to know right now.
You need to know right now.
Yeah.
So you need to be prepared.
Exactly. Awesome. Well, I love what you're doing. That's all the time we have. Can't wait to see how Parallel Profiles expands in 2020 and the work that you're doing. So thank you for your awesome contributions. All right. Take care. Have a great festival. All right. Into the hot seat, I'm inviting Andrew Hoppin now, CEO and co-founder of Cover Us. Come on in, Andrew.
Thank you.
Hey, good to have you. How are you? You take that microphone, all right? Are you having a good Startup Health Festival?
I'm already a little bit overwhelmed, but it's a good problem to have.
All right.
All of the amazing people here.
All right, so you have Cover Us has built a smartphone app enabling consumers to augment their existing health records with real-world data, okay? We'll get into that, but first I want to know, what do you see as your company's audacious goal that you're shooting after? What's your health moonshot?
So our moonshot is cost to zero.
Yep.
We think that in America, where we spend more money per person on healthcare than any other wealthy country in the world, you shouldn't have to be wealthy in order to be healthy. And we're working on that.
Okay. So how are you going to get there?
So as you said, we help people find their data, connect it, make some simple consent choices about what their health data can be used for, and augment it with real-world data. Very specifically, we use that data to help you figure out how you can save money on healthcare, and even how you can earn money by participating in health research, all so that you can better fill financial gaps in your life and afford to be as healthy as you can be, engage better in incremental care.
You have my attention. Save money on healthcare. I think anybody in this room has felt the strain of healthcare costs. So consider me a standard consumer. Kind of walk me through what would my experience be of Cover Us?
So we're focused on people with chronic health issues. So
Okay.
about 160 million Americans that have one or more chronic diseases. About half of those people, maybe a little bit more, have some financial challenges that keep them from caring for themselves and their disease as well as they could. Our job is to help you, that person with a financial and a chronic health issue, to afford your care. We do that in a variety of ways. Your data may show us that, you know what, you qualify for a benefits program that you weren't aware of that can help cover the costs of food, that can help keep you healthy. We may find that you actually have a genetic phenotype that makes you a good fit for a research study you can actually get compensated to participate in. We may find that by going down the street for an x-ray rather than going to the place your doctor sent you, you can spend half as much on that x-ray.
And where are you feeding that information into?
So we do that all for you in a mobile app that you control.
For the consumer, not for the provider.
For the consumer. So we're not taking your data and selling it to a third party. We're not having somebody else then evaluate what's good for you and then they reach out to you through the health system. So it's all in your hands.
So I have diabetes. My employer or my insurer tells me to download Cover Us, the app, or do I just hear about it as a consumer?
Hear about it from us or through an array of partners that we have.
Direct to consumer.
It could involve it could involve your payer, it could involve your employer, it could involve your doctor, but really we're going mostly to communities of people that are actually already helping each other figure out how to manage their disease.
Interesting.
In our case, it's very much again about how you manage the cost issues associated with your disease, and that's primarily how we find people. So regardless of your doctor, your insurance company, or government, we get this insight and this power into your hands.
Yeah, so all of a sudden I have this kind of coach on my phone that's starting to give me some tips on how to be healthier, but primarily how to save money.
Exactly right.
Save
so we
money
might think
on
of
my
us
care.
as like your financial coach for your health.
Very nice. Okay, that's awesome. Is that nationwide? Is that U.S. only? Are you?
Yeah, so we're rolled out across the country, and we do this really chronic condition by chronic condition. We focused on gut health to date, so irritable bowel disease, irritable bowel syndrome, where there are a lot of things that don't happen in the doctor's office that matter if you're going to manage that condition. Your sleep, your stress, your diet, all those things. And so we're with you wherever you are in your life, whether you're in the healthcare system or not, with a gut health issue. We're next moving into endometriosis and a variety of women's health issues, and then ultimately into cardiac and even substance use disorders. In all these domains, we find that people are finding financial challenges to doing what they actually otherwise would like to do that can help them to be as healthy as they can be.
I mean, it seems the logic makes sense across all verticals. You know, I would like to have those tips about just about anything that I do to engage in the health system. I would want this kind of navigator, right? It has that kind of like a guide feel to it.
Yeah.
It's very cool.
Exactly right.
What are you most excited about coming into 2020? What are you looking forward to for the company?
Yeah, so we've just run a very successful pilot where we engage people at very low cost of finding and recruiting a cohort of people with gut health issues, and we demonstrated there's intense demand for this from patients. Now in 2020, we need to prove that the industry is willing to engage patients on their own terms with data that is in the patient's control and willing basically to provide financial incentives to do the things that I've described here. So if we do that, we'll have proven both sides of what we think of as really a two-sided marketplace. Patients, their data, and their consent about use of that data on the one hand, industry that wants to engage those patients on the other hand. We'll have a great 2020 if we can prove that out.
Where do you see this going? Like, if you look out 5 years, you look out 10 years in your particular market, if you succeed, what will the market look like? How will it look different for me and my family, other patients?
So this ultimately rolls up to improving outcomes, right? And so a lot of people at Startup Health Festival are doing that in ways that involve research and developing better drugs and better devices and providing better care. We're focused on this economic part because we think that's at least as important. So if everybody had the money that they needed to be as healthy as they could be and engaged as optimally as they could be in incremental healthcare, we'd have a much less expensive and much more effective health system. So if you project out 5 years, we think that 100 million Americans with financial issues and chronic health issues are going to be much healthier, and that the system is actually going to cost a lot less money to take care of those people. And that really pertains across any disease.
Yeah, so that cost to zero moonshot really is the entry point for a number of other major goals in health in terms of opening up access, obviously, improving outcomes. I mean, that sort of answers my next question, but you know, you're here at the Startup Health Festival. what do you get out of being at an event like this? Why is it important to be a part of a community like this?
So for us, we came from a background of mass market civic engagement, helping people find each other and help each other around things that are important in their life, often informed by data, politics, government, what have you, but we didn't come from healthcare, we didn't come from the health industry. So it's this massively complex, multi-trillion-dollar industry just in this country. It could have taken us a decade to get to the point where we had the relationships and the insights that we've gotten in just 1 year by being part of the Startup Health cohort. So it's all served up for us on a platter here. People from every aspect of this really complex industry who actually want to come talk to us as entrepreneurs. That's worth its weight in gold.
That's awesome. That's awesome. All right, that's all the time we have for now. So excited to have you into the Startup Health studio. I hope the rest of the festival is productive for you, and wish you the best in 2020.
Fantastic. Thank you so much.
All right. Thanks for joining me.
Appreciate your time.
All right. All right. I'm Logan Plaster, the host of Startup Health TV, and we're going to be back in just a minute with some more interviews with health transformers. Be right back. And we're back broadcasting live from the Startup Health Festival. I'm Logan Plaster, the editor of Startup Health magazine, and I couldn't be more excited to be bringing you into the festival, into the Startup Health studio to meet some of the top health entrepreneurs in the world. We are live streaming at startuphealth.com throughout the end of today and all day tomorrow, and I hope you'll come and join us. I am joined in Startup Health Studio right now with Alexandra Greenhill, Dr. Greenhill, founder and CEO and Chief Medical Officer of Care Team. And you're working to solve the problem of fragmentation of care, focusing on some really tough chronic diseases, I understand. So we'll get into all of that, but I want to start by really understanding what's that big, audacious health moonshot that you're shooting for? What's that big problem that you're solving?
Well, the biggest problem is the gap between what we can do for patients today and what happens for the average patient is getting worse as opposed to better.
Okay.
And so we know better what kind of interventions make them feel better and get better, but we don't implement it because it's not easy to remember everything that has to be done in order for the patient to have the optimal experience.
Okay, so things are fragmented. Things are confusing, okay? So you are stepping in here as a navigator, kind of bringing that together. So talk to me about the actual product. How is Care Team solving that problem?
So the average patient who has a chronic health issue has seven health issues across a possible 200 common ones. And so think about it, between genetics, lifestyle, smoking, exercise and other factors, if you have diabetes, you're likely to get renal failure or heart failure or cancer and other conditions.
Yeah.
And each one of them is massively complex. There's
Yeah.
so many tests, appointments, treatments that have to happen. And so our software essentially says, well, what if you actually had a clear plan of action that's personalized to you for each one of those diseases, but also combined across that tells you today, for your heart, do this, for your diabetes, do that. And it allows you as a patient to say, I need a tribe, I need a village of people to help me cope with this on the emotional level, on the logistical level, in sort of family members and friends that I choose to share this with who can step in and help.
That's interesting. You bring in the element of incorporating your village or tribe. What does that look like? How do you coordinate care with average people in your life, your family, your neighbors? What does that look like?
Well, that's where technology has to step in because without it, it's just too difficult. And I've now been in practice for 20 years and very little has changed for the patient in that amount of time. But we can book our trips and order food and online banking. And so it's time to make it possible for people to do that on their own, but backed through the medical system telling them what should be happening and then letting them have the freedom of choice as to who gets involved.
Very nice.
But we've made healthcare into a team sport. It's time to make patient care a team sport too.
Interesting. What does it look like if I'm using the platform and I've got a neighbor that I'd want to bring into my care team? I want to, bring it all together into one platform. What does that look like in practice? Because that's kind of a foreign concept for me.
Well, it is, but right now people are doing it. They're using email, WhatsApp, Facebook.
Okay.
None of them are privacy enabled or compliant. And so through our software, the medical team gives you instructions. And then you decide as to, my brother and my siblings and my parents can have access to everything. They can see my entire story. But for the neighbor, I just want to tell them, can you please feed my cat while I'm away in the hospital or pick up grandma
And you can do that on the
drive her-
platform. You can get your neighbor involved in basic
But decide how
care.
much access they get to your medical history because it's yours, it's private.
Interesting. What kinds of chronic diseases is this particularly useful for, or have you seen success in?
So startup health means we're still a startup, so
Yep,
getting
yep.
going. And so far we've done dementia, heart failure, multiple sclerosis, epilepsy, diabetes, cancer, and eating disorders. And the platform's flexible and works across all of those. But essentially, anything that, for 6 to 12 months or longer, essentially massively impacts your life, gets better through collaboration, coordination, communication, because the plan always changes, but it's important to have a plan.
Got it. No, that makes perfect sense. So talk to me about kind of where you're at right now, what you're looking forward to in 2020. What should we be looking to see from Care Team?
Oh, it's exciting because in the healthcare system, everyone knows care pathways work. And right now they're done analog. They're done by hand, by case managers, by nurses. And we're helping digitize that experience. And it's really fascinating to see proactive clinical systems and decision makers saying, yes, we want this. And so we're now starting to work with some of the best organizations across Canada and the US, Sweden, England, and others, saying that it doesn't matter how the healthcare system is structured and who pays, the problem's still the same. We have many new options to offer, good news. However, they're not coordinated, bad news, and therefore some patients end up with gaps and overlaps. And so look for announcements from us about I'll give you a preview, addictions and ending addictions, which to me would be very exciting because so many people suffer from that.
And need their tribe around them, need their family and the connections to help get them through it.
Well, we know social determinants of health matter, but we haven't been able to do anything about it.
Alexandra, Dr. Greenhill, thank you for your time. I hope the next couple of days is fruitful for you, and thanks for coming to the Startup Health studio.
Thank you for the invitation.
Have a wonderful time. All right. Again, we are live streaming on StartUpHealth.com. We're at the Startup Health Festival in San Francisco, and I would like to invite to the hot seat here, Nick Adkins. Come on down, Nick. Here you go. All right. All right.
This off later.
You can't.
But during this segment, come on.
All right. Fair enough.
I'm gonna tag you with this.
Nick Adkins is the co-founder, not the founder, co-founder of Pink Socks Life. Anybody in digital health knows about Pink Socks as kind of a movement, kind of a philosophy even. So. This is an opportunity for you to kind of explain to the people who don't know kind of what that is and kind of how Pink Socks went from just an idea to actually being a company.
Right, well.
What's it all about?
Yeah, so it's
glad to have you here, by the way.
Logan, I'm glad to be here. Thank you, it's good to see you again. It all started by accident. In 2015, we started giving away some Pink Socks at HIMSS in Chicago that year. And had no idea that here, almost 5 years later, it was going to become a global...
Knee-high pink socks with mustaches
yeah,
on them. Yes,
that's right.
To be specific.
The OGs, the original gangster socks, were just pink with the mustaches. And then I did this TEDx talk in San Francisco in 2017. Added the piece of the additional piece with a puzzle piece that represented the power of connection. Pink socks connecting people all around the world. And after that TED talk, it really took off and became this global movement, which is now over 100,000 people all around the world that are really just focused on spreading love and kindness through authentic connection, using Pink Socks or the sticker or the pin or something to be a catalyst for someone to say, hey, it's good to see you, what's your name? Just as a conversation piece.
Why do you feel like that's so important in health innovation?
Right, well, not just health innovation, but in all of life. But when we talk about health innovation, digital technology, I mean, we're swimming in connectivity. We're drowning in connectivity, but what we're missing is authentic connection. There's a difference between connectivity and connection. And so the Pink Socks movement is an opportunity for you to have an authentic connection with someone one-on-one, at the end of one, right? So think about this. The Pink Socks tribe around the world, just for simple math, if we say there's 100,000 people today that can do what you and I are doing right now, having an authentic connection, saying it's good to see you, having this conversation, feeling what each of us is saying and experiencing in this now. If each of us can do that one time today, 2 times with somebody, 3, 4, 5, if we can 10, 20, 50 connections online at the grocery store or the post office, on the BART, on a plane, on a train, what? The exponential ripple effect of goodness that can throw around the world by just having these simple, authentic connections. Now think about that. Can you scale that using technology? Absolutely. But if we fail to have these connections right now, it doesn't really matter how much money we throw at this thing, what cool technology we invent. If we fail to get this piece right here, we've missed it all. And so there's so many awesome companies in the Startup Health portfolio and the family here of things that are being able to scale this kind of human connection using technology. That's really what it's all about. And so kudos to Startup Health and and all the great entrepreneurs that are exploring their passions, and you guys are giving them opportunity to thrive, so it's good.
So you've been around, you've seen who's presenting at JP Morgan and at various conferences. What gets you excited in terms of which companies are tapping into this kind of authenticity, this kind of patient focus, this kind of human-to-human interaction? Who gets you excited?
Okay, so disclaimer, I'm on the advisory board for Cloudbreak Health, which is
in the startup trends too.
Yeah, but I love telemedicine. I'm a big fan of telemedicine.
Yeah,
I was a co-founder of a company that created some really cool technology for asynchronous video file management telemedicine. So I'm kind of biased toward telemedicine, and like I say, Jamie Edwards and the Cloudbreak folks,
I think we originally met at the ATA.
Yeah, right. What's so cool about telemedicine is it's still that physical connection, right? Visual. It's I see you. It's humanizing healthcare. Where a lot of times, you miss that connection because it's data running in the background. You're missing a conversation. So I can't believe that we're still talking about telemedicine being a new technology, right? Because it's just the way, and it's fascinating to see how fast medicine is changing because we're changing it. The users are changing it. So it's nice. It's nice to see that the systems are catching up with how people want to interact with the system.
Yeah.
So,
last question. Yeah. You embody the brand in terms of having that authentic interaction. When you gave me a pair of pink socks, you explained it. How do you keep that ethos as it gets so big and global? And this kind of applies to other startups. You care about something so deeply, and yet you want it to scale. How have you thought through how to keep that core at the center?
Yeah, because it's all about, it's not about me, it's not about you, it's about us.
Yeah.
And people say, well, what really is the message? What is it about?
Yeah.
Well, it's a paradox. The Pink Socks movement is made of multiple missions. It's not about any one thing.
Yeah.
It's a celebration of all kinds of different things that are happening around the world, whether it's organizations that are working on Alzheimer's or dementia care or cancer or patient engagement, digital health, technology, quality, feeding the homeless in San Diego, feeding hungry children in Chapel Hill, North Carolina, and on and on and on.
Yeah.
It's not about any one thing. It's a celebration of all of us. And so Logan, you and I spend a lot of time on social media, right? Who doesn't? Whether it's Twitter, Facebook, LinkedIn, you name it. All of those are opportunities to say, hey, look at me, look at me, look at me.
Yeah.
The Pink Socks movement is an opportunity for you, and we invite you to use the hashtag Pink Socks, always one word, always plural. We invite you to use that hashtag, wear the socks, wear the pin, and let us celebrate you. It's an opportunity to say, instead of saying, hey, look at me, look at what she's doing today. Look at what he's doing today. Look at the good they're doing in their community today. Let's be your cheerleader. Let's bring this tribe of over 100,000 people around the world to be your cheerleader today and celebrate what you're doing.
Awesome.
And so it's the power of connection in that, to say that we're all in this together.
Sure.
It helps keep it growing.
Yeah.
Absolutely. So it's good to see you and see the good things you're doing.
Yeah. Nick, thanks for coming by. It's all the time we got.
Yeah.
But keep spreading the love.
We're gonna get a hug.
All right. Keep spreading the love. And keep spreading those authentic connections. All right.
Good to see you, man.
All right. Take care. All right. We are excited to bring on our next health transformer, Tanya Yarkoni, the Chief Product Officer and co-founder of Resilient. Come on in, Tanya. Hi. Here's your microphone. Yeah. How's the Startup Health Festival going for you?
Oh, it's my first. It's extremely exciting.
Very nice, very nice. So you are with Resilient. You're a tech-enabled support service working with patients with dementia.
Right.
Which is very exciting, and we'll get into all of that, how that works. But first, let's start with Resilient's Health Moonshot. What's that big, audacious goal you're shooting for at Resilient?
So our focus is actually on the family caregiver.
Okay.
And our goal is to ensure that chronically ill people are taken care of at home by supported caregivers with a home-based care system. That would be our moonshot.
So you're caring for the caregivers.
Correct.
Very interesting.
Yeah, our whole focus is if the caregiver's not in good shape, they're not going to be able to do their job well as a caregiver and take care of the person who has obviously needs that care.
Right. So you're helping the caregivers remain resilient.
Right. And it's assumed at this point in time that they know how to do this. Yeah. But the reality is it's a very challenging journey.
Yeah.
And actually, if we were looking philosophically at challenge, which is really what this is about, we want to make people understand that challenge could actually be an opportunity to fulfill and reach actually even a level of happiness, dare I say it. So we live in a world today where trauma and challenge is perceived as an anomaly, when in fact we live in a world where nearly everyone faces one form of challenge or another. And why aren't we given the tools and the mindset to look at this in a very different way? And why is it only perceived as something bad? And why do we avoid everything that is hard when we know that those things actually can be pivotal for change in a very positive way?
Yeah, can actually be the thing in your life that causes you to shift or to grow.
Well, that's what happened to me.
Okay.
I'm a family caregiver. I have a child who has special needs. And I went on that journey and sort of after a few years sort of saw that I wasn't coping well, and at that point was wondering, is miserable now my new normal? And that didn't make sense, so I went on my own journey to sort of find a new way, came out of that and then learned and saw I'm happier now than I ever was, and that's not what I was told, or that's certainly not what I expected. How can I actually help other people experience that and change their mindset? So that's really where it all came from.
Wow. Okay, so tell me now, let's talk about the product itself.
Yeah.
How do you do that? Because that's a big ask.
So we're actually doing a behavior change coaching methodology that uses an actual human coach. We have metrics that assess the caregiver through self-reported metrics that they actually provide data about themselves that enable us to see whether a caregiver is reaching what we call role overload. And role overload, we view caregiving, it's a role like any other role, and we want you to understand that this is a role, and what happens with caregiving is that it's very frequently perceived as, which it is, something very personal and also emotional.
Yeah.
And caregiving doesn't have any boundaries, it's very unpredictable and chaotic, and we want to help you stay on track, actually, so that your whole life doesn't fall apart, and maintain your work-life balance and not burn out.
Yeah, it's seen more as a burden than a role, really.
Right.
Interesting.
And so, if I was to say to you, you're about to now have to take care of someone for the next 10 years who's going to become progressively more ill, what do you need actually to do that job well?
Yeah.
I'm sure you'd have some answers.
So what's the thing in 2020 that you're most excited about for
Our
resilience?
pilot, it's going live. We're starting to test with caregivers.
When's it going live?
Next month.
Next month.
Yeah.
Congratulations.
Thank you. It's a huge achievement.
Yes, awesome.
Yeah, very excited about that.
All right.
Yeah.
And then beyond that, what's the benchmark that you're hoping to hit for the year?
So, our main focus will be on engagement with the caregivers.
Okay.
That's absolutely where that's a critical piece for us. And then, of course, receiving actual outcomes and improving quality of life, enabling them to be more productive in the workforce, enabling them to take care of the patient in the home longer.
Awesome.
Those are sort of outcomes that we'll be looking for.
Awesome, Tanya. Well, thanks for coming by. It's the time we have. Thanks for the work that you're doing, and have a great afternoon. All right. All right, my next guest is Bill Nordmark, CEO of Aver.
Logan.
Hey,
nice
good to have you, Bill. Excited to have you in the Startup Health studio.
Absolutely, thank you for having us.
I'm looking forward to learning more about what Aver is doing. I learned that you just announced a Series C close on Thursday. Congratulations.
We did. Thank you very much. It's very exciting. So last Thursday, we announced a Series C, $27 million round.
Congratulations.
Led by Cox Enterprises, new investor to the market. Okay. So we're starting 2020 with a bang.
Awesome. Well, we'll get into a minute of what you're building and kind of what you're going to spend that money on.
Yep.
But first, let's pull back and talk about what's the big problem, what's the health moonshot that you're aiming after?
So the market's got to move to value-based care. We've got to move out of the historical fee-for-service model. So Aver, the origins of the company are to build the platform for the future for value-based care, bundle payments. So our big moonshot is to design, implement, administer for health plans and really deliver on the promise of this value-based movement.
Okay. A lot of people trying to deliver on that and struggling. Yeah. So kind of what is it that you're building that is going to, I don't know, that's going to deliver on that?
So we have a tech-enabled service.
Okay.
And our secret sauce is basically we realize that the market has to be met where they are today.
Yeah.
Too much innovation is done with changing business processes. And we know this is healthcare.
Yeah.
These are payers. They move slow. The market adopts slow. So you got to meet them where they're at. And in meeting them where they're at, you actually take an evolutional movement towards getting them to where they need to be.
Okay.
And so our secret sauce is to build a tech-enabled service. We're scaling that with the dollars we just raised, operationalizing, helping payers design the programs, helping them implement the programs, and then administer the programs in a way that helps guide them to where they need to be.
Okay. Tech-enabled service. Break it down for me. Like I have no idea what the platform is.
So the platform has 3 components. We're an analytics business, so we're taking historical data to analyze historical claims data to determine where payers need to focus in value-based programs, which providers, which types of episodes, which programs are the low-hanging fruit and ideal areas.
Nice.
And then we have a network team that helps payers go out and actually implement it with doctors. So we're sitting at the table, negotiating contracts, negotiating the network, negotiating the prices. And then finally, the service part of it is, a platform that helps administer the claims. So we all know the market's not ready for value-based payments. We've optimized for real-time adjudication and fee-for-service. And so our platform actually bolts on to what they're doing today to help them process those claims in a value-based payment model.
Got it, but you would describe it as sort of a bridge technology.
Bridge technology to get them where they need to go, and then the innovation can start when they have a new platform to enable all of these programs working.
How long of a runway do you see that as being? When you're being optimistic, where do you see value-based care kind of coming into its own?
The inflection point is now.
Okay.
If you look at where employers are asking for significant cost reductions. Our platform's saving payers anywhere between 20 and 30% in medical spend today.
Okay.
So over the next 18 months, you're going to see the inflection point rise now.
And you're positioned, obviously, with this raise to sort of take advantage of that or be on that wave?
So we're very well positioned. Awesome. So the dollars are going to go to help our payers scale, to help our business scale, to advance and accelerate the market. And in 2020, now it's all about execution and helping those payers make the jump so that they start delivering on the value-based promise.
Nice. Okay. Well, very excited to hear about the raise. Congratulations again.
Thank you.
Excited to see where AVR goes in 2020.
Thank you very much.
And just the work that you're doing in value-based care is incredibly important. So thank you, and thanks for stopping by the studio.
Appreciate it. Thanks so much.
All right. Have a great afternoon. All right, we are still live streaming at StartUpHealth.com. I'm Logan, editor of StartUp Health magazine, and excited to have you with us this afternoon. And we're going to be live streaming more interviews tomorrow, so log in at 9 a.m. Pacific as we kick it off. But I'm excited to invite in my next interviewee. Is going to be Brand Newland, CEO of Goldfinch Health. Brand, great to have you. Take a seat, and we will talk about Goldfinch, which is on a mission to reduce opioid use by improving how people utilize surgery. I understand. Okay.
Yeah.
So we'll get into that in a minute. But tell me, let's start by pulling back and let's talk about kind of the big picture problem that you wanted to address when you started Goldfinch.
Yeah, the big picture problem we're looking to address is more informed decisions by patients as they prepare for surgery in order to get back to their lives sooner. Ultimately, that's what we're trying to solve, is how can we help people get back to their lives and back to work sooner when they go into surgery.
How big of a problem is people making poor decisions around surgery?
Well, as it relates to the opioid side of things, which is our moonshot to end addiction and opioid addiction, surgery is the #1 gateway to opioid use. 90% of patients come out of a surgery with a prescription for an opioid. 75% of them end up using it, and it's just way too much. In the year 2020, that doesn't have to be the way that we go through surgery.
So you went way upstream in terms of tackling the moonshot for ending addiction, the opioid crisis. You went all the way up to to surgery,
Yeah.
when a lot of treatments are looking at recovery, which I think is really interesting.
Yeah, we were really inspired by the opportunity to do something proactive. There are a lot of good solutions out there that are much needed in the opioid epidemic. Things to reduce access to opioids, increase access to the rescue medications, increase access to counseling. But at that point, the toothpaste is sort of out of the tube, and it's hard to get back in, right? Unfortunately. So what if you could change the underlying pain of surgery, and thus change the need for pain medications, including opioids, and that's what we're working on.
And how do you reduce the underlying pain of surgeries?
Yeah, well, one of the things, really the foundation for what we're working on is what's known as enhanced recovery after surgery, which has about 15 years of support in the clinical evidence to show that there's a patient-centric, clinically validated way to go through surgery. Things like, what if you could get ahead of the pain before surgery by using 2 or 3 non-opioid pain medications and use regional pain blocks and a number of other techniques to reduce the pain overall and thus the need for opioids after the fact.
Yeah. I feel like this would be really welcomed by the physician community. What's been the reception among surgeons?
Mostly positive.
Mostly? Okay.
Mostly positive.
But you're rocking the boat a little bit.
There is a little bit of rocking the boat, which is when we, my co-founder John and I, decided to take on this challenge, we saw the need for a new standard in surgery. And one of the things we could have done is gone to the providers and provided consultation and try to help them with implementing these protocols. Yeah. But what we ultimately decided was needed was, let's change the understanding for a better way through surgery, the demand for a better way through surgery. Let's go to the payer market and sort of bring the providers along with that.
Got it. Okay, so here we are at the end of 2019, beginning of 2020. Yeah. What are you most excited about for Goldfinch in 2020?
Well, we have the first batch of results from our pilot, which is very exciting. In our first batch of results, we're seeing on average patients saving 34 days per patient in recovery time. So about a month sooner, folks are able to get back to their normal lives, be it work, be it walking their dog, be it going to their kids' soccer games, whatever that is, they're back a month earlier. We're also seeing that the status quo is 75% of patients, as I mentioned, use an opioid after surgery. In our study, 75% of patients don't use an opioid at all after surgery. So great results. What we see coming for 2020 is building on those results in our pilot. We see growing our program through self-insured employers in the payer market. And we see expanding our national network of physicians who've adopted these protocols.
Very nice. Well, Brand, I love what you guys are doing. I love that you're moving up the stream. I know that within Startup Health, there's a range of companies addressing the opioid crisis, but at different points in the patient journey, and how critical it is to collaborate across that spectrum. I know you're part of the opioid crisis working group within Startup Health, and it goes all the way from pre-surgery to recovery, and it's a wonderful thing.
That's
so love to see what you're doing, and thanks for stopping by the studio.
Thanks, Logan.
Hope it's a productive couple days for you, and keep doing the great work you're doing.
Thank you very much.
All right, Brand. Have a good afternoon. All right. We are at the Startup Health Festival in the Startup Health studio, interviewing some of the top health entrepreneurs in the world, and just excited to be learning about what they're building and sharing with you some of their motivations, their health moonshots, kind of what makes them tick. So I am excited to be welcoming up to the hot seat Muhammad Ali, CEO and founder of MyRx 365. Muhammad, good to meet you. Great to have you, and I can't wait to learn more about MyRx 365 and what you're building. Okay. If you heard the last interview, you might know that we at Startup Health, we like to start by pulling back, by talking about the big motivations behind the startups. So what would you say is the health moonshot, the big audacious goal that MyRx 365 is going after?
Well, first off, thank you for having me. Our moonshot is basically to increase patient medication adherence. Right? And the reason why we're doing this is that at the end of the day, the more adherent you are to your medications, the healthier you'll become, and you'll stay compliant on your care plan. And so our goal is that.
Okay. How big of a problem is that?
It's surprising. It's a really big problem. Non-adherence is about $300 billion annually, is the cost to the healthcare system. Great. So I mean, if we can even change that, even bring it down by 10%, it's $30 billion a year which you're saving.
It's massive. It's massive. Okay, so what's your tack? What is your angle on improving medication adherence? Because I feel like I've heard a number of different startups, even just today, talk about some piece of that puzzle. So
Correct.
Yeah.
So we are a digital pharmacy, and what we do is we provide all the similar tools which other pharmacies do. The standard, you can transfer your medications, see your meds, get delivery, so on and so forth. But what makes us unique is that we actually integrate with medical records. We integrate with wearables, health apps, any form of data which is out there related to you. And we give the patient ownership of those records and really aggregate them together. And if the patient wishes, they can have their providers or their physicians or family members be part of their care plan. And so what that eventually does is it forms a unique data set which no one has, which is a 360-degree view of the patient's health. Right now, if you go to the doctor's office, all he knows is what you tell him or your blood work tells him for those 10-15 minutes. He doesn't know what you're doing for the other 90 days after you left the doctor's office. So imagine if he can be proactive and get involved in your care 10 days after rather than 90 days. So we're doing something which is unique.
Yeah. Okay, so there's the personal data component, the wearables component, and then how does that integrate with the pharmacy tech that you mentioned?
So the way that it integrates with the tech is that now you have a record of your medications, your health apps, your lab work, your medical records, and it's all in one place. And so as you're connected with your providers, with your family members if you wish to have them, there's a social component to it as well. And the physicians can be involved when they see that, for example, if your medical records said you should stop eating fatty foods, and now you are at a fast food restaurant from 12 to 1 every day, and Monday to Friday, there is a way to do an intervention to possibly change your behavior.
Okay.
Instead of waiting 90 days till the next visit.
This app sounded great until you said it was going to start telling me to eat better. No, I'm just kidding. I feel like so critical to have those daily interventions help us with habit change. Really interesting. So here we are at the dawn of 2020. What is it that you're most excited about for this next year?
So this next year is really huge for us. The reason for that is our new app is coming out by the end of the first quarter, I believe, February, March, we should have it out. We're also working with a number of transplant centers nationwide. We're getting pharmacy licenses nationwide as well. And there's a few strategic acquisitions which we're looking at. So it's going to be a banner year, hopefully.
Nice. Is this something that I can download, or is this something, are you selling into consumers or providers?
Yes, our marketing strategy is obviously to providers. We tell them about all the different tools that we offer for their patients, medication therapy management, patient engagement tools, integration, so on and so forth. But you as the patient will be able to download the app come the first quarter of 2020.
Awesome. All right, well, that's the time we have. Thanks for coming down to the TV studio.
Thank you very much.
And best of luck in 2020.
Thank you.
All right, take care. All right, we're still broadcasting live from the Startup Health Festival and introducing the world to some of the world's top health entrepreneurs. Next up is Lawrence Girard, CEO and co-founder of Fruit Street. Come on up, Lawrence. Good to have you into the Startup Health studio, and excited
Thanks
to
for
hear
having me.
what is the latest with Fruit Street. As you may have heard in the previous interview, we always start with the health moonshot question. So with Fruit Street, which you co-founded, what was that big audacious goal that you were going after, that big problem you're trying to solve?
Our goal is to really prevent hundreds of thousands or millions of cases of type 2 diabetes. We deliver the CDC's diabetes prevention program through telemedicine and live video conferencing with dietitians. So we take people with prediabetes and we really help them lose 5 to 7% of their weight to avoid developing type 2 diabetes. So we're really just about preventing hundreds of thousands and hopefully millions of cases of people from getting type 2 diabetes.
What drew you into the diabetes market?
Well, I was planning to go to medical school, and I was volunteering in an emergency room while taking a nutrition epidemiology course, and realized that not many people do those two things at the same time. And you just realize that a lot of chronic disease like diabetes, heart disease, stroke, it's really preventable through diet and lifestyle, and that's really what drove me to start the company.
Nice. Now I know that you have raised funds from practicing physicians. It's one of the things that's really innovative about Fruit Street. Maybe you can tell me a little bit about that motivation for that and kind of how that played out.
Yeah, we've raised capital from about 300 physicians, around $13 million, and we have no institutional investors. So the idea was that instead of being funded by a Silicon Valley venture capital firm, we wanted to make this more of a grassroots movement of physicians that wanted to have a social impact in public health using technology. And they're not only investors, we have an online advisory board using Basecamp where they're giving input, and this is something patients in their local communities or their own practices can benefit from. So we might have 1,000 physicians invest $50 million and have no institution and just be really grassroots.
How has that changed the way the company has developed, having that kind of grassroots base?
Yeah, I mean, you're getting constant feedback from the healthcare professionals on the front line who literally see patients with prediabetes every day. You know, venture capitalists can be helpful, but you know, they're sitting in spreadsheets all day. They're not in a healthcare setting where people are literally dying from diabetes, heart disease, prediabetes. So I post on this Basecamp forum 5 times a week, and I'm getting, within a second, you know, feedback from 300 physicians.
It's amazing. Can you think of anything, any sort of prevention that you've put into the program that's come directly from sort of like real-world physician experience? Maybe something that you would have done otherwise.
Yeah, let's think about that. Well, one of them suggested that we add a meal delivery component. So we're actually partnering with one of the leading plant-based meal delivery services because people sign up for diabetes prevention and they want to know what to eat. And so why not provide them with a dietitian approved and Fruit Street approved meal service right to their home.
Nice, nice. Okay, so here we are at the beginning of 2020, and something we're asking each entrepreneur is, what are you most excited about for the next year for Fruit Street?
Well, we have some large contracts with health plans. We'll probably be a covered benefit for about 1.8 million people by the end of 2020. So we're anticipating significant revenue growth, but more importantly, a large amount of people that we can impact and help them prevent diabetes. And we are also very, very excited about that plant-based meal delivery option because we think that that's one of the missing things from diabetes prevention programs is how do you actually get people healthy food to their home. So those are some of the things we're excited about.
Very nice, very nice. I love this, the fact that you thought differently about not just how to raise money, but you know, but just about how to create the kind of advisory team that you needed, you know, to create something almost democratic in terms of this broad base. As you know, the festival's theme is collaboration. I feel like you've embodied that in a really cool way, collaborating with just hundreds of physicians.
Yeah.
Yeah,
I think it's interesting. Sometimes even today, I'll meet with venture capitalists that say, "Oh, this would be so hard to get involved because you know there's so many physicians on the cap table," and then others love it. And public companies have thousands of shareholders, right?
Yeah.
And I think that the way to have a big social impact in healthcare is not necessarily by raising $100 million from one institution, but getting thousands of healthcare professionals being advocates for this in local communities, because at the end of the day, healthcare doesn't happen in spreadsheets, it happens in local communities around the whole country, and that's why we really like having this army of healthcare professionals promoting the product.
That's awesome. All right, Lawrence, that's all the time we've got. Thank you so much for stopping by the studio, and I hope it's an awesome couple days for you, okay?
Thank you.
All right, take care. All right, that is a wrap. That is day one of the Startup Health Festival, coming to you live from the Startup Health studio. We're going to be back tomorrow morning at 9 a.m. Pacific with probably about 50 more interviews with some of the top entrepreneurs here in this community and around the world. So we hope you'll join us, and we are just excited to have you along. So join us tomorrow. Take care.